Good morning. I'm at-large council member Anita Bonds, chairperson of the Committee on Executive Administration and Labor. The time is 9:13 a.m. on Monday, April 22nd, 2024. Happy Earth Day to everyone. We are meeting in council hearing room 412 and via Zoom to convene the committee's budget oversight hearing for the Department on Aging and Community Living and the Department of Human Resources. We were originally scheduled to also hear from the Department of Employment Services government witness today, but we had a delay on receiving responses to our questions, and so that hearing has been rescheduled to Wednesday, May 1. The purpose of today's hearing is to receive public and government witness testimony regarding the budgetary needs and expenditures of these agencies for FY24 and the proposed FY25. I'm asking that our witnesses keep their remarks to no more than 5 minutes to allow all witnesses the opportunity to be heard. And with that, I'd like to note that the entire written testimony that you present will be a part of the record as well. And if you have not submitted your written testimony, please email it to seal@dccouncil.gov, and that's CEAL@dccouncil.gov. Today, we're going to examine the agency's overall budgetary expenditures to date and plans for the proposed 2025 budget. Along the way, we will also identify areas of success and as well as areas for improvement. We'll begin by receiving public testimonies from the Department on the Department of Aging and Community Living, followed by our government witness, and then we will move on to the Department of Human Resources. At this time, I would like to recognize any of my colleagues that have joined in, and I see Ward 3 Council Member Matt Fruman. He is here, and so I'll give you an opportunity to make an opening statement if you care to, sir.
Thank you very much, Chairman Bonds. I had a little birdie come by to tell me that it might be your birthday today. Is that correct? Happy birthday to you. I don't have a formal opening statement. I mean, obviously, DACL is an incredibly important agency, and I want to do all I can to support the work of the agency and to support the prosperity and good health and quality of life for our seniors. So happy to be here today and look forward to the testimony.
Thank you. Thank you very much for joining us. Let me just speak very briefly about DACL, or the Department on Aging and Community Living. It started as the DC Office on Aging, and some of you may remember, I certainly remember when it was just the Office on Aging, and we advanced that's right, we advanced the proposition that, listen, all of us in the District of Columbia will be at a point where we can use services that are devoted directly to seniorhood. And so we said, now why is it that there is this little agency when we know the service needs are tremendous? And so it became the department. And it has been growing by leaps and bounds ever since. And I think those of us who are advancing into seniorhood are very, very delighted to have that. And so the Office on Aging became the Department on Aging and Community Living in March of 2019. But, you know, the Office on Aging has been around for a few decades. So, but here we are today, and today we're going to talk about the mission of the Department on Aging and Community Living, which consists of advocating planning, implementing, and monitoring programs in health, education, and social services for the elderly. Also, it's concerned with promoting longevity, independence, dignity, and choice for aged district residents and residents with disabilities, regardless of age, and their caregivers. It also is ensuring the rights of older adults and their families and preventing their abuse, neglect, and exploitation, and of course, leading efforts to strengthen service delivery and capacity by engaging community stakeholders and partners to leverage resources. DACL's total budget proposal for the upcoming fiscal year 25 is $64.5 million, which is operating dollars, but zero for capital. And we're going to talk a little bit about that today, I hope. What does this mean? It means that 0.5% or approximately 300,000 reduction in its total budget in comparison to its budget that we're currently experiencing, which is FY24, which was, 64.9, almost 65 million. So we want to talk about why dollars had to be removed from the proposed budget for the coming year. The variety of programs include community activities and events, nutrition and transportation services, health care and insurance counseling, Alzheimer's prevention, caregiver support resources, and adult protective services. Also, DACL's budget contributes to 29 other organizations that service the district's senior residents, including a network of 13 senior villages that are focused on addressing seniors remaining in their residence with services that promote their continued well-being. The district's senior population is substantial and continues to rise. In 2019, the district was home to approximately 85,000 older adults, and the population is expected to rise to as much as 25% by the year 2030. And I believe the current census data indicated that the population was over 100,000. So that's who the senior population is that this agency is working directly with. Because the FY25 annual budget is projected to have little, if any, growth in revenue enhancements, today's budget hearing is focused to provide information and direction on programs that are working and therefore should continue receiving vital funding. As we work through the tough coming budget year, I will be asking detailed questions for the agency to walk us through line by line so we can better understand the mayor's proposed budget and DACL's plan to retain quality service deliveries, assuring that our government makes the necessary investments in our seniors so that we can continue to live and thrive in our city, or as DACL's logo states, live boldly, is the goal set forth for today's hearing. And we'll begin first with our public witnesses on how DACL is serving the district's senior population. And then we will be followed by the director of the agency, Sharon Hines. And so now we will start with our first panel. And today we have approximately 50 witnesses that we expect to hear from. And our first panel, I believe they are here. Don Quattlebaum, the CEO of Seabury Resources for Aging. It is an organization that's been around in our community for decades, and proudly so. And then Dean Brunner, who is the chairman of the Alzheimer's Association. Saras Turner, Miss Senior, DC 2023. Lewis Davis, State Director of AARP. And I think that's about as, we can do 4 at the witness table and then we'll come back and get the rest. Thank you. Ms. Quattlebaum, you can begin when you're ready. And everyone, be sure to hit the mic. When it turns red, you're on.
Thank you very much. Good morning, Chairperson Bonds and members of the committee and staff. My name is Dawn Quattlebaum, and I am the Chief Executive Officer of Seabury Resources for Aging. Thank you very much for the opportunity to present this testimony as part of the FY25 budget oversight hearing on the District of Columbia's Department of Aging and Community Living, also known as DACL. Seabury is only days away from celebrating our 100th anniversary on May 16th as a nonprofit organization that provides personalized, affordable services and housing options to help older adults in the greater Washington, D.C. area live with independence and dignity. Seabury supports more than 6,000 older adults and family caregivers each year through comprehensive programming designed to help older adults keep safe, secure, and connected. We work to end housing and food insecurity and to mitigate the negative physical, emotional, and mental impacts of social isolation. Our long-term partnership with DACL makes a significant and positive difference for the older adults we serve. Thank you to Director Hines and her staff for their continued support, innovation, and funding. Through the Ward 5 and Ward 6 lead agencies that we manage, we implement programs via hyperlocal, community-driven strategies promoting social inclusion, healthy practices through direct services, and education that together aim to eliminate food insecurity and improve health outcomes. The support that is provided to Home First residences provides much needed affordable housing for vulnerable populations, including those who are formerly homeless. For many living at one of the 3 homes within Home First, no other option exists outside of sleeping on a park bench or underneath a bridge in DC. We are proud to manage the only halal-based community dining site in Washington, DC, where we provide nutritious meals to Muslim residents and help them have a sense of belonging as they age. Our volunteers and dining site manager have shared they are honored to serve their community at the Kabar dining site. Seabury's support of services for older adults is well summarized by Irene, who appreciated the yard work that was completed by a group of young college students through our Age in Place program and attending an education session on transportation. She especially liked the art classes she has been attending at Model Cities Senior Wellness Center. She shared, "I had so much fun discovering my inner artist. I made new friends, even though I know I am no Picasso." We are immensely proud of the successes we have had with the Out and About program that engages older LGBTQ adults, for which we support the development of a standalone dining site. We cannot ignore the unique and specific needs of LGBTQ older adults. Many of the Out and About program participants have shared their appreciation for the opportunities to make new connections through special outings, movie nights, and social events that are inclusive, welcoming, and instill a sense of pride. We have an obligation to create safe spaces where all residents can age as a community with a sense of belonging. Seabury's commitment for the last 100 years has been and continues to be reaching isolated DC older adults. Our expertise, trust, and capacity to support them is provided through funding from vital sources, such as DACL since 2009, as well as private donors, grants, and government entities. We urge the District of Columbia to continue funding programs and services to enable older adults to live independently in their homes and neighborhoods. We thank DACL for providing much-needed transportation, and we ask the district to avoid any funding cuts for programs serving older adults, as changing demographics will equate to larger demands for services with a workforce already stretched by a lack of resources and competing critical needs. It has been very beneficial to receive DACL sustainable funding, and we don't want to reverse the positive impact. We are not in a position to shoulder any budget cuts, and the impact will deeply be felt by older adults in the district. We believe the investment of ensuring older adults do not suffer from social isolation and food and housing insecurity is a valuable investment towards the community's future. We appreciate your continued support, Chairperson Bonds, and this committee as Seabury moves into its next 100 years, and look forward to our important work with the Council of the District of Columbia, the DC Department of Aging and Community Living, and all the partners we consider a part of our Seabury family and community. Thank you for allowing me to testify today.
Thank you very much for your testimony. Mr. Brenner?
Good morning, Chairperson Bonds and Councilmember Fruman. My name is Dean Brenner. As a volunteer, I chair the board of the Alzheimer's Association's local chapter. I'm the national treasurer of the Alzheimer's Association, and I was the caregiver for my mom who passed away from Alzheimer's in 2018. Like the two of you, she was a public official in her hometown, the first woman elected to her town's council in the history of the town in 1965. Recently, the Alzheimer's Association released new data on the Alzheimer's crisis in DC. As of 2020, over 15,000 people in DC who are age 65 or older had Alzheimer's, a more than 50% increase from the prior report. So if DC were a state, we'd have the highest percentage of people with Alzheimer's out of every state. And the same holds true among US counties. If you consider us a county, we have more prevalence of Alzheimer's on a percentage basis than any other county in the country. So DC is a major hotspot for Alzheimer's, and women, African Americans, and Hispanics are disproportionately affected by Alzheimer's. We need far more support for the thousands of DC residents living with Alzheimer's and their families. There's one gaping hole in the DC government when it comes to Alzheimer's. There is no employee within DACL or any other part of the DC government responsible for overseeing the care of people in DC with Alzheimer's and all other dementia across all 8 wards. No one is setting up cognitive screenings. No one is educating the public on the need for early diagnosis. No one is working in all 8 wards to make sure people who are living with Alzheimer's know about new treatment options. It's time to fill this gap. So I'm testifying today to urge this committee to create and provide $150,000 in funding to create a new position within DACL, a dementia care specialist. Several other states, including Maryland, have dementia care specialist programs, and it's time that we establish one in DC too. Now, the cost of this program, I said, is one employee, $150,000 in the coming year's budget out of a proposed budget for DACL of $64 million and out of a proposed budget for the district of $21 billion. So respectfully, we can afford to do this. A dementia care specialist would work all over DC to establish cognitive screenings, caregiver programs, and other outreach initiatives that engage individuals with dementia in regular exercise and social activities and promote independence, which helps ensure that people with Alzheimer's and other dementia can remain in their homes longer. The dementia care specialist would work in tandem with the dementia navigation program run under grants to Iona, which we completely support, which provides direct long-term support for families that are dealing with Alzheimer's. And in addition, the dementia care specialist would work closely with the dementia services coordinator in DC Health. That person is a policy specialist, getting grants from the CDC, establishing an overall plan for the public health crisis that Alzheimer's represents. And then finally, the dementia care specialist would work in conjunction with the many dementia-specific programs that there are in the district, the Club Memory Program run by Sibley and other important programs. We support continuing all those programs. It's just we need a single point of contact who's handling and leading the way for dementia care. The dementia care specialist would actually reduce the cost and burdens for the many thousands of families in DC dealing with Alzheimer's by as I mentioned, is ensuring that people can remain in their homes longer and most importantly, promoting early detection. Let me explain why that's so important. Recently, the FDA approved a drug called Leqembi, which slows the cognitive decline caused by Alzheimer's, but it can only be taken by people in a very early stage of Alzheimer's or even pre-Alzheimer's. So reaching as many DC residents and families as possible to alert them to the warning signs of Alzheimer's and to help them get a diagnosis for a loved one is now the difference between someone qualifying for treatment or not qualifying for treatment. So we need a dementia care specialist to spread the word all over DC about this new treatment and to help thousands of people get the care that they need. Thank you very, very much.
Thank you very much for your testimony. Ms. Turner?
Good morning, Chairperson Anita Barnes and committee members. I am Cerise Elaine Turner, Miss Senior District of Columbia 2023. In my roles as both Queen and DACL's Senior Ambassador, I represent and advocate for over 100,000 seniors, promoting technology training, scam and fraud prevention and protection, and raising awareness about artificial intelligence. The Miss Senior DC pageant is sponsored by the Honorable Mayor Muriel Bowser and the Department of Aging and Community Living, under the leadership of Director Sharon P.W. Hines. It is managed by the East of the River Strengthening Collaborative's Executive Director, Ms. May Best, with the support of the DC Seniors Cameo Club. The pageant offers women aged 60 and over a transformative opportunity, empowering them to become influential agents of change and role models within the senior community. It provides a platform for showcasing their experiences and perspectives, enabling them to inspire and uplift our seniors. Furthermore, DACL and its Ward 4 lead agency, Genevieve N. Johnson, provide programs and services that are lifelines for thousands of seniors across the District of Columbia. From dynamic senior wellness centers to vital initiatives like Safe at Home, DACL plays a pivotal role in enhancing the quality of life and independence of our senior population. However, the demand for DACL services continues to grow as our population ages. With an increasing number of seniors relying on DACL for support, it is crucial that we provide adequate funding to meet their evolving needs. By approving a budget that reflects the importance of supporting our seniors, we not only ensure their well-being, but also alleviate the strain on other social services and healthcare systems. Our seniors have spent a lifetime building our community. Let us unite to ensure that no senior is left behind. I would like to extend my gratitude to Director Sharon P.W. Hines, the dedicated DACL staff, and to you, Chairperson Anita Barnes, for your exemplary leadership and commitment to the welfare of our senior community. Thank you.
My goodness, thank you very much. Mr. Davis?
Good morning,
Good morning.
Chairperson Bonds, and again, happy birthday to you. And good morning to the committee. I am Louis Davis Jr., State Director for the AARP DC State Office. AARP DC appreciates the opportunity to provide written testimony in the budget oversight hearing for the Department of Aging and Community Living. The AARP DC State Office represents more than 78,000 members living in the District of Columbia through advocacy, outreach, and community engagement. Since August 2023, my office has been actively engaging adults 50 and older and their caregivers to learn of their key priorities for the district's FY25 budget. AARP's actions to date for this budget include completion of a community listening tour, deployment of a FY25 budget questionnaire to 14,000 AARP members, a survey of over 70 service providers, calls with DACL and staff, and engagement in the mayor's budget forums. Our office shared what it saw as priority FY25 senior budget needs through individual meetings and letters to DACL and the Mayor's Office of Budget and Performance Management. Regarding caregiving services, AARP DC supports the $669,000 that Mayor Bowser has proposed for caregiver supports. These funds will continue to support district residents with Alzheimer's disease and related dementia and Home Care Partners DC Caregiver Institute. According to AARP's Public Policy Institute, there are over 78,000 caregivers in the district. The proposed funds, if allocated directly to caregiver supports, will offset the financial and emotional burden to caregivers and avoid the adverse expense of institutionalization. We thank the mayor and DACL Director Hines and community advocates who worked together to close this year's current $100,000 budget gap for the DC Caregiver Institute. As a result, caregivers and clients continue receiving support to manage activities of daily living, 16 hours of monthly caregiving respite, and a $300 a month reimbursement for out-of-pocket caregiving expenses. The DC Council and its Committee of Executive Administration and Labor should defend the proposed $669,000 that the mayor has put in her budget. Regarding in-home services and home modifications, AARP supports the $750,000 the mayor returned to DACL's proposed FY25 budget to fund Safe at Home at $4.3 million. However, this funding will not fulfill the promise to expand the program as noted in the mayor's executive summary. AARP DC understands that Safe at Home, which provides in-home adaptation, received $920,000 in one-time additional funding in FY24. These funds successfully eliminated a backlog of eligible participants. However, these local dollars will have been cut in the mayor's budget. AARP DC understands the district's budget constraints. We are still concerned about this cut and the inevitable new backlog we anticipate from programmatic underfunding. While relatively expensive, Safe at Home is a cost savings still to the district. The median nursing home cost to the district exceeds $135,000 per year. Providing up to $7,000 per year to prevent falls is a common sense solution to prevent institutionalization. Additionally, the need and desire for in-home adaptations is a growing trend nationally and in the district. Regarding senior villages, during DACL's FY24 performance oversight hearing, DACL Director Sharon Hines committed to securing equal funding for all 13 senior villages. We applaud the upheld commitment to increase funding for senior villages, also known as DC villages. Senior villages are quickly proving to be an essential lifeline for older adults, and just like Safe at Home, is a cost savings to the district. AARP DC urges this committee and the council to support the additional $350,000 proposed in the mayor's budget for senior villages. Regarding Hispanic and Latino senior services, AARP DC is alarmed by the mayor's cuts to programs for Hispanic, Latino, older adult programming, while the needs for this culturally appropriate wraparound services for them has only grown. During DACL's 24 performance oversight hearing, Vida Senior Center Services reported a $60,000 cut in funds for their FY24 grant award. AARP DC urges this committee and the council to restore the $60,000 cut from Vida's FY24 budget. I should have to tell this committee of how triply marginalized this elder Latino population is by their age, by their language, and their small numbers. Lastly, AARP DC supports the sustained funding proposed for nutrition services, transportation, lead agencies, and case management. And I'd be remiss if we didn't lend support to our affiliate, Legal Counsel for the Elderly, for whom we support in legal services to meet the need, including a hotline operator and social work staff to meet the needs that they see in the District of Columbia. I look forward to answering any questions you may have. Thank you.
Thank you very much to the panel. We have been joined by another member of this important committee, Councilmember Trayon White from the great community of Ward 8. And we'll give you an opportunity to make an opening statement.
Yes, thank you, Councilmember Bonds, Councilmember Fruman, and those who have testified or will be testifying today. This is a very important hearing. I think that seniors are the foundation of our communities that keep us grounded and our beacons of light as we try to strive to create a better future for our young people. We can't create a strong future without having affinity and appreciation for the past and what you all have done to create foundations for us to even be, for me to even be a council member today. DACL serves as the backbone of support for rapidly growing senior population in DC, ensuring that our elders and our elderly residents can age with dignity, independence, and access to viable resources. See, we are joined today by Director Hines. I want to thank you for coming as well. I also see Sharon Wise was in the community giving access and resources about senior services in the community every day. Caring for the well-being of our seniors in Ward A is a top priority of mine, as well as my colleagues. I've been concerned about the decline for senior housing and upkeep availability in our various communities. It's critical that we ensure affordable, and I say affordable, I mean real affordable, low-level affordable and equity housing for our seniors. We are in the process of building 2 senior homes east of Anacostia River, but we have to do more across the city. Furthermore, we need to increase the number of available slots in our 50+ program with DOES. Currently, there were 25 slots. You know, the population of seniors are increasing throughout the district by the day. Happy birthday, Councilmember Bonds. But I think it's not nearly enough to address the needs of the population we serve. And so part of what I want to do is increase the number of slots for seniors who are on fixed income, that need extra money coming in that doesn't interfere with their Social Security money or their income they have currently. And so we want to use the budget to increase that. I know I talked to council member that talked to the chairman about it, and we're looking to do that in this budget. I'm pleased that the increase in funding the advocacy, elder rights, and assistance and referral of the $291,000 and the $553,000 respectively. The caregiver support service increased by $669,000. Delivery of meals, $689,000. However, I'm concerned about the $900,000 cuts in in-home services. And so I want to ask about that and figure out a way we can keep that accurate. Up to par. We are here because those who came before us paved the way, and we must not forget our seniors during this rough time, who stood here when DC wasn't popular, during the riots, during the crack epidemic. You guys stay here and fought for us to even have families here. So we appreciate you. We have to honor you with our budget. I was pleased to see the $83,000 increase for funding for learning and development services. And I'm interested in the discussion around restoration of funds towards the benefit operation services in the amount of $2,824 million from the zero in FY24. So I won't be able to be here the entire hearing, but I'll be listening in along with my staff. But I do want to say that we have to have equity and inclusion for seniors at the forefront of the work we're doing. I see seniors here from Congress Heights Senior Wellness Center as well as across the district. I know we're building a new senior wellness center in Ward 8, but we have to do more with this $20 billion budget. Again, thank you, Councilmember Bonds. Happy birthday, and may you be blessed with many more.
Thank you very much for your comments, and you are 100% correct. We are here about equity for our senior citizen community, meeting their needs. So thank you very much for that. I just have a very few questions of this panel because I know we have so many that would like to move forward, and I'm conscious of our senior population that came out this morning. I know that I have to clear the deck, so to speak, before noon so that you can go and enjoy your programming that you're customarily have an opportunity to do in the afternoon. So we'll move right along. But I did want to make sure that that Dawn gets to put on the record the anniversary date for your 100th year celebration.
Thank you so much for that opportunity. And first, let me say happy birthday to you on your special day and many more. We are proud to celebrate our 100th anniversary centennial celebration, May 16th, 2024, starting at 5:30 at the National Museum for Women in the Arts. And we have invited you and other council members. So I hope that you all will be able to attend as well as the community. It's going to be an exciting evening and certainly reaching this milestone. It's just a wonderful achievement for us. So thank you for that opportunity.
It is a wonderful achievement. I mean, 100 years, just think, and an organization. People live that long, but organizations, they seldom can survive. So big congratulations to you. And I'm sure that there will be some from today that will want to come. And is it open to the general public?
It is, and you can reach us at our website, seaburyresources.org.
All right.
Thank you so much.
Thank you very much. Mr. Brenner, I have your information as you indicated. You're estimating 150,000 for a Alzheimer's care specialist who will navigate us through the process. You presented some very important statistics that indicate the District of Columbia has the highest Alzheimer's population in the United States. And that means, if nothing else, we certainly should be giving it, more than ample attention. So thank you very much for that.
Thank you.
And Ms. Turner, thank you very much for telling us about the pageant. Can you give us a date and a location and tell us what we have to do to get to the pageant?
Oh, yes. Happy birthday, Chairperson Anita Barnes again. The pageant is on Saturday, June 15th at the University of the District of Columbia. Tickets should be ready for distribution within the next few weeks, I believe. I'm not sure, but it's June 15th at UDC.
All right. So everyone, I hope you've heard that. It's Ms. Senior DC, and we want to be there in force. It's an auditorium, so we can fill it up. We know how to do that. I'm hoping that we will come out because the winner of this pageant will represent us at the national. So it's like, the old days, the Miss America and Miss Universe, and well, we'll have our own version of it. And so I hope that you will come out. And thank you very much for representing us so graciously.
Thank you. Thank you so much.
Mr. Davis, I just wanted to make sure that I have the information that you shared about Safe at Home and the senior villages, the Latino program, and transportation. I'm sorry, I missed that. You were giving us some information about transportation, your concerns.
I didn't speak specifically about transportation, Councilmember Bonds. There were, in the budget that Vita Senior Center gets, there are certainly dollars in there they provide and to get funding from DACL. Their needs have increased for transportation services to provide for they service over 100 people nearly every day for wraparound services. We work with that organization, have for more than 17 years. And we're happy to, where we can, to collaborate to pull up the rear end where DACL falls a little short, because we see the importance of the programming there. So DACL does great work there with that Latino community. Their needs have increased, and we'd like to see that $60,000 plus put back. And some of that, it does include their abilities to move their seniors around to culturally appropriate activities.
All right. Thank you. Thank you for that clarification. I was wondering if you were speaking of the connector card, which, as you remember, was started by Seabury a few years ago. And I wondered if you were speaking to the need. I understand they have a tremendous wait list, and already they have easily spent all that they have and could spend twice as much.
I couldn't agree more. In our written testimony that we'll provide, happy to add where ARP stands on the connector card, which we
All right.
broadly support.
All right. And so as you were mentioning the Latino community, you are thinking that they need dedicated transportation because they collect people citywide to come to primarily one location, Vita Center.
You know it well. They do service the entire District of Columbia, and even they've had some clients who come from just outside. But they are moving seniors around from all the wards. They work with a very slim margin of error there, and the numbers and needs have increased as that population gets only older. And we try to supplement where we can with a number of our community partners, provide a little bit of money we can to assist where they have restricted dollars limited by DACL's statutory ability.
All right, well, thank you very much for that. Mr. Fruman, you have a few questions and then we'll turn to you. Councilmember.
Sure, just a few questions. Ms. Quattlebaum, great to see you. Thank you for your testimony. One of the things that you didn't talk about here, and maybe that it actually is covered in a different committee, but I am curious about, is how things are proceeding at Friendship Terrace and your plans for the improvements at Friendship Terrace. Can you
Thank
speak
you
to
so
that?
much for asking. Seabury at Friendship Terrace opened in 1970. Just to give you some background, we recently refinanced at the end of September, last September, and that was able to produce 125 project-based vouchers to make the community almost 100% even more affordable than it was before, in addition to HUD's 40 Section 8 units. With that equity, we are in the midst of a renovation and upgrade of common areas. We have replaced the roof. We have replaced the cooling tower. We are now in the midst of painting and doing things such as furniture. We'll be creating a new fitness center. And then we'll also be installing solar panels, and that's very exciting as well. And so we are moving along with that. All of that has to be completed by the end of September. And all of the council members and others will receive a grand opening and open house that we plan to have in October to celebrate this wonderful milestone.
Well, it's so great to hear that that is moving along well. Councilmember Fan White talked about the need for housing for our seniors. This is an incredible facility, has long been an incredible facility in Ward 3. Thank you for your work on that, and glad to hear the progress is positive. Mr. Brenner, and that $150,000 for a dementia care specialist seems like, you know, a critical need and a modest request. Are there arguments that can be made that that $150,000 would yield other savings in other parts of the government, because by doing this kind of preventive work that we can avoid unnecessary additional costs down the line?
I think that is certainly true, Councilmember Fruman, and thanks a lot for raising that. You know, one of the things today is that there are all these, there's no one person in charge of dementia care. There are a lot of disparate parts that are around the DC government that are kind of touching on little parts of it. And I think if it was all centralized in one person who had this mandate and to reach across all 8 wards, I think there would be cost savings. And by the way, just as a point of comparison, in terms of how modest the request is, when I said that Maryland recently established a dementia care program, the Maryland legislature appropriated $2.4 million, and they have dementia care specialists in every county across Maryland. You know, and their prevalence, while very high in PG County and Baltimore City, statewide, Maryland is not as prevalent. And that's a good thing, but they're not as prevalent as we are here in DC. So we do think centralizing dementia care within the mandate of one person leading the way would yield efficiencies and cost savings.
All right, great. That's very helpful. A different thing that you didn't talk about here, but you're relentless, and thank you for that, because it's an important issue, is I believe that you've spoken in the past about the need for a plan or regulations, and that, you know, that had advanced some, but not. Where are we on those issues that you've raised in other contexts?
Thanks so much again for raising that. Let me explain. So this relates to DC Health, and it relates to two different very important issues for Alzheimer's. So one is all 50 states in the country have a state plan for Alzheimer's, a comprehensive document with short, medium, long-term goals, and that pulls together all the stakeholders all over each state, the healthcare industry, the senior care industry, researchers, people involved in supporting caregivers. There's, a giant assortment of people that have to be, and entities that have to be pulled together. Here in DC, we don't have an Alzheimer's plan. We had one until 2019 when it expired. So for 5 years, as Alzheimer's is continuing to surge, we don't even have a plan. Now, DC Health has a dementia care coordinator, thanks to the council. And in the law establishing the coordinator, one of the coordinator's duties is updating our plan. And we work closely with the coordinator. She's a very good person. And she's prepared a draft plan that's just, not have been approved yet by senior management at DC Health. So I was told in January, actually the health committee was told at a public hearing, it would be issued in February. Here we are almost at the end of April. There still isn't a plan. So that's one issue. The second issue is training. So the council in 2020, after lobbying from the Alzheimer's Association and other stakeholders, passed a law that requires every direct care worker, every worker in the district who's interacting with people with Alzheimer's or another form of dementia to get at least 8 hours of initial training and to get continuing training as they go along. That law has still not been implemented. And there are 2 impediments to DC Health implementing the law. One is they have to issue regulations. I've heard for over a year now, the regulations are somehow drafted or they're being processed through DC Health, but we're not over the goal line with these regulations. And then the second issue is that DC Health wants to hire a consultant who would develop training materials. As an aside, the Alzheimer's Association, we're the leader in dementia training in the country, and we have training materials that are, available online, ready to go. But DC Health is doing a procurement, and the procurement is still not finished. So we have a law that the council passed in 2020 that's kind of just a symbolic piece of paper. Meanwhile, Alzheimer's is surging, and we know terrible things happen when the workers don't receive adequate training. So that's the status. Both of those lie within DC Health, but they're really urgent issues.
All right, well, thank you very much. And I guess all of them come together and we need to get in front of this and have a coordinated response. And that's critically important to a large number of our residents and their families. So thank you for your work on this.
Thanks.
Thank you for your testimony, Ms. Turner. Look forward to the pageant.
Thank you.
And Mr. Davis, I was struck by the modesty of the requests. I mean, in most of your testimony, you're talking about defending things that are in there as opposed to trying to reverse cuts. Am I right in interpreting your testimony that the one place that you are expressing a need for additional resources, not just defending resources that have been there, is in the setting of the services to Latino seniors?
Services for elder Latinos and Hispanics, and legal counsel for the elderly.
And legal counsel for the elderly.
For legal for LCs, we're talking under $210,000, $206,000 to support intake services and social workers for the demand that they're seeing.
All right. Well, thank you to all the members of the panel, and I will try to be in the spirit of Chairwoman Bonds, be brief so that we can work our way through all of our witnesses this morning. Thank you.
Thank you very much, Councilmember Trayon White.
Yes, as noted, I am concerned about the $920,000 cuts in in-home services. And I wanted to ask you, Director Davis, State Director Davis, the last I saw you was at Congress Heights Wellness Center. We had a nice event there that day. And one of the recurring things I heard from seniors was about trying to find housing. They are stuck in a place where they, don't have enough to move. And then when they do find a place, the place is not accommodating or meet their needs as far as their fixed income. I want to know, are you hearing this more as you communicate with our growing senior citizen population?
Short answer, Councilmember White, is yes. district seniors, district elders are very giving and compassionate people. So we hear sometimes that even when it's not for themselves, they're recognizing the needs of seniors that they know in their circles and other parts of the District of Columbia. Some seniors in DC are doing quite okay. But other seniors who are low, and that's right, there are high fixed incomes. We're not talking about people on high fixed incomes. We're talking about people on low fixed incomes. And so if they're in a fee simple home that they own outright, they're still seeing their taxes, their property taxes increase, even with the tremendous provisions that DC has in place that a lot of states don't, that bring some of those costs down and cap some of the property taxes. They're feeling the pinch from increasing property taxes. And then the cost of getting to and from and across town, but sometimes just getting to and from the first, second floor of their home that they're in.
Yeah.
Hence the importance of home modification programs like Safe at Home.
And thank you for that. And we want to figure out a way to use our dollars. One of the things I did, there was a lawsuit that when Carver Singh was Attorney General, instead of that money going into the general fund, we redirected that money through legislation to make senior living more affordable. And that was just in Ward 8, but we're looking to do that citywide and things like that. I'll talk to you more about that offline because I know that's a growing need in the city because DC is becoming too unaffordable. And I think about the unaffordability, I think about the food, right? The price of food is skyrocketing. And I was in my car driving two seniors. This was during the Christmas break. And one was getting $32 a month in food stamps, one was getting 34. That's almost $1 a day. And I began to become like emotional, like how is this? And so we exploring ways to put more money into seniors' pockets so they can, you know, live good in the city and not just be penny pinching or figuring out where to go. You talked about transportation. And last week I had a Zoom meeting with Empower Rides. And I'm glad I'm talking about it today because I want Councilmember Bonds to hear this. Councilmember Bonds. I had a meeting with Empower Rides because seniors are saying unless they're going to the doctor, they can't go anywhere to enjoy themselves. And so even sometimes they're being denied going to the senior wellness centers or the centers like you have across the city because of the restrictions. And so nothing's in stone with Empower Rides, but I hope to talk to Councilmember Bonds, Director Hines, and the mayor about how we can foster a feasible relationship with some of the business communities and use some of our power in the government to let seniors ride free. We have a youth ride free in the district, which is phenomenal. But seniors want to go places and have a good time, right? Y'all want to go places, enjoy yourself, and live a little, dance a little bit, enjoy yourself. We took some singers to the movies. They were just happy to get out. We've done that a few times in the last 30 days. And so anybody can answer this. What are your thoughts on transportation and travel for seniors? Are you hearing this, seeing this? And what's some of the barriers to doing that?
If I might, the ARPDC, AARP, our parent organization, provides what are called challenge grants once a year. I've been doing it for 7 years. In the District of Columbia, we've had more than a dozen winners over the last 7 years. So others might eat, won an award from us just last year to test the prowess of seniors to connect using their smartphones, the variety of services for transportation that the district provides. And when compared to other states, we do quite well with a wide variety of services. We just don't always do very well in helping persons who use those different services connect the two. It could not only make their lives easier to get around town, but save them dollars if they knew how to connect the different disparate services through one door, no wrong entry. That could be one way to bring down their daily living costs if we could make it easier for them to connect these services.
May I also add that I am very appreciative of DACL increasing funds for transportation. And we would like for that increase to continue into the next fiscal year and going forward. All of us benefit from proper transportation. So it's not just an age issue. So when you get older, you still need proper transportation in order to have a good quality of life. So I appreciate DACL and Dr. Hines and her staff for doing that, but certainly we need more dollars in this budget for transportation. Thank you for that opportunity to say that.
Yeah, thank you.
I would like to add that there's a senior whose car is disabled and she didn't have any other way to get around. So I take her, to get food, to meetings, to shopping. I know of other seniors who may have had, their own transportation, but could not afford to repair, that personal transportation. And so they reach out to, whoever, friends or relatives for rides. And, I know how frustrating it must be, but, I agree, they do need more support.
Thank you. And I'm glad did you want to add to that? You good?
Sure.
I didn't want to leave you out, that's all.
No, thanks. No, for people with Alzheimer's, of course, they need transportation everywhere, and it places an added burden on caregivers to figure out how to deal with the many challenging issues in taking care of someone with Alzheimer's.
Yeah, thank you. I know you talked about automobile repairs, but one of the other recurring things I'm hearing is those seniors who own houses needing repairs to their houses. Last week I was on a conference call. You okay? We got one over there. Let the church say amen. I was on the phone with Director Green, was talking to DHCD about their program to help seniors get those repairs done. And they do have we do have a program in the government, but it's a lot they requesting through taxes that people don't have. It's a lot of barriers, a lot of reading. And for those who don't have access to computers, it makes it more difficult. So I also want to work with Councilmember Bonds trying to remove some of those barriers because even when we was working with Al Malik Farrakhan with one of his locations, where he is, I guess the HVAC system was out and just trying to, and I was talking to Maria Powell who needed some assistance with something, and she's always trying to help other people. So like you said, if each one reach one, and if we know that, then we have to figure out how to make the government work for our most vulnerable residents. I have 2 minutes left, so I'll just say this. A few years ago, we changed over our healthcare plans. And there was a lot of disruption in services, some changeover in doctors, locations, and travel. I wanted to know, just from you guys' experience, are you seeing that things have leveled out, that things have been peaceful, people have getting services, getting to and from their doctors, or specialty services that you know of? I want to start with you, Director Davis.
I don't have that information in my pocket, but I will, my staff are here in the room and we'll let you know what we do know about that. It may be from our stakeholders that we work with. We'll
Yeah.
get information back to you.
I'll have to get back to you as well, but thank you for asking that because I wasn't aware of that change. But I can get back to you after talking with my staff. Thank you for asking.
So I'll just say, as I said in my testimony, Alzheimer's is a healthcare crisis in DC. We're the leading national hotspot across the whole country for Alzheimer's. And we don't have a comprehensive way for people to get tested. We don't have a comprehensive way for people to get the care that now, when my mom had Alzheimer's, the doctor, a very nice doctor, said, "Hey, I'm sorry, there's nothing that we can do." Now that's not the case, and we need a comprehensive way for people to get care. So thank you.
Council member, can I
Yeah.
take one more swing at that ball?
Sure.
Because there is one area that I would like for the committee to pay particular attention to, and that's the health disparities in the District of Columbia. In a city that's only 68 square miles across, there have to be a wide assortment of reasons. Historical, sure, but for things we're not doing correct today, to explain the gap in life expectancy of 12 years for people who live just east of the Anacostia River compared to those who live just west of the Anacostia River. And the district collects a lot of data. And in our findings in conversations last year with Chairman Henderson, the data doesn't make its way around. So we collect data, but we're not actually doing a whole lot with it to get at some of the underlying causes and remedies to help people live longer in the District of Columbia and live better.
Thank you. I'm over my time. I defer back to the chairman.
Thank you very much to this panel, and I think we're off to a roaring start. Thank you so much for pointing out issues I'm sure we're going to hear about through this day. We want to know, because if we don't have the information, we can't address it. And it's, I think every year we get better at our efforts to address the disparities that are facing our senior population. So thank you very much to this panel. Our next panel, John Bang, CEO of Iona, Andrew Ross, Director of the Alzheimer's Association, Kathleen Brisbane, Public Witness, and Stephanie Robinson from Model Cities. I think that's Model Cities Wellness Center. So.
I can begin, Chairperson Bonds.
All right, and you are?
I'm Andrew Ross. Good morning, everyone. Thank you, Chairperson Bonds, members of the committee. I am Andrew Ross, here representing the Alzheimer's Association as their Director of State Affairs and the over 15,000 residents across the district living with Alzheimer's and their family caregivers. I first want to thank you, Chairperson Bonds, and this committee for your continued leadership in making Alzheimer's a priority across the district, and also to thank Director Hines and her team at the Department of Aging and Community Living for their continued collaboration to assess how to best serve people living with dementia across the district. DACL has been a leader in their commitment to serve people with Alzheimer's and their family caregivers, and we have appreciated their partnership. As you heard from our volunteer and board member, Dean Brenner, I too am here today to urge your support of a $150,000 appropriation in order to establish a full-time dementia care specialist position at DACL and to maintain funding for the existing dementia programs that this committee oversees. We recognize the multiple competing priorities that you all are facing and the council is facing during this challenging budget cycle, but we can't lose sight of the tens of thousands of DC residents who are living with Alzheimer's or their family caregivers. The proposed dementia care specialist position would increase access to dementia-specific information and resources across the district so that families are not struggling to determine how to obtain a diagnosis or how they can access services. Now, you have my written testimony, and I'll make this brief, but I do want to highlight the specific functions of this proposed position and the urgent need. Trained dementia care specialist staff, in this case one position, would work with other agency staff and community partners to connect the public with information and services, to review benefits eligibility, to provide cognitive screenings, to deliver caregiver education, and help keep people living with dementia healthy and active so that they can stay at home as long as possible. Together, this can help to ensure people with dementia are able to remain at home, which subsequently reduces the cost of care for the entire family and DC Medicaid, getting to the important question, Councilmember Fruman, that you identified earlier. Now, we have seen success in similar dementia care specialist programs that have been established in Maryland, in Georgia, Indiana, and Wisconsin. And this position would also help to improve health equity, reducing the disparities across the district that exist in accessing the diagnosis and the newly approved treatments that Dean Brenner mentioned. Now, when families see changes in their loved one's cognition, many don't know where to turn. Obtaining a diagnosis can take upwards of 2 years, so many people just don't have a diagnosis, yet they still are living with this disease. As a result, the family may lack an understanding of what their loved one is facing and how to appropriately provide care for them, as a result, straining their own well-being. We know caregiving is extremely stressful, physically, emotionally, financially. Many caregivers burn out or have to leave the workforce. But DC is already a leader in providing many other resources to help families navigate the caregiving experience. DACL has Medicare and Medicaid assistance, caregiver education and respite. The senior wellness centers across the district are a wonderful hub for residents to build community and remain healthy. Partners like Iona, Sibley Memorial, the Genevieve Johnson Senior Daycare Center, all are committed to helping older adults across the district and people living with dementia to stay at home and stay healthy. And the association urges continued funding for those dementia-specific programs. Yet families still struggle to access resources and the full gamut of services. Now, the DC Council has taken a number of actions in recent years to prioritize the needs of this constituency, And I think it's helpful to see how services connect. So in my testimony, I included a diagram that highlights all the different DC dementia programs, how they intertwine. But importantly, this position, this dementia care specialist position, would serve as an initial point of contact for the public, where there's a gaping hole that makes this experience so challenging for families. We should also differentiate between the dementia coordinator in DC Health and the proposed dementia care specialist position. The coordinator in DC Health is responsible for executing awareness campaigns, coordinating the district state plan that Dean Brenner mentioned, making sure that we are able to receive federal funding, such as from the CDC, to further build out our public health work. The DACL dementia care specialist position, though, will interface directly with the public, helping them to access information and services. So I urge your support on this $150,000 appropriation and existing dementia funding, and welcome any questions that you may have. Thank you.
Thank you very much for your testimony. Next, we're going to turn to Mr. Bang from Iona House. Please proceed. Thank you.
Thank you. Good morning, Madam Chair Bonds, Councilmember Fruman, Councilmember White, and staff of the committee. And thank you for your commitment to DC's older adults and the aging community. I'm June Bang, CEO of Iona Senior Services. For almost 50 years, Iona has been a lifeline to older adults and caregivers across the district. Today, we serve older adults and their family caregivers across the city with our adult day health centers in Congress Heights in Ward 8 and Tenleytown in Ward 3. We provide citywide programs like Dementia Navigators and Money Management, along with 8 satellite locations to provide meals, engaging activities, social services, as well as a virtual platform for lifelong learning through around town DC to meet the diverse needs of our aging population. We help older adults with opportunities to age well and overcome food insecurity, loneliness, language barriers, homelessness, and provide care for individuals and their families impacted by dementia and other difficult challenges. Through our partnership with the DC Office on Aging and Community Living, Iona first became the Ward 3 Senior Service Lead Agency in 1982. 41 years later, in 2023, Iona was given the privilege of not only continuing our role as a Ward 3 Lead Agency, but becoming the new Ward 2 Senior Service Lead Agency as well. I am grateful for the partnership of Director Hines and the hardworking staff at DACL. In just 7 months, we have served over 30,000 meals to over 1,000 food insecure and often isolated older adults across wards 2 and 3 since October. We've expanded our services with the Oasis Drop-In Center to provide older adults experiencing homelessness with daily meals, education, and socialization opportunities while receiving support to find housing. Iona also now serves the Asian Pacific Islander older adults in the district living with language barriers through our API Senior Center. Each of the thousands of people we serve have incredible life stories, and we have been honored to walk with them on their life and aging journey. I want to share with you a story about Mr. Smith using a pseudonym to protect his identity. Almost 80 now, he immigrated to the US from the Middle East and made a new home in an apartment in Glover Park in 1981. Throughout the 4 decades, he met his wife, developed a community of lifelong friends, and like all of us, have traversed the good and the hard of life. When his wife was diagnosed with Parkinson's disease, he took on additional caregiver responsibilities as well. When you meet him, you can feel his zest for life. He carries a joyful spirit despite some of life's difficult challenges. What is also remarkable is that he lived in the same home in Glover Park for 40 years until last year when his apartment was severely damaged in a storm and became unlivable for months. He was on the verge of going to a shelter while trying to manage his declining health due to chronic conditions, until Iona's social worker began working with him to find health services and a new place to call home. Mr. Smith could have never navigated the application process, the signing of the lease, the move, find medical attention while navigating all aspects of this difficult life transition alone. Like Mr. Smith, more than 74% of the district's older adults are living alone, and many require continued care and support to age safely in their communities. I share Mr. Smith's story with you to highlight the important work of Iona social workers and case managers. As you already know, in fiscal year 22, the decision to remove funding for case management and home delivered meals from lead agencies resulted in a substantial decrease in lead agency grant budgets, which has a direct impact on our ability to provide the individualized support and care for many older adults aging alone in the district, like Mr. Smith. Iona's Ward 3 lead agency grant has seen a significant decrease of over 50% coming into fiscal year 24. Ward 3 is still home to the largest older adult population in the district, and I respectfully request the council to support Iona in restoring our Ward 3 lead agency budget levels to that of 2019 to 2023. In addition, we need your continued support for Iona's dementia navigators and money management programs, as they are the only community-based comprehensive subsidized dementia care management and navigation for the district. We've uploaded our client profiles onto our website for your view and the public's view at www.iona.org and attached to this testimony. They highlight the important work of Iona's dementia navigators and the diverse clients served throughout all 8 wards of the district. I thank you for your leadership in the city and the opportunity to testify. Thank you.
Thank you very much, Mr. Bang. I believe we're going to go down to our number 11, which is Rhonda Cunningham Holmes, the Executive Director of Legal Counsel for the Elderly, and Dr. Maria Teresa McFall, President of Vida Senior Center. I understand that they are ready on the internet, so we'll start with you, Ms. Holmes, when you're ready.
Hey, good morning, Councilmember Bonds, Chairperson Bonds, I should say, and happy birthday and greetings to all of the members of the committee. I am Rhonda Cunningham Holmes, the Executive Director of Legal Counsel for the Elderly, commonly referred to as LCE. LCE is the only organization in the District of Columbia that provides legal support exclusively to seniors. My testimony today will focus on LCE's relationship with DACL, specifically our legal hotline services and our DC Long-Term Care Ombudsman Program. First, I want to acknowledge the tough budget decisions the council must make. I hope my testimony will demonstrate how efficiency can help stretch the taxpayer dollar and how LCE's continued service is an investment in district seniors. Second, to help ensure district residents maintain support from LCE, I am asking the council to support the mayor's proposed DACL funding, which will help LCE sustain our core services. As noted in my performance oversight testimony, LCE and DACL are longtime collaborators. That relationship led to the development of a warm handoff system to better coordinate senior services. This system provides a direct line between the LCE, legal hotline, and DACL case management. Before this system, which is a simple email, referrals between LCE and DACL would be put in the regular queue. The warm handoff provides efficiency by allowing the LCE hotline attorney to continue assisting the client with their legal issues while guaranteeing that they get immediate access to DACL services. The warm handoff is an example of how LCE and DACL are working together to increase efficiency and provide more services to district seniors with no additional appropriation needed. I applaud Director Hines and her staff's ability to adapt to provide efficient senior services. LCE will be happy to offer our support and will collaborate to further streamline senior legal services in the district. As AARP DC State Director Lewis Davis stated, LCE is requesting an additional $206,300 for a full-time hotline attorney and social worker for the LCE legal hotline. In 2023, of the 400 to 500 calls answered by hotline intake staff each month, hotline completed nearly 2,000 intakes for legal matters for the year and rejected an additional 625 inquiries due mostly to ineligibility. Hotline attorneys took on 3,300 cases last year. Many clients call with more than a single legal issue, which is how we have more cases than clients. Hotline is the first stop for most older adults seeking LCE legal services, and most of our low-income clients receive initial advice from a hotline attorney before going on to meet with an attorney for extended representation. The hotline capacity is stretched from 2 points. The first, an increasing number of calls are for non-legal services. These calls range from securing clinical care to finding and applying for basic support services. With the addition of a social worker, LC will be better able to assist these hotline callers to get the services they need. The second capacity issue is legal complexity. Over the past several years, calls to the hotline have become more complex, requiring additional services from LCE. These clients require follow-up from an LC attorney in one of our other practice areas, a pro bono attorney, or an extended relationship with the hotline attorney. Regardless of their need, these complex legal issues require more time and strain the hotline capacity. Funding for an additional hotline attorney will allow more people to address their legal needs and will help district seniors connect with quick, no-cost legal assistance when they need it most. LCE provides a variety of legal services that help preserve wealth and dignity for district seniors. Many of these services are funded through a grant from DACL. I appreciate DACL's partnership and thank the mayor for including more funds for DACL in her proposed budget. Again, understanding that the FY25 budget will be tighter than any presented to the district in many years, I recommend the council protect the increases to DACL's budget. Through DACL's grant to LCE, district seniors are able to secure public benefits, maintain their housing, protect their generational wealth, and preserve dignity as they age in the community of their choice. Finally, I would like to thank DACL and the council on behalf of Mark Miller, the district's long-term care ombudsman. In FY24, the district appropriated an additional $100,000 to the ombudsman program, which helps protect some of the most vulnerable seniors in long-term care by allowing us to add an additional ombudsman specialist. LCE appreciates the financial support for all Title III and Title VII programs, and we're advocating for Congress to reauthorize the Older Americans Act and provide additional funding. LCE will continue to partner with DACL to provide efficient and effective services to district seniors. With additional funds for a hotline attorney and social worker, I am sure we will help more older adults age safely and with dignity. Thank you for your time, and I look forward to any questions you may have.
Thank you very much for your testimony. And now we will hear from Dr. McPhail, who is also on Zoom. All right.
Chairperson Anita Bonds, members of the Committee on Executive Administration and Labor, witnesses, and agencies who are testifying in this oversight hearing today. My name is Maria McPhail, President and CEO of Vida Senior Centers. It is an honor to testify on behalf of the Department of Aging and Community Living during this hearing. I represent Vida Senior Centers, an organization dedicated to serve Latino and low-income seniors in the DC area all worlds for over 53 years, providing essential services under the domains of food security, mental and behavioral health, nutrition education, social services, health promotion, recreation and socialization activities, facilitating social interaction in their language to seniors from 26 countries. Through our mission, we aim to enhance wellness, self-sufficient, and independence of Spanish-speaking and low-income seniors in DC. bridging cultural and linguistic gaps that often leave seniors isolated while aging in place. Annually, Vida delivers at least 150,000 services with 41,000 supported through the DACL-funded programs, plus 18,000 congregate meals every year. I would like to express my heartfelt appreciation to the DACL's team for their decades of support to Vida, to Director Sharon Hines for the outstanding leadership in the time she has been at DACL, and also take this opportunity to acknowledge Madam Chair Anita Bonds for her unwavering advocacy on behalf of the Latino seniors. Your support has been invaluable in sustaining a crucial service for Vida over the years. Vida budget is $1.5 million a year. In fiscal year 2024, DACL is covering a ratio of 48% for their programs. Therefore, Madam Chairs and committee, we urge you to approve DACL funding for 2025, as they are the major funders for many organizations like Vida, positioning them as the backbone of DC seniors care. And we need their continued support. As well as we all are aware, post-pandemic, the cost of living has increased significantly. And additionally, demand for our services continues to rise. This evidenced by how we have increased Vida membership, going from 659 seniors to 1,900 seniors in the last 3 years. This is being really conservative. Due to the limit on the space and funds, we try not to over-enroll people that needs. We try to help them as we can. DACL in the past covered 60% of our program's budget, but this recent cost and increased demand have placed an additional strain on Vida's financial resources. We do not turn anyone away, even with the limitation I have expressed today and in past public hearings, but our resources continue to stretch thinner and thinner. It is for this reason that I urge you to not only approve DACL's funding, but also consider how to increase this funding to allow us to provide sufficient staff and resources to support our programs, which have continued and will continue to grow. To DACL and this committee, my commitment is to continue working tirelessly, looking for additional partnerships to increase Vida's capacity so more senior citizens in the city can benefit from our great programs. But we need more DACL fundings. A lot is being done, but there is so much work is left, as there are so many more Latino seniors isolated in need in the city who needs our support. Once again, thank you, DACL, and look forward to conversation in how optimize the support further to programs we deliver to the Latino population with their funding. Thank you very much for this opportunity. And Madam Chair, happy birthday to you.
Thank you very much for your testimony. All right, I wanted to, Ms. McPhail, I'll ask you, since you are still on the monitor, what is the current number of seniors that your organization is working with?
Yeah, we are serving 1,900 seniors. They are enrolled on the programs, Madam Chair. One of the things that you can see, because of the limited space, we only receive 100 seniors in both centers every day, but we have a lot of interactions via phone, and through the recreation and socialization activities, we serve a large number of Latino seniors. As you can see, many times we go for the socialization activities, we take at least 250 seniors to these events we have. And this is only for the component of the socialization activities. And then comes the wellness, the health promotion, and all the things that our counselors help in the basement, that this is the work that you don't see happening every day at Vida.
All right. Well, thank you very much for that. Your testimony indicated that programs have surged by 198%. So I wanted to get some real numbers of individuals. Thank you very much for that. Let me ask you a little bit about your space, which is very limiting. What are the plans for expansion, or are there plans for expansion?
Right, so I have been looking with the support of the board for a bigger space. The problem is the funding. We're trying to first allocate a venue where we can serve more seniors. And then the plan is to go and talk to DACL and how to optimize the money we're getting right now, because we're not paying rent. This is our own venue. So I am looking forward to find the right space and see how I can collaborate with DACL to see how we can optimize the funding we're getting and reallocate it maybe for renting. Or who knows, this is me saying, not Vida, maybe get rid of this building and find another building, but I know that's not gonna be enough. The prices in the city are very, very expensive, and we need to find a very centralized venue where seniors have transportation and it's easy for them to commute to the centers, to the site.
All right. Well, I appreciate that. Thank you. Thank you so much. As you were speaking, of course, I was thinking about, what might be some of the options. Of course, if we were in real estate, we would say, well, you can always sell your very strategically located venue. And with that, you could probably buy something that's, more open space. But let us help you work on that. I think we reached a point where we need to think about how more can come together on a regular basis and not be scattered all across the city. But that's just a thought. There are those who think that remote programming is more exciting than programming coming together, but I tend to think that seniors like to be together and doing things. And I'm getting a lot of head shaking saying, yes, yes, yes. Okay. So we will explore that. So thanks for that response.
Thank you. And if I may say just one more thought, Madam Chair, we are doing services hybrid as well. This is how we get through many classes during the day. We have seniors connected via Zoom, but as you mentioned, the pandemic has left devastated consequences, and we're trying to get the seniors out of that state and bring them to the new normality. And one of the biggest things is what you just mentioned: interact with each other, network with each other, and share, important time between them. Things that we do all the time here during the congregate meals every day with the support of the ACL.
Thank you very much. Mr. Bang, 53 years, that is also historic, and thank you so much for that. I own a house, 30,000 meals served annually, correct?
Well, that's 30,000 meals in 7 months.
7 months. All right. And what do you see as your membership? That is those that you're serving on an annual basis. What are your numbers look
About
like?
4,500 per year.
4,538.
4,500 per year.
Okay. All right. You asked for a budget increase. And what number did you give us for that?
Well, I was asking for the Ward 3 lead agency budget restoration, which using numbers from 2019 to 2023, as well as support for our dementia navigators and money management programs.
And what total amount are we speaking of?
So we saw a 50% decrease in our Ward 3 lead agency grant, which comes up to roughly about over 900,000 to $1 million.
Okay. Do not be afraid to talk numbers. We got to know what the ask is.
Yeah.
In order to even get close to it. So I appreciate that,
Thank you.
you know. And it seems like a big number, but when you're servicing so many important citizens of this community, it makes a difference when you're serving our seniors. So
That's right.
we're going to do everything we can to get those dollars that you need.
Thank you.
And that's for all of our programs. And so, Ms. Cunningham Holmes, I know you heard that, and I know that you are saying I think you said $206,000 is your need.
$206,300.
All
And we
right,
do use Iona's money management when we're able to, so that is
all right.
definitely something we like to see restored as well.
All right. And Mr. Ross, we already have heard loud and clear the importance of looking, if we can, to come up with this dementia care navigator individual.
Dementia specialist, thank
So,
you. Yes,
Yeah,
thank you.
yeah. Well, I call it a navigator because they're going to be trying to, and I'm really thinking that you're speaking, if we're going to do it, we're going to do it right. And so we're speaking of not just one person, but probably a couple of people in order to do the service justice. So thank you very much for your testimony as well. And I'll turn to Councilmember Fruman, who may have a battery of questions.
Thank you very much, Chairwoman Bonds, and thank you to all of our witnesses. I'll start with you, Mr. Bang, and Iona. Congratulations. Congratulations on the new role that you're playing in Ward 2. Congratulations on all the great work that Iona has been doing under your leadership and has been doing in different forms for all of those 53 years. On the restore the Ward 3 lead agency funding, and if the idea there is that you feel like you have a let's call it $1 million shortfall in what you need in terms of full support, is there a reason, if you're the Ward 3 and the Ward 2 lead agency, conceptually, why wouldn't we think about that as a $500,000 increase for each of the lead agencies, which would then deliver $1 million to Iona? Why do you talk about it in terms of restoring the Ward 3 lead agency level? Is the Ward 3 lead agency level lower than the levels for the other wards? So if you could speak to that.
Yeah, absolutely. So the Ward 3 lead agency grant budget is, there are 8 different budgets because of the wards. Ward 3 represents the second to last in terms of the funding levels we receive for the lead agencies. And so I think why I'm advocating for restored funding is because because of the decrease in funding coming into the new fiscal year, we've had to adjust and reduce the size of many of our programs, specifically with our case management program. And so we want to see the funding levels restored to lead agency Ward 3 and figure out a way to work across the 2 different wards utilizing the restored funding.
All right, so more conversations on this over time in terms of how one executes the increased dollars to Iona. I hear you that now I understand that the lead agency funding differs from ward to ward.
That's
And
correct.
as you said, Ward 3 has the highest number of
That's right.
seniors. So the idea that it would be second to last is, would require some explanation.
Mhm.
There could be, if the dollars came through an increase in Ward 3, but also an increase for other lead agencies across the city, and it got you to the same place, that would meet your needs. Is that correct?
That's correct. And this, ultimately, I'm advocating for increase in restoration for all of the different lead agencies and the budgets that were cut because of the removal of case management, home delivered meal funding.
Okay, all right, very helpful. A couple of other things that, one that I'm not sure came up, and maybe you referred to Around Town DC.
Mhm.
Is Around Town DC funded adequately in FY25?
I think we are, yes.
Great. And then Dementia Navigators, very, very important program.
Mhm.
The mayor did include additional dollars for Dementia Navigators. Do you feel that that additional funding is not sufficient, or are you concerned that that funding won't make its way to the specific Iona program? How do you see the mayor's addition in that space?
Yeah, I thank you for that question. I think it's important to recognize the value that Iona's Dementia Navigator program provides for the district. We serve all 8 wards. And there isn't any other program in the district that provides the level of comprehensive services for older adults in the district. I think the budget can be inclusive of other programs, but I think it's important that it's allocated specifically for Iona's Dementia Navigator program.
I guess all I can say to you on this is that I like to think that money was included in the mayor's budget because I asked for it.
Mhm.
And when I asked for it with the idea in mind. So I need to follow up on that to ensure. There may be other programs that are doing the work, but we've actually heard from a couple of different folks today already about
That's right.
the importance of this program and citywide. So want to make sure that it is fully funded. I do think it's the goal of the mayor to fully fund it, and certainly my goal to make sure that it's fully funded. I think a different thing that's out there, and I wonder what role you're playing in this and how you're tracking it, is the idea of a senior wellness center. And the 2 places that there are not brick and mortar senior wellness centers are Ward 2 and Ward 3. The 2 places that you're the head of the lead agency are Ward 2 and Ward 3. And I'm curious your thinking about that, your hopes for that, your thoughts on that.
Yeah, I think DACL and DACL staff have done a fantastic job of leading a task force to identify what the programs look like, but also the feasibility of the location as well. And so I think it's good to see the diversity in the task force. We have a good number of individuals who are contributing to supporting DACL's effort in that. And so I think it's going well. And hopefully by the end of the year with the task force, we'll have a report for you and Madam Chair.
All right, well, thank you very much. Thank you for all the work that you're doing at Iona in Wards 2 and 3. Thank you, Mr. Ross, for your testimony. I think I followed up with questions to Mr. Brenner, and I'd just be repeating those same questions again, but it's really important work being done by the Alzheimer's Association, and very grateful to you for that. Dr. McPhail, thank you also for your testimony. It was interesting that the witness for the AARP talked about the needs that you have, and have you put a specific dollar amount for the needs that VITA has in this budget that are so far unmet?
For this, I haven't. We talk about the cut that Vida Senior Center got for last year, and we heard that the incoming year is gonna be difficult or tight budget. So we haven't, but DACL and AARP and many other agencies are aware of the difficulties Vida Senior Center has faced this year financially. I mentioned in the last hearing that we have to cut 5 hours of a week of every single staff without reducing the time of service for the seniors. So I think this has been vocalized in many occasions for me, but I haven't put a dollar amount for the next year's request. I will definitely tell you that I need to increase my staff hours, and I have been doing some math on the amount of money we are getting from the DACL funding per seniors. When you do the math, we are getting $600,000 and a little more for transportation. And that give me like a $28 per month per senior. And if you see, that being said, only one unit for nutrition, education, and counseling cost in the market around $165. And we do tons of these interactions every month. And we do multiple for each senior, that's only one service. So definitely we are working with very little and doing a lot. And I can put numbers together and send it to you because I know that data is what people needs to see. But I don't know if that helps to answer your question.
No, it's very helpful to hear that. I think the idea that, the growth in the numbers of people that you're serving, the special issues that the community that you serve faces, all very, very important. We are getting to a place where everything has to be put in black and white in a budget. And so I think we need very specific numbers of what it is you think would address the issues that are most important to your organization, so that if there are the resources to help, we can help, but it has to be very specific. So I'd encourage you to try to come forward with a number justified by the kinds of things that you're talking about. So thank you very much. Thank you again, Ms. Cunningham Holmes, for your testimony and for all of the work of the Legal Counsel for the Elderly. Super important work, and very grateful for you for that. I'm down to 10 seconds, so I think I should call it a day and move on to the next panel. But thank you to the witnesses here for your testimony.
Thank you.
Thank you very much to our witnesses. Mr. Bang, I guess one of the things we need to remind the public of is the fact that Iona House, back in the day, as they will understand, was originally a wellness center. And it became a full service blown, almost a mini DACL. And so that's where we are today. And thank goodness for that. So I want those who are Ward 3 residents to understand that the intentions of your government were always solid, that Iona House would be, a full service institution that would address many issues of those who are aging, especially given that the population is and continues to be growing amongst our aging community in Ward 3. So I just wanted that on the record. Yes, and thank you again. And thank you to all of our witnesses on this panel. We are now going to have Kathleen Brisbane and Stephanie Robinson. I understand that both are they here or online? One is here. And Frankie Willis Hope. And I believe we can take one more at the table. Matthew Thackerson, we can take you at the witness table if you'd like. If you're here, a public witness. He's online. All right. Well, we'll start with those at the table first. All right. Good morning.
My name is Deborah Peterson, and I am sitting for Catherine Spain. She's not able to be here. Good morning, council member bonds and committee members. Opportunity to ask for your continued support of senior citizens out the District of Columbia. I'm here today on behalf of Kate Brisbane, who is not able to be here in person. I will read her testimony. It is quite often our lifeline and helps avoid social isolation. The mayor felt so strongly about the value of senior wellness centers that she allocated several $millions to expand some wellness centers and build a new one since 2018. DC has been certified as an age-friendly city and should deliver on its promises to seniors by making sure that access to public services and programs is given priority. Without access, even great programs are meaningless. DC seems to be missing an essential element in age-friendliness bus transportation. Several years ago, Model City Senior Wellness Center in Ward 5 had daily bus transportation. The bus brought 20 to 24 seniors to the center daily and took us on trips to museums, theaters, and citywide events. Having a bus meant that our volunteer dance troupe, the MC Steppers, of which I am a member, were able to travel around the city to perform at the request of the mayor and other city officials without having to pay taxi and parking fees or come out of our own pockets. In the FY23 budget, a specified budgeted amount for bus transportation was ended. Now senior wellness centers have to decide between programmatic needs and transportation. How is it that the mayor has chosen to make $525 million available to help a billionaire build a sports arena in DC while ignoring the need to find bus transport to and from senior wellness centers? Now that our center buses are no longer provided by the district, our wellness center managers have been told that they have the option to use a portion of their allocated funds of bus transport. But wellness center budgets were not increased to cover these costs. At model cities, in order to retain the programmatic needs of our members, bus transportation was reduced from 5 to 2 days. Seniors were told that they could apply for a connector card, which would give them $100 per month for taxi fares. The connector card has a very long waiting list for those applying and has now suspended issuance of new cards. And for those lucky seniors who have the card, they now have to face increases in taxi fares. Seniors at our center have reported that taxi costs from their homes inside Ward 5 run between $8 and $11 each way, or $16 to $22 a day round trip. I did the math. The greatest number of days a senior using a connector card can come to the center would be 9 days each month, not the recommended 20 days. And taxi rides costing $22 round trip reduces the maximum number of days to 4.5. Faced with these travel costs, members needing transportation have reduced the number of opportunities to get healthier and remain connected to others. Studies have shown that daily exercise and regular social interaction for seniors are major factors in avoiding physical illnesses, depression, dementia, and other challenges that may lead to long-term care in a nursing home. And we all know what nursing home care costs. If senior wellness centers are continued to play a major role in age-friendly DC, transportation for many seniors is needed for these centers to continue to support the promises and policies of our age-friendly community. It is imperative that full funding for bus transportation must be restored to all senior wellness centers. Consider the social and fiscal impact of a population of seniors who are healthy, engaged, and safe. All it takes is the city's willingness to provide bus transportation 5 days a week to the places intended and ready to provide those indispensable activities, our senior wellness centers. It is difficult to believe that our city council prefers funding nursing home care or a quote unquote bigger and better sports stadium over bus transport to our senior wellness centers. If that is what comes out from the FY25 budget, then how can DC remain an age-friendly city? Thank you for your time and attention, but also for your support for those who worked to make DC their homes and now rely on DC to help them age in place.
Thank you. Thank you for your testimony. Next, and you'll have to identify yourself. I'm not
Good
sure.
morning. I'm Stephanie Robinson.
Sorry, Ms.
Good morning,
Robinson.
Councilmember Bonds and committee members. I'm advocating today for better and more nutritious meals for DC seniors. I'm an active member of the Ward 5 Model City Senior Wellness Center, and I'm here today to ask that the Department of Aging and Community Living, DACL, be more accountable to seniors by fulfilling its 2024-2027 State Plan on Aging. The plan was designed specifically to serve DC's older adults. The plan states that DACL is committed to ensuring that seniors age with important services, to include nutrition programs that will help us age and live boldly. We ask that DACL keep that commitment by ensuring our nutritional and health needs are met through better meals at senior centers. Seniors at model cities talk daily about the high calorie count and excessive amount of sodium in too many of our lunches. Daily, we comment that the meals are too high in sodium, too high in cholesterol, contain too many carbs, and we also question why are there 14 grams of sugar and a 4-ounce cup of yogurt? A healthier serving of yogurt is less than 20 grams per cup. So we ask, also, why are vegetables so overcooked? Instead of serving us these sugar-packed fruit cups, could we get some fresh fruits? Could we get some fresh vegetables? Also, can we get a list of the nutritional facts for the foods that are regularly served? DACL understands that for seniors, the lunch at a community dining center or a home-delivered meal may be the only hot meal that a senior receives. A report by the DC Hunger Solutions indicates that food insecurity among older adults is approximately 12.8%. And in DC, we have one of the highest rates of seniors facing the threat of hunger in the nation at 20.1%. The USDA defines food insecurity for seniors as a lack of consistent access to enough food for a senior to lead an active and healthy life. I believe it may be difficult for seniors to lead an active and healthy life if we're not being fed consistently healthy meals that are hardly nutritious and loaded with refined sugars. So today, we ask that DACL contract with businesses that will be required to provide nutritious meals that help to promote good health, not put us more at risk for illnesses. If the mayor can make a $515 million investment to keep sports teams at Capital One Arena, we can certainly hope that DC can also invest in better meals for senior citizens. Just to give you an example of how we seniors at model cities are concerned about our health and what we eat, we have a nutrition class every Tuesday and Thursday, and it's instructed and led by our amazing nutritionist, Dr. Sunuthi Selvaraj. Sue's classes are packed weekly. Sometimes there's standing room only. So that's a huge indicator that we care about what we're consuming. During last month, which was March's National Nutrition Month, we had a class on how to make salt-free seasonings. So Sue is consistently instructing us on how to make more informed and healthy food choices. I'd like to invite the whole committee to come join us for lunch at Model Cities to get a sampling of what we eat on a regular basis. On DACL's website, it says, in order to thrive, you need food that tastes good and that is good for you. So we're asking that the committee secure funding that promotes good health and wellness of our seniors by serving us better and more nutritious meals. That way, we can truly be healthy, truly be active, and truly live boldly. I know how important it is to rely on just the opinion of more than one person when considering a change. So to increase our chances of success, I prepared a short survey for seniors who eat at model cities on a daily basis, and I've attached it to my testimony, those results. So I hope it'll help you to decide to promote healthier meals. So thank you, Council Member Bonds and community members. I appreciate the opportunity for you to listen to our concerns today. Thank you.
Thank you very much for your testimony. And I believe we now have Frankie Willis Hope. There you go, you're on. All right.
Good morning,
Good morning.
Chairperson, excuse me. Good morning, Chairperson Anita Bonds and committee. My name is Frankie Willis Hope, a lifelong Washingtonian living in Ward 5. I am a member of Model Cities Senior Wellness Center, representing in Seniors Speaking Out and Up. The DACL budget allows only $20,400 for transportation at model cities. We are able to provide round-trip transportation 2 days a week for our seniors at a cost of $3,400 a month. There are additional, my cataracts have failed and it's difficult reading. There are additional bus charges when we need to go to different transportation, like to the town hall meeting on Wednesday. It's another charge for the driver to pick up the members to bring them in. We are making a recommendation that $20,400 be added to our transportation budget so that we can bring our seniors to the center 5 days a week. That way they will feel so much better and not feel so isolated. As you heard in last month's testimony, we had an 87-year-old who was knocked down at the subway trying to get home from the center. This accident may have been avoided. We have a 104-year-old who would love to come every day. She just stopped driving this year. She used to being out daily. Thank you, Chairperson Bonds and Director Hines, for all you've done for us in the past and considering our increase in our transportation budget. Thank you.
Thank you very much for your testimony. Do we have Ms.? All right, we have Mr. Thatchton, who is on video. All right, go right ahead, sir.
Good morning, Chairperson Bonds, and happy birthday. Members of the committee, I thank you for the opportunity to provide testimony on the Department of Aging and Community Living's fiscal year 25 budget. My name is Matthew Thaxton. I am a resident of Ward 7 here in DC, and I am the son of a mother who is living with dementia. While I know the council is juggling multiple priorities and budget issues, I wanted to focus on a program that both Mr. Brenner and Mr. Ross talked about earlier that is important to so many people in the district. I'm here to reiterate the ask that the council appropriate $150,000 to fund the position of the dementia care specialist within DACL. This critical position would help thousands of DC residents who are currently living with Alzheimer's and other dementias. I know from personal experience how difficult dementia is, not only for those who are living with it, but for their caretakers and their families. Even getting a diagnosis can be difficult. because dementia can show up in different ways depending on what type of dementia it is. For my family, because my mother has frontal temporal dementia, the symptoms are very different from traditional Alzheimer's symptoms. So our family was sort of at a loss and confused about what was going on. A dementia care specialist could help with these diagnoses, which are particularly important. Early diagnosis is critical for patients to be able to utilize new treatments that can help slow down the progression of the disease. The dementia care specialist would also help with training for healthcare providers and programs for caregivers. A diagnosis of dementia is the start of a long and difficult path, and care coordination can be difficult, especially for caregivers. I experienced firsthand the difficulty of care coordination for my mother after a recent fall. A trip to the ER meant coordinating among her primary care team, her vascular team, her neurology team, the nursing team, and the palliative care team. The experience can be overwhelming for caregivers. I'm lucky enough to work in healthcare policy and to understand that patients and caregivers need to advocate for themselves, but not everybody is equipped with this knowledge. The dementia care specialist could help those like my father who have taken on the incredible burden that comes with being a caretaker. He is my hero, and all the incredible caregivers like him deserve support. As you know, DC has the highest per capita prevalence of Alzheimer's of any state or county, yet we do not have a dementia care specialist. This leaves the district lagging behind some of our neighbors like Maryland who are already building out these programs. We can do better and we must do better. And I hope together we will do better for everybody who is living in DC with dementia by funding the much needed dementia care specialist. Thank you so much for the opportunity today.
Thank you very much for your testimony. That completes our panel. Just hold it. There may be questions. I appreciate your testimony, and I think that the audience here today has appreciated it as well. What we will do is take another look again at the budget. That's what we have to do. And that's why your testimony today is so important, because it helps us to look anew at those areas where you are indicating we have some deficits that we need to make up. So don't be shy, feel free to share what you must, because it's about us together collectively trying to get this right so that you continue to have a good life, and those that are not, to see if we can help you have a good life, because you are important and you are deserving. So just want to make that real clear to everyone. Want to make sure that I collected certain numbers that would help us understand any adjustments that we might be able to make to the budget. Ms. Robinson, your concern is better meals. Do you have a sense of how many meals are served at the wellness center, let's say on a weekly basis?
On a weekly basis, I could tell you we serve about 45 to 50 daily. So that's about 250 meals or more on a weekly basis at model cities.
All right, and that's the hot lunch meal?
That's correct.
All right. Do you get is there any breakfast kind of?
No.
Okay, just the hot lunch,
hot
okay,
lunch.
which is considered the conjugate meal.
Absolutely.
Okay.
Yes.
And Ms. Peterson, you're concerned about this 515 million to the billionaire. So what are your thoughts about what the number ought to be to for our seniors?
Well, 525 million.
Okay. Yeah.
I mean, he's a billionaire. Maybe he could put up a little bit more. I don't know.
Okay, I hear you. Okay, but your point is that you said the center has 438 seniors that are active.
Yes.
Okay, and so you want to make sure that we have ample dollars that address their needs. And number one need is the transportation.
Yes, ma'am. And if I could just say one thing from my own experience at Model Cities, I'm also a lifelong DC resident. I've been attending Model Cities since 2011. I am one of the MC steppers. And we do sometimes have to come out of our own pocket to go to a voluntary dance performance. So I don't think that that's something we should have to do.
So you're suggesting that while you have gone through the training and you're high stepping and people are applauding, that it's not about volunteerism when you have to go in your pocket to do all of this?
Well, not totally, no. I mean,
Okay,
we
all
love
right.
what we're doing and we'll do whatever we have to do, but it would be nice if
Yeah,
that could be provided.
becomes costly.
Yes, it does.
Yes, all right. But thank you for what you do. And we're not going to ask for a demo this morning, but she can do it. I just want you all to know they are fabulous, absolutely extraordinary. And Miss Willis Hope, you give us actually a number, $20,400. Okay, that you want to be added to the transportation side of the equation. Okay, thank you. And Mr. Thaxton, I have it, 150,000 for the dementia care coordinator. All right.
Exactly.
All right. Well, thank you all. My colleagues, I don't believe any are on, so we'll now move to the next panel, and thank you all very, very much.
Okay,
for
I'm
your-
sorry. My director has told me to say one more thing.
Oh,
We also have costumes, of course, that we perform in, and sometimes we have to come out of our own pockets to purchase those costumes. So it'd be nice if DACL could help us with that as well. A little, and I don't have a number, I'm sorry.
Okay.
You know, prices change every year, but it does add up. And, you know, we have to look good when we're out there dancing.
Oh, I agree, and you have to have makeup kits and all of that. I got it. So could you please make sure in the next few days that I get some sort of budget for how many and what? Because there may be benefactors in the community that would want to augment the cost there. Maybe the billionaire might be listening and thinking
You can
about
only ask.
this program. Okay, thank you. Thank you so very much to this.
And happy birthday.
This panel,
Councilwoman.
thank you. Our next panel, Heather Foote, public witness. Marla Lahat, Executive Director of the Home Care Partners. And Denise Snyder, the Executive Director of the Foggy Bottom West End Village. And Ronald Hampton, who is the State President of the AARP. Yes, Ronald. I see Denise, Dennis, and I see. Okay, Heather. Okay, all right. And so additionally, we're calling Claudia Schwarzberg, Chair of the Coalition of Long-Term Care. And we have one more seat at the table, Paulette Tigman. If you are here with us. Or Justin Johns, Director of Operations at the DC Center. He's doing virtual, okay. All right, well. And Hillary Kay, if you are here, are you also virtual? Okay. Robert Cook, Public. Robert Cook will join us at the table. Thank you. And that brings us down to 22. So we're making progress. I just want to make sure you have time to get out and do your afternoon activities because I know they're so important. All right, Ms. Foote, we will begin with you.
Thank you for the opportunity to testify. My name is Heather Foote. I'm a Ward 1 resident and an analyst of older adult transportation options and related issues. I'm testifying today in support of the valuable older adult transportation options, the Senior Med Express, and the Connector Card programs offered by the Department of Aging and Community Living, or DACL, and administered by the DC Yellow Cab. I encourage the committee to look closely into the adequacy of proposed FY25 funding, in particular for the Connector Card program. It provides a Visa debit card for use with a wide variety of transportation services. Its gradated financial support structure provides greater subsidies for older adults with lower incomes. Seniors with the lowest incomes can benefit from funds deposited onto their cards without being required to make a contribution themselves. This is important in a city with a senior high poverty rate. Participants with higher incomes make a specific dollar contribution specified by the program, and supplemental program funds are deposited onto the card. Program contributions are assigned according to income levels. Without going into too much more detail here, it's important to note that the Connector Card program had expended all its FY24 funding as early as February or earlier. As important, there is a long or very long waiting list, i.e. residents who've submitted applications for the program but have not received their cards, presumably due to lack of funding. According to the Chief Financial Office webpage, the transportation line in the DACL budget shows a $325,000 increase over the approved DACL FY24 transportation appropriation. My concern is that given the FY24 budget did not even suffice for half the fiscal year, it appears that the FY25 budget could fall quite short for the Connector Card program. According to the DC Yellow Cab page for the Connector Card, the DACL has made several changes to the program that were communicated last March. DACL asked participants to resubmit their income verification by June 30th, 2024. It is unfortunate that this step was not taken earlier in FY24. My concern here is that the mayor's FY25 budget proposal may not be based on the information needed to assure adequate funding throughout FY25. Senior transportation is a core service, to quote the mayor's wording, and needs to be funded as such. I want to conclude with 3 commendations. The first is for So Others Might Eat, and AARP. Some won a community challenge grant from AARP DC, which enabled them to teach seniors how to use the Connector Card, learning by doing. It's not necessarily intuitive. The second is for Capitol Hill Village, which is doing important work on repair of sidewalks, walking being a critical transportation option for older adults. And the third commendation goes to DACL for its use and wide distribution of printed materials about its programs. While many seniors are online frequently, many others are not. In assigning a budget line for printing, DACL is addressing a key information access equity issue. And I would underscore here, given a number of things said about Visa Senior Services, that translation into Spanish of information about the Connector Card, for example, and making sure that all Latinos involved in that program know about this opportunity is incredibly important, especially since those seniors tend to be lower income. And because of those who are sitting alongside me here, I personally want to express my strong support for the Safe at Home program and for increased salaries for those who provide in-home care services in the district. Thank you.
Thank you very much for your testimony. Ms. Lahad, you're next.
Good morning, Chairperson Bonds. Happy birthday to you and also to my esteemed colleague, Ms. Claudia Schlossberg, who also celebrated a milestone birthday. My name is Marla Lahad, and I am the Executive Director of Home Care Partners. Home Care Partners is a nonprofit home care agency that provides 3 services through generous funding from DACL. That are designed to help older adults remain in their homes. The Homemaker Home Care Aid Program that provides home health aides to older DC residents who do not qualify for Medicare or Medicaid home care. The DC Caregivers Institute that provides support to unpaid family caregivers who are caring for their parents, spouses, or other loved ones. And the Safe at Home program that provides occupational therapy assessments, home modifications, and other fall reduction activities. We are very appreciative of the generous funding and the support from Director Sharon P.W. Hines and the staff of DACL. In February, I testified at the performance oversight hearing about the funding gaps Home Care Partners is facing for each of these programs in FY24. Each of our 3 DACL-funded programs fills an essential need for older persons and adults with disabilities. All of these programs support our clients to remain safely and independently in their homes, thereby saving millions in nursing home and hospital costs. FY24 funding pressures were caused in large part by the success and overwhelming demand for these programs. While our budgets remained flat, more and more DC residents needed these services and cost increases were significant. Workforce shortages of home health aides, social workers, nurses, and other home healthcare professionals resulted in much needed and deserved increases in wages for our staff. This had an enormous effect on our Homemaker program that relies so heavily on this essential workforce. It also impacted our Caregivers Institute, where the respite care offered to family caregivers is one of the most heavily utilized services. In the Safe at Home program, supply chain issues and increases in material costs resulted in higher costs for the home modifications that are the backbone of the program. Budget pressures for these critical programs are anticipated to be even worse in FY25. We have all heard the admonition to do more with less, and I have often said that in the nonprofit world where budgets are already so lean, it simply is not possible. We can only do less with less. With increasing costs, it is not even possible to do the same with the same. With budgets that remain flat and do not cover increasing costs, we can only do less. With growing demand and increasing costs, particularly for our direct care workforce, it simply is not possible to provide the same level of service as in prior years unless more robust funding is dedicated. We are particularly concerned to see cuts in the mayor's proposed budget to the in-home services and supportive residential services line items, which fund these critical programs that I've mentioned. We are very aware that this is a tight budget year, and there are many competing and deserving priorities. But shouldn't our older DC residents, some of the most vulnerable residents of the city, who have made this city their home for decades, be one of DC's most important priorities? In 2019, the district was home to approximately 83,600 older adults, and that population is projected to rise over 24% by 2030. It is clear that funding for DACL programs is generous and appreciated, but it is not enough to meet significantly increasing costs and the growing demand. We are very appreciative of the collaboration with staff at DACL as we go into this tight budget year. But without additional funding, reductions in services and longer wait times for many critical programs are in store for older DC residents. Thank you to Director Hines, the staff of DACL, and to you, Chairperson Bonds, for your leadership and continued support.
Thank you very much for your testimony. Ms. Schlossberg, we'll go with you and we'll get those that are on video.
Thank you and good morning. Chairman
morning.
Bonds, members of the Committee on Executive Administration and Labor. My name is Claudia Schlossberg. I'm a 45-year resident of Ward 1. And as Ms. Lahat noted, this past weekend, I celebrated my 70th birthday. So congratulations to you, Councilmember Bonds, as well for celebrating a birthday, a fellow Taurus, I suspect. I am testifying today in my capacity as chair of the Coalition on Long-Term Care's Committee on Workforce Development, and as one of a growing number of aging district residents who hope to be able to age in place in my home. Unfortunately, the prospect of being able to do so is grim because today DC does not have enough direct care workers to care for seniors and people with disabilities who need help. And we are not making sufficient investments to increase wages and to expand training opportunities to ensure an adequate direct care workforce to meet the anticipated growth in demand due to the aging of the baby boomer generation. Last month, I testified before the Committee on Health that following the last certification renewal cycle that ended on October 30th, 2023, the Board of Nursing reported that the district's direct care workforce, which includes certified nursing assistants, home care health aides, and personal care aides, and direct support professionals, shrunk by an astounding 4,489 workers, a loss of 30% from just the prior year. Findings from the DC Coalition on Long-Term Care's multiple workforce surveys over the past 4 years document that direct care workers have been leaving the workforce for jobs that pay more and are less demanding. DC is also not training enough workers to replace those workers who are leaving. In 2021, only 443 individuals passed the CNA certification exam. Yet in the last renewal cycle, we lost 2,346 CNAs. Today, even if all the schools approved to offer training were fully enrolled, they are not, we would only be able to replace a fraction of those workers who are leaving. Yet the mayor's proposed FY 2025 budget not only fails to make needed investments to address the growing and gaping shortage of workers and to strengthen the infrastructure needed to rebuild this critical workforce, her budget cuts childcare subsidies, reduces the Access to Justice Fund, which I recently heard the council is hoping to refund, and reduces the value of the earned income tax credit. And it also includes a potential regressive income tax, sales tax. These policies hurt working families, including direct care workers who care for seniors. Other cuts of concern include a proposed 50% reduction in the workforce investment and a $4.6 million cut to the budget for UDC's Workforce Development and Lifelong Learning Division. This is the division that trains CNAs and other healthcare workers. With respect to DACL specifically, as you've heard from other witnesses, in-home services, which funds the home care partners, is reduced by $920,000 over the FY24 approved budget of $7.9 million. However, actual costs in FY23 were $9.3 million. So the proposed FY25 funding levels represent a 25% reduction from FY23 actual expenditures at a time when, as you've heard, demand for services and costs are increasing. Notably, FY24 program costs for homemaker services already exceed the approved FY24 budget due to the increased costs of labor and demand. This is resulting in reduced access to care for seniors who need help at home. If the mayor's FY25 budget for in-home supports is approved as proposed, more seniors will lose access to care. In closing, I just want to add, I learned recently that Council Chair Mendelson appears to have found a way to fund the Pay Equity Act, which is the fund that pays for the salaries of our childcare workers and to restore funding for the wages for those workers. And as some of you may have heard, when the mayor testified, she noted that elder care workers don't get the same benefits and remain underpaid. We know the consequences of underpaying this workforce, mass exodus of workers. So in closing, I would just ask the council to consider supporting passing and fully funding the Direct Care Worker Act of 2023 so that we can have pay equity for all care workers in the district. Thank you for the opportunity to testify. I'm happy to answer any questions.
Thank you very much. Mr. Cook will take your testimony now as well.
Good morning. Well, good morning, Chairman Bonds and the committee members. My name is Robert Cook. I'm a senior advocate and active member, and who most of you know may well know me with my ongoing work with affordable housing. For MANA Inc., I'm on the board of directors and the Coalition for Nonprofit Housing Development. I'm also active with the DC Health Department for HIV and AIDS services, and proudly representing today Seabury's Resources for Aging as being a part of their advisory board. Seabury supports older adults across the greater Washington, D.C. region, providing affordable permanent housing and transportation solutions, minimizing food insecurity and social isolation, and creating safe, compassionate solutions for living with dignity. Additionally, we are very aware of the difficult financial decisions that will need to be made in the post-COVID-19 environment. I'm here today because of challenging times as we face many issues with our seniors in the District of Columbia. We still must make our seniors and their issues a high priority and not let them feel forgotten. We should always remember that it was our seniors that made the path for the way that the communities are today. I'd like to recognize with gratitude Mayor Bowser and our council member Bonds for all you have done for us in the past. As in the past, we look forward to you continuing your support of Seabury Resources for the Aging. We need to continue improving our outreach efforts, such as the movie night series, virtual coffee hour, and other activities we have weekly. These programs need to be expanded as the senior population is one of the fastest growing populations in our city. We need these programs to promote socialization for the well-being of our senior quality of life. As medical research shows, socialization promotes a healthy longevity. Additionally, as we talk about seniors and LGBTQ seniors, we are more prone to isolation, discrimination, and lack of health services. Seabury's All and About program has been well received, but must be expanded with more frequent outings. The need to increase funding to expand socialization programs like Out and About are critical to the well-being of our LGBTQ senior communities in our district. Additionally, access to efficient transportation needs should be a frontline priority. Seabury continued to utilize technology to enhance outreach efforts by using teleconferences discussions for both our blind, deaf, and visually impaired adults. Keeping folks connected and less isolated is a key component of DC seniors' quality of life. The Seabury motto, keeping all of our seniors less isolated, encourages us to enhance their quality of life. I'm pretty sure you will feel the same way if you have seniors in your family. Case management team and congregational resources assist our older members in staying connected as well. Lastly, but not least, you know me well enough from my work with Affordable Housing for All campaign and the ability of our senior community to age is placed comfortably must be our number one priority, because the need for affordable housing for all seniors similar to Friendship Terrace development in Tinleytown. Considering the size of our population, we need more affordable housing developments for seniors district-wide. Furthermore, along with affordable housing, we definitely need to focus on access to and affordability of connectivity to Wi-Fi in order to have more seniors connected, especially related to their health care, as this is vital to their healthy outcomes. We are concerned about the discontinuance of the Affordable Connectivity Program for seniors and other family members on fixed incomes. We are concerned about the discontinuation of the government program, which will be coming to an end. In closing, both Seabury Resources for Aging and the Department of Aging and Community Living do a great job, and we need to make sure that continues. I would like to recognize your continued leadership and dedication to our senior communities and look forward to working with you and your staff in 2025 on issues of mutual interest. Thank you, and I am available to answer any questions that you and any member of the committee may have.
Thank
Happy
you.
birthday.
Thank you, Mr. Cook. Thank you. And now we will move to, we have a few online. We'll start with Ms. Denise Snyder. Ms. Snyder, you're on.
Thank you. First, I want to thank you, Chairperson Bonds, and other council members and staff for the opportunity to speak this morning. I'm here representing the Foggy Bottom West End Village to address the budget of the Department on Aging and Community Living. DACL provides critical direct services for older adults in our city and acts as an umbrella for many organizations working to create an essential safety net for those citizens. Given the importance of this role, DACL's funding must match the needs of one of DC's most vulnerable populations. I'm here to speak specifically to the efforts of the 13 DC villages, which are supported in part by funding from DACL. As you know, villages are incorporated nonprofits with the mission of helping older adults remain in their own homes for as long as possible while living the best life possible. Villages are a critical component of the senior citizens network in DC and serve not only our own 2,600 members, but also other community members. During the first quarter of fiscal year 24, almost 1,250 unique individuals who were not members participated in one of our programs. Many villages as well serve to help other people by being involved in various service projects. We also offer information and referral to many people who are not members. Our outreach program, run by Kingdom Care Senior Village and funded in part by DACL, ensures that hundreds of additional older residents who are not village members receive village-like services through a network of faith communities all over the city. With additional funding in fiscal year 25, we would work to develop more villages in currently underserved parts of the city, especially in wards 7 and 8 and parts of Northeast. Villages rely heavily on volunteers to accomplish our mission, thus making us a very cost-effective service provider. In fact, in the first quarter of this fiscal year, almost 1,500 village volunteers gave just over 10,600 hours of service to help support older adults. If you multiply that times all 4 quarters, this represents almost 20.5 FTEs, i.e. 20.5 full-time employees. And that is a 25% increase over last fiscal year in terms of how much volunteers contributed. If village volunteers had to be replaced by paid staff, the cost for those services would significantly exceed $1 million. Villages also play a unique role in addressing social isolation for older adults. Because we're neighborhood-based, there's an element of familiarity and trust that develops between our volunteers and those being served. Every one of the over 11,000 services provided in last fiscal year included social isolation reduction because our volunteers make it a point to take time to chat with the person they are helping. In summary, although all of the villages have additional funding, the grant we receive from DACL helps village provide the grassroots support that older adults need. The villages appreciate the work of DACL and its many facets, as well as the support we receive to help us implement and hopefully expand our mission. I also just want to add support for Iona, both in terms of their work with dementia, as well as their financial management. It's something that is not duplicated anyplace in the city and is urgently needed.
Thank you very much, Ms. Snyder. Believe our next, do we have anyone else on? All right, we have Justin Johns, Director of Operations at the DC Center. And Mr. Johns, go right ahead.
Thank you, Chairperson Bonds. Happy birthday. And thank you for taking the time to hear all these different perspectives on what the city needs. My name is Justin Johnson. I have the privilege of serving as the Director of Operations at the DC LGBTQ+ Community Center. We've been providing vital life and human supportive services to DC's LGBTQ+ community for 20 years as of last month. Center Aging is our program specifically for older LGBTQ adults, and itself is a decade old. We've been receiving funding from the Department of Aging and Community Living to provide those services since 2020. Even before receiving funds, we've been tackling the problems of senior social isolation, hunger, and housing. Starting with word of mouth networking and volunteers generous with their time and resources, we've been able to establish a foothold and build an ever more important reputation as the premier community space for LGBTQ+ people in and around Washington, D.C. DACL's funding has allowed us to bring on dedicated staff and the resources necessary to provide educational seminars and webinars addressing important life topics such as avoiding or recovering from scams and frauds, decluttering, and end-of-life planning. We also do social events like twice weekly virtual community conversations, theater outings, watercolor classes, and we have monthly luncheon with chair yoga. Building on that momentum, we're excited to be moving into a new location. In addition to tripling our space, we'll be co-housed with a variety of LGBTQ+ community organizations, we hope that that'll reduce the burden folks face when reaching out for services. Instead of having to go from place to place to place, we can walk them down the hall and introduce them in a warm handoff. We'll also be expanding some of our existing services. We'll have a larger food pantry and clothing closet. We'll have more meeting space, a cyber center and career development services. We'll also have an ADA compliant shower and laundry services. We're already looking forward to creating crafting nights, book clubs, movie nights, and more for our community to rest, recharge, and connect across all different ages. NPR recently published a story about the looming housing crisis facing many aging baby boomers, and center aging participants are perhaps uniquely vulnerable, considering they may not have family members to fall back on due to lingering stigma or estrangement. To help prevent that, last year we co-hosted the region's first LGBTQ+ housing summit with the DC LGBTQ+ Budget Coalition, bringing together about 180 people representing organizations, advocates, and citizens to talk about their hopes and fears and how we can come together to improve housing for all members of our society. Let me talk about why our space is so important, especially for older adults. Though acceptance for LGBTQ+ folks has grown by leaps and bounds, some of our participants have experienced a lifetime of discrimination in many different areas, from family to employment. So it's not a surprise that they seek out LGBTQ+ organizations for services. We are a trusted messenger between our community and other service providers, providing warm handoffs and recommendations for those in need. Also, we have to acknowledge that community members sometimes face discrimination at other organizations, not necessarily from the staff, but from other community members or from their peers. And so it feels safer in some ways to come to an LGBTQ+ organization when you're being vulnerable and asking for help. The sad truth is that the pendulum of LGBTQ equality feels like it's swinging back in visible and scary ways. from the proliferation of laws against trans existence to political leaders calling for violence against us. There's a rising tide that we need to come together to stand against. And one of the ways we do that is by creating spaces where we can come together in safety, share joy and strength with each other, and strategize how to survive and thrive. LGBTQ plus history is so important and so fragile. The generation who survived the start of the AIDS crisis, health crisis have so much to teach us about building networks, remembering those who came before and paved the way for our present, and surviving in a world that doesn't cherish you. Given what we know about housing becoming less and less affordable, it's becoming more urgent than ever that we come together to create opportunities for seniors to connect with each other and future generations. All too often these days, the only way to exist in public spaces is by spending money. And on a fixed income, that can lead to folks having to choose between having enough food or medication or being able to go out and socialize. And so I ask you, will you help us expand our existing services and create new ones? And in so doing, demonstrate DACL's commitment to the LGBTQ plus community. Thank you for your time today. And of course, I'm available if you have any questions.
Thank you very much, Mr. Johns. I do have a few questions. You mentioned I think you have, every 2 weeks you have events. And you also mentioned that there is a conjugate meal that happens, I think you said once a month? Am I correct?
We have on Mondays and Fridays, we have virtual hangouts. One's going on actually right now. And then, yes, we do have a monthly luncheon. It's the fourth Friday of every month.
All right. How many are served at your monthly luncheon?
It varies. Sometimes in the summer months, folks are traveling or something like that. So it's anywhere from 10 to 30 or 40 people. I know this month we're actually partnering with a nonprofit for professionals of color who are going to come in and do an intergenerational event as part of the programming.
All right. And so what is the amount of resources that you get from DACL on an annual basis?
On an annual basis, we're making do with a little bit less than $48,000 a year.
Okay. And of this 48,000, is any of that resource used? You mentioned that you were going into new space with other agencies.
That's correct. Currently, DACL does not provide any funds towards occupancy, rent, or things like that.
All right, okay. And so this 48,000 takes care of at least partially the staff costs and seminars and social events. Is that kind of how the money is spent?
Yeah, we're able to. We have a part-time person who will be speaking a little bit later this afternoon. Adam is about 20 hours a week, on a little bit of my time for oversight, and then the rest of the fund goes towards providing services to our LGBTQ plus seniors.
All right. So my question then, what is your need to really service the community that you know of and that would use or is trying to use the center and the center services?
I believe at the beginning of the conversation today, you said capital funding was off the table, but just in case, we are asking for, in partnership with the DC LGBTQ plus Budget Coalition, $1.5 million to finish our space and a recurring $300,000 a year to help provide those to provide that space. DACL specifically, I'd have to get back to you with a more particular number. I apologize.
All right, that's fine. And would you please, in the next few days before the end of the week, if you can? All right, thank you very
Absolutely. Thank
much
you.
for that. Ms. Snyder, thank you very much for speaking out and up for the villages. You're right. 10,600 hours of service per quarter certainly translates to far more than $1 million. So thank you very much for putting that point on the record. When you think about the services that the villages provide, are there any areas where you would like to see an increase?
Well, I think transportation is probably the most requested service. And I know that's come up in testimony with a couple of other folks already. We do it using volunteers who pay for their own gas, etc. But it's often something that stretches us. In the past, one of our villages had a grant that enabled them to allow us to use Lyft free of charge to our members when we couldn't find a volunteer, and that has been cut out. So funding to help with that transportation thing would be very useful. There are also lots of other things. I mean, increased programming, transportation available to take by bus folks to a program someplace would be useful as well.
All right. So when we talk about this, you're talking about dollars and cents that the villages will get back to me on, which would give me some sense of what, when we talk about an individual using their personal vehicle to do some transporting, you would like to provide them with gas money?
No,
No.
our volunteers are very oriented to being able to do that on their own. I think the transportation issue would be more like for backup, being able to provide Lyft or Uber for especially medical appointments, which is the predominant request for transportation, and also to provide buses or large vans to transport members to programs that are outside the immediate area. Let me just add, Chairperson Bonds, that the biggest issue that the villages have on our agenda is that we need to expand into currently underserved areas of the city. So if we do get additional funding this year, I'm sure that a priority will be to try to work on establishing villages in Ward 7 and 8 and parts of Northeast.
All right, well, I'd like to see what you think those numbers would look like. At least by the 1st of May.
Certainly.
It'll take you a little time to put all of that together, I suspect. If you're talking about expansion into new neighborhoods and reaching those folk and determining what the need is and how many are low income, that we would want to make sure that we subsidize so they can take advantage of the services.
You may already know this, council member, but all of the villages that currently exist have some kind of a reduced fee membership program. So the point is that while we do have annual dues, no one wants a person to be left out of village services because of finances. So all of the villages have significantly reduced fares. My village, for example, is $100 down to $0, depending on a person's need. We're very conscious about that already.
Yes, and I don't recall talking with you when we began the district's commitment to the villages. It was my sponsorship for that. And the intention was to make sure that our low-income communities had the opportunity to participate because perhaps the membership fee was something they could not afford. So the subsidy is designed to make sure that those who do not have the resources can participate because they're in those neighborhoods where we have the very vibrant village concept. So thank you very much for that.
You're welcome.
Mr. Cook, you mentioned the discontinuance of the Affordable Connectivity Program. Tell me a little more about that, what you know about that program.
Absolutely. The program provides Wi-Fi service, and it's free for those who are on fixed income, and it has been supplied for the past maybe 3 years. funded by the government. And I know that because I got it. And I got a letter, an email from them saying that it will soon be disconnected because within a month, if the government does not approve it or reinstate it.
I see.
Yeah. And it's been very vital because like this coming Friday, I'm doing my telehealth over my phone because of my Wi-Fi. So even though I can't afford it, but still when you're on a fixed income, every little bit, every little penny helps when you have doctor's appointments and utilities and you name it.
I see. Thank you. We're going to examine that program with the director when she comes up a little
If you
bit
have any
later
other,
today.
if I have any other questions, I'll be glad to answer it because I got a lot of emails I can
Okay.
show on that.
All right.
Because it's really been a lifesaver.
I believe. Thank you very much.
Mhm.
Let me ask you then, would you be interested in there being a dedicated hotline that seniors can use for, we have the 311. Of course, we have the 911. But do you think we're at a point where we need a hotline that seniors can call in whenever they're having difficulties so that they sort of like go to the front of the line and can get responses? I hear so frequently that that seniors have to wait and they wait for a very long time to get servicing from the various agencies that provide, very, dedicated service of one type or the other. You think that would help?
Absolutely, because not only just for utilities, suppose if I need a painter, a lot of seniors don't have that ability to go out and find a painter for their house or a plumber or something needs to be fixed. And there should be references that they can go to that they know that they can trust and be honest about it. Whatever they have of the issue is that they don't be jeopardized. Because I know a lot of seniors can be taken for their money and not even know about it.
Yes, yes, I'm aware. I've heard here recently about a number of seniors that have actually lost their home,
Oh,
not knowing that they were putting themselves in jeopardy. And so, we are an easy group to prey on. Like you said, we are not, sometimes we don't have Wi-Fi. We're not up to date. We're not as agile as Generation Z and what have you. So it's easy. We're more stationary, and we are a generation of people who believe in others, and we want to believe in others.
Right.
So we're an easy mark. So we need to think about how do we safeguard against some of these situations. And we'll talk to the director about what the adult protective services programs really are and how they maybe need to be more inclusive of some of the current issues that seniors are facing.
Absolutely. I would like to be on that committee if you want to help to start
Right.
that new
Oh,
program.
you remember the working groups that we did so much around housing.
Yes.
I got you.
So I would be glad to help you with that.
We will endeavor to have a working group around
Right.
that. I think it's way past its time coming. And that leads me to some of the points that Ms. Foote mentioned, things that we really
Excuse me,
need to
could I
be
say one more
concerned
thing
with.
about the program?
All right.
If you don't have a computer and you can't afford one, they will hook you up into getting you a laptop. It might be used, but it's been refurbished.
Okay. And this is the connectivity
Yes, ma'am.
program.
Yes,
All right.
ma'am.
Okay. All right, so the free computers are still available. And then the training.
Yes, ma'am.
All right, and it works.
And it works, and it goes
It
through.
works.
And it's through our cable company, Xfinity. Like they'll send me a statement, say, your bill's due in about the next week. It's a credit because it's been paid. They're very on top of things. So it's kind of hard to believe they want to end that program. But I don't know yet because I guess the government's having a lot of,
Well, I'm
issues.
glad you said a kind word about Xfinity because, you know, I could tell you some things that would lift the hair off your back.
I could too. Exactly.
And I'm sure if we did a working group on that, we would not, this building is not large enough. So.
I agree.
Yeah.
I agree.
But I'll leave that for another time when we'll have breakfast.
I only
and we'll
gave them a
talk
little,
about
I
that.
only gave them just a little credit.
I hear you. I hear you. So Xfinity, I hope you heard that. You got a shout out. It was positive, believe it or not. And so thank you so much for that. Ms. Lahat, you said I made a note that said homemakers rely on DACL. Are you speaking of the fact that we need to have more homemakers the home care workers that will assist our seniors? Do you see a growing need for that type of service?
Yeah, absolutely. There is a growing need. And then as Ms. Schlossberg just said, we have fewer certified home health aides in the city than we did just a year ago. Over 4,000 did not renew their certification in 2023. So there's a huge workforce shortage. That is one part of the issue. There's a huge shortage. The pay is not enough. But what I was testifying about specifically is our homemaker program, which does fund certified licensed home health aides to seniors who do not qualify for Medicaid and Medicare. That program has faced a real funding gap, not just because of the increase in costs, but because the demand is so huge. The demand is growing. It is going to continue to grow, and we need to be able to fund it accordingly.
And so what is the hourly cost for that service? Or does it vary by income?
The cost to the clients, to the
Yes, to the
seniors?
clients, yes.
Just like other DACL programs, our seniors are not required to pay anything. We do ask for a voluntary contribution, but they do not have to pay.
All right. And what is the current level of contract that you have with DACL now?
For the homemaker program
Yes.
specifically, I don't have the exact number. It is over $2 million. Part of it is federally funded through Title III, the Older Americans Act, but most of it is local funding.
And how many do you have? Excuse me, 1 minute, I'm losing my voice. And so, oh, this is getting worse, sorry. Now I'm back on the ranch, okay. So how many clients does your association carry? How many clients do you have?
So through the homemaker program, at any given moment, we probably have about 175 or so clients in that program. I know this year we're supposed to serve 250. I don't know if we'll get up to that, not because of the lack of demand and the lack of interest, but just because we have to stay within our budget.
All right, you have to stay within your budget, okay.
It is still, if you were to compare that program to the Medicaid waiver, the EPD waiver, It is a very cost-effective program because most of our clients through this DACL Homemaker program are receiving between 6 and 12 hours per week of service. They get short visits a few times a week. So it is really a very cost-effective program. It helps people to stay at home.
Yes, yes. Thank you. I just wanted to make sure we have that information recorded. Ms. Swaffberg, thank you very much for your testimony. And one of the things that I'm concerned with, you mentioned the certification exam. How does that work? You said only 443 individuals had passed it. Is the need greater than those that have passed it? And are they all working in DC and assisting households in DC or?
So all home health aides, which includes personal care assistants and all certified nursing assistants, CNAs, who largely work in institutional settings like nursing homes or assisted living, they all must take a 125-hour training program and then take a certification exam and pass that exam. In the district, we don't have enough training schools to train the number of aides we need. The UDC budget for their CTE program is being cut, and OSSI doesn't fund these programs to any great extent. But in addition, the number of aides who were certified last year, this is tracked by the Board of Nursing, 4,489 did not renew their certification. So that was a across the board 30% loss of workers. You can only work in DC if you have that certification. So we're down to about 10,500 from the number last year was more like 14,000 and something. So there's been a huge exodus of workers. We are not training enough workers to replace those who have left, and we are not meeting current demand or training enough workers to meet what we expect to be a much higher demand. In fact, the WIC in their last WIOA state plan found that home care workers are the highest demand profession, among healthcare workers. Home care workers in particular anticipated 53% growth in demand for these workers, and yet we're losing workers and not replacing them. So it's a very serious problem. And we've been talking about this for several years now, and unfortunately have not seen the investments needed, not only to raise the pay of these workers, but also to invest in the training that's needed for the number of workers that are needed.
All right, and you mentioned UDC. You're saying UDC is discontinuing?
Not discontinuing. I mean, again, we only have so much visibility into the budget. The budget books are kind of high level, but they have a CTE, a Career and Technical Training Institute,
right,
which is where they train CNAs. That budget was cut. Sorry, I've got to put my glasses on. It looked like they lost was 4.6 million from their Workforce and Development and Lifelong Learning division. And the note in the budget book was this was due to lower demand. One of the reasons why there's lower demand for those programs is that we're not attracting people to take these jobs and train for these jobs because they can make more money walking down the street and getting a job at Target to be a cashier or Walmart. And so why invest in this training when it's a challenging job, it's a difficult job, it demands a lot of skill, not just physical strength, but also a lot of skill in managing patients. And yet their pay is, through the Medicaid program, averages about maybe $18 an hour, but the starting pay can be much lower. It can be minimum wage.
All right, I I'm very concerned about this because we want to do everything we can to keep people in their home
Absolutely.
and to keep them mobile as long as possible. And so this is a very difficult arena to navigate. And again, as everyone knows, this is a very difficult budget cycle for us. But I just wanted to get a better feel for where we really are and why we have these circles of continuation where we still don't seem to get things done. No matter how we try, one action is, the reaction somewhere else. And so trying to break through that so that we can, get some finale to some of what we're attempting to do and the services that are needed in community.
If I could just add
Yes,
to
of
your
course.
point, one of the very big challenges here, and it's not just with respect to this issue you've heard about transportation and housing.
Yes.
These are issues that involve multiple agencies across the district government. With respect to workforce, we have OSSI, the WIC, DOES, DOH, Department of Healthcare Finance, DACL. That's just naming, I think, 6.
The Hospital Association, they also believe that they have a role to play in this.
And they do, and
Yeah.
we work with Jackie Bowen and Justin Palmer. We talk to them about this issue all the time. The concern is that we need leadership to pull these disparate agencies together around a comprehensive strategies, as other states are doing. They have executive leadership that has brought together the various agencies to develop strategic investments and planning around this crisis, which is not unique to the district.
Well, of course, I always get tremendously wonderful ideas from those of you who come down to talk, and we don't need another round of applause, but I think we're going to have a task force that looks at this issue of how we are looking after folk who need the special care, the special tender loving care, and what should be the process. Only I just don't want us to study it and study it and study it. And then most of us will never have an opportunity to benefit from the service if we study it forever. So we'll figure out how we can really get something going in the immediate, and then we can maybe continue the process long term. But we need to think about how we can do this in the immediate, because senior daycare is one good model that seems to work, but keeping people in their home, I'm sure the villages can attest to that. I know that even Friendship Place can attest to how they have helped folk stay in community and viably in community. So we really need to look at that. And then we have, of course, assisted living. There are a lot of things that happens in our world as we age in place, and we want to do that. But we want to do it with services that are really making a difference in our lives. And we have to demand it. And I suppose that's where we really are. We have to demand that. And maybe DACL is the coordinating point. But we need to have a body of individuals that are constantly putting forth those ideas. It's just not good enough to have some transportation, some food, some fun. It's about how are we living into the future? And so I'm expecting you all will advocate with me on that. So thank you very, very much for your comments today. Thank you. We are, I believe we have number Teresa Ann King Smith, who, all right, we want to make sure that you are up because I understand your bus will be picking you up soon. And then we have Stephanie Chow, who is the Executive Director of the Northwest Neighbors Village, Charles Turner, who is Executive Board Member of the Washington Wellness Center, and then do I have, is Hillary Kay? Oh, not yet. Oh, you moved her down. Okay, okay. And then Jocelyn Johnson, Chairperson of the Ward 4 Mini Commission. And Sharon Sellers, Senior Manager, Sibley Memorial Hospital. Okay, she's not here. Susan Sedgwick, Public Witness. She's online. Daryl Diaz, Public Witness. Monica Bilger, American Diabetes Association. And Adam Hiller, the DC Center. So we're going to start with Miss Teresa Ann King Smith because her bus is waiting for her.
Good afternoon, and no worries, because I made additional arrangements
Oh
in
my
case I missed the bus.
All right.
I am a Ward 8 resident since 1966. Happy birthday. And I'm a proud member of several organizations around the city, some of which we belong to together, and especially Congress Heights Senior Wellness Center. And some of those people I did encourage to go and get on the bus because they take a little more time to get down to the area. My background and love of the city is well documented in previous testimonies. And as I said to you in 2017, and you really helped us in several things, let us seniors help you help us. First, it's my understanding that the fiscal year budget for Congress Heights Senior Wellness Center has not increased in over 3 or 4 years. Now, as far as monetary concerns, the additional parking spaces and other renovations that are incomplete were already funded, and the money is somewhere within the DACL budget. However, I do want to take time to thank you and DACL for the theater room upgrades. Oh, they are luxurious with reclining chairs, lighting, and TV screens. So you'll have to come when you bring us that bundt cake. The addition of square footage was desperately needed and well utilized during some of our exercise classes and chess games. I would like to thank Director William Ritchie and his staff for a lot of hands-on assistance in making this happen. Another challenge that we have, though, are the ill-functioning computers for seniors. It's really unacceptable. We have DACL, defunct organizations and libraries that donate outdated equipment. I remember, and you may remember, the old-fashioned mag card and WordPerfect 4. We may be able to use them instead. Remember, and this is not to you, Chairman Bonds, because we are staunch supporters of you, but I would like other council members to remember that the baby boomers influenced their children and their grandchildren who are current voters. Congress Heights Senior Wellness members asked and were approved to receive additional and adequate parking places, and we would like to know when we're going to get them. My son was kind of miffed a couple of weeks ago because we had a presentation at Congress Heights and I had to walk about 4 blocks. He didn't know that, but he saw my car on his way home and he said that he was upset. Little does he know that some of the disabled people, I parked them near Blue Parking football stadium, and I walked back by myself. I don't think he would be happy that I'm taking that walk either. So if it's anything that you can do to help us, we would appreciate it because we have the land available. Now, how we help DACL and the council's budget is that a lot of us have expertise in several classes, and we volunteered that in doing line dancing classes, community news and current events, crochet skills, sewing classes, art and craft, spiritual studies, and more. We also encourage intergenerational teaching and learning by inviting some of the students to participate with us in certain ceremonies. Second, Stephanie Robinson of Model Cities may be interested to know that in 2023, a food sampling of various vendors for senior wellness centers was held at the Hayes Senior Wellness Center. I was one of the participants. A final report was supposed to be distributed no later than the early fall of 2023, but we were not able to get it as of now. Please note that the menu and food selections that we saw and tasted were delicious, they looked appealing, and the aroma was just delightful. If we could get some kind of feedback, we would like it because we hate to waste time on such a, as you say, a committee and with no results. Third, I would like to piggyback on the, I think it was Ms. Bryson said something about transportation to and from senior centers. Model Cities has a bus that picks up seniors and bring them and take them twice a week. We have nothing. And you so delicately and nicely help move us up on several of the panels in order for us to get the partial transportation to the hearings, which is very important. We also need in-house transportation for some of the seniors, and I, along with 4 or 5 other members, usually will pick up seniors and take them back home. But some people say that's not always optimal because we may have problems. Along with transportation along Savannah Street, we may want to encourage the use of speed bumps because some of the people think that's the Indianapolis 500 and some of the seniors walk very slowly across that street. And on Martin Luther King Jr. Avenue Southeast, they started road repairs and one senior actually turned her ankle trying to get across the street safely. Finally, as far as the Safe at Home program, I've had a number of seniors say that they have received help from the Safe at Home program, but they were wondering or complained about some of the chairlifts installations and subsequent mechanical problems. Seniors have called concerning repairs and received estimates of up to $700. And I was wondering, are companies responsible for a limited warranty on such devices? Or should seniors find some type of additional insurance in order to make sure that the equipment stays in order? Now, I've had wonderful experience with my request, but some of the seniors say that's because I'm in your face on with the council persons at ANC meetings, et cetera. So they just do it right the first time and leave. But I said, no, we want fairness for everyone. And finally, I would like to give a standing ovation to a lot of the council people that come into the community on Saturdays, Sundays, and evenings on a regular basis without TV cameras, radio acknowledgements, and all the fanfare, just to work with us in our community. Community associations, funds and games, conversations, and they include, may not be limited to Congresswoman, see, I'm promoting you already, Councilperson Anita Bonds, who is also a member of our Bellevue Neighborhood Community Association, Robert White, who attends our Interfaith Ward 8 activity sessions, Trayon White, who attends everything, and also you, Director Hines, who have come to the center and eaten with us. Thank you, and if you have any questions, I'm available.
Thank you very much, Ms. Smith. Thank you very much for you're always have a lot of information to share, so thank you very much for that. And now we will hear from, let's see, want to make sure Ms. Johnson, we'll start back on the original list now. All right, Ms. Johnson, yes, thank you.
Hi, Councilmember Bonds, and happy birthday to you as well.
Thank you.
I want to say that. Actually, I don't really have a speech today, because I actually thought the DACL was taking me off of your list. I had some issues, and I talked to them about it, and I thought that I told them to take me off because I thought the issues were resolved. Actually, they are not. So I was going to ask you, when is the deadline for submitting a written testimony? If you would tell me that.
I believe it's May 1.
May 1st?
Yes, May 1.
Okay.
So please get your information in.
Yes, I want to do that. I do, just as I leave, because, I would rather put it in writing. But when you were asking about a call center, and all that for seniors to be in the front of the line, that will probably work until it doesn't work. That's the problem. We get things, they start off really good, and 5 minutes later, and we really need to see some things actually happen. So hopefully that one of the things that I can just leave with you now is that maybe you need to have some seniors actually involved as a behind the scenes group, liaison kind of group, to kind of feed you the key questions to ask, so that while they give you all the rah and the good talk, because it's all good talk when we sit here, but when it starts working back home for the folks back home, it really stayed on this table, and it really doesn't translate back to the folks back home. So that's what I wanted to say, but I will provide you my concerns in writing.
All right, well, I appreciate that, and I appreciate your, somewhat criticism of the process, because we do endeavor to make these hearings as transparent as possible. And short of being rude to each other, we try to put the real deal on the table, so to speak.
Exactly.
So please feel comfortable sharing. If something is not working, we can't fix it if we don't know.
If you don't know. That's
Yes.
what I would like.
And we're at a point where we just do not choose to waste taxpayers' dollars. If it doesn't work, it just doesn't work. And we may need new models. Some processes have been in place for decades, but the decades have moved forward, and it may require a different application. So we need to know that as well.
And as I leave, I just really want to say that that's what our sentiment is. We want to see it work. And because this budget has such a big shortfall, I want to endorse what your previous committee said. 500 and some million or $1 billion for a sports arena. I'm sure that works where it works. But you have some real hard line stuff that we want to tell all of the council. They need to consider that, because we need to tell you and have some real straight up conversations about where the money probably will work a little better.
Well, and I appreciate that. And it's not lost on me that, you are a body of individuals with a lot of wisdom. And so you therefore must know that in any city, There is the economic engine that helps to keep the various services in place. And in the District of Columbia, it is to a great degree our business sector. And when revenues are down there, and we all know that that's the case, we can see the vacant buildings. And that means that we're not bringing in taxes through that. So that means our bottom line is down. And so that also then affects the services and the operating activities that we're engaged in. So that's why we push so hard for the economic, I'll call them demarcations that we have throughout the community. They're critical. DC does not grow corn. We don't even make solar panels. We have nothing that we export. Nothing. In fact, 70% of our employment base, those who work in the city, not the government, but 70% of those who work in DC are non-DC residents. We cannot tax their income that they make here. It goes out where they live.
Right.
Okay, and so we're kind of like in a little real tight, tight fit here. And so when we can, we try to put resources towards our economic engines, which tend to be those places that people will congregate at and will spend money. And that tends to be hospitality and amusements. I wish you could see with me every day the number of visitors that we have in this city. It's absolutely amazing. And they're buying sandwiches and things like that, we hope, spending money here. So that helps us with sales tax. But the real estate tax, which was the real engine, it's down a little bit. There have been businesses that buildings that were valued at $200-300 million. And so you can figure what the tax would be on that they would paying every year. But now they're selling for 37 million. And that's the truth. And so things are not the way they once were. What we have done as a community, we haven't quite learned how to live within this new means. We just haven't. And I'm not suggesting that we're all going to have to go out and get us a chicken and care for the chicken. The chicken brings the eggs in, nor am I suggesting we're going to have to go out and plant all our veggies in our window boxes. But things are different. They are truly different. And we just have to
The good
figure
thing
that
though,
out.
with your seniors is we learned, that's how we were raised. We kind of know how to do it. We kind of, you don't have to really tell us like you have to tell some of the younger people. We were raised that way, we get it. But we do want to, the Ward 4 Mini Commission looks forward to June 13th when you're supposed to come and speak to us.
I will be there.
And we want you to please come because we got a lot to tell you.
I bet you do. Thank you so much. Thank you. And continuing on the list, and forgive me, I didn't mean to run into too much chatter. Let's see. Mr. Hiller, are you on? And I see Stephanie's here. Okay. Mr. Hiller, you're up next.
Thank you.
Hear from you. Okay. There you go.
Thank you. Happy birthday, Chairperson Bonds, and
Thank
hello,
you.
members of the committee. My name is Adam Heller, and I have the privilege of running the Older Adults Program at the DC LGBTQ+ Community Center. The primary goal of our Older Adults Program in the last 10 years has been to combat the unique social isolation our seniors face. We have been diligent in creating a variety of programs to meet these needs. With the support of DACL, the DC Center has been able to provide 2 weekly support group meetings, like my colleague said, allowing older adults from across the city the opportunity to mingle, share their stories of their lives, and create support networks for navigating the challenges of health and general well-being. As you may know, we are moving the DC Center to a new site in the coming year next to Howard Theater and just off the Shaw Metro Station. In this larger space, we'll be able to better meet the needs of our seniors and of with their vital life and human supportive services. Specifically, we'll have a better space to prepare and enjoy meals, improve capacity of exercise classes, foster intergenerational dialogue, and host more educational seminars covering a variety of topics. Though we believe our older adults program is thriving, the top consistent feedback we receive is the ever-growing need for an LGBTQ plus dining site to provide more meals and more exercise opportunities, but we stretch our staff and his budget as far as we can go and cannot meet these developing needs, unfortunately. We look to the generosity of the city for further support and partnership to address these needs in the form of more resources to grow our current meal and exercise programs. Our older adult program has been active for 10 years now. We are at the beginning of seeing our first wave of seniors starting to pass on, unfortunately. LGBTQ seniors, many of whom have had little to no contact with their relatives, have found a strong sense of community by coming together at our location to lean on each other in times of crises and loss. We honor their memories by ensuring our services support future generations. Our new community center will triple our space, but it will also triple our rent. Although build out on our new community center is 70% complete, we still need to raise 1.5 million in capital investment and 300,000 to assist in subsidizing the annual cost to maintain the new center and to best represent Washington, DC. As some of you may know, next year our city will host World Pride, which is a global event that spotlights LGBTQ plus excellence of its host city. There will be a spotlight on the LGBTQ plus community center, and the building it lives in will have an impact on how the world views DC and the fight for equality. We need your support to reflect all the work we in the capital and the nation have accomplished. Like my colleague Justin Johns mentioned, we're looking to further investment in the programming to support our older adults, specifically in the form of a robust LGBTQ plus dining site by increasing our current DACL grant to $70K. We are also here before you to request, like I mentioned, an annual commitment of $300,000 to assist in subsidizing that annual cost to maintain the DC Center, as well as the $1.5 million in capital investment to ensure its grand opening in the near future later this year. With that said, thank you for the opportunity to testify, and I'm happy to answer questions, and happy birthday again.
Thank you very much for your testimony. All right. I have here Monica Miller.
Yes.
There you are.
Hello.
All right.
So first, Chairperson Bonds, happy birthday, and Chairperson Bonds and honorable members of the Council of Executive Administration and Labor, thank you so much for the opportunity to speak with you today. My name is Monica Bilger, and I'm the State Government Affairs Director for the American Diabetes Association.
Okay, Ms. Miller, could you speak up just a little bit? We're missing part of your.
Oh,
there you go. Now we hear you much better.
And I'll try to be a little loud, okay?
Okay, thank you.
I'm here today to ask the council to implement No Senior Hungry by funding this critical 2023 law in the DC Council budget. The ADA is extremely concerned with food insecurity as it is associated with higher rates of diabetes and obesity. A healthy diet can help decrease the risk for obesity and chronic diseases like diabetes. Unfortunately, food insecurity has heightened consequences for seniors where adequate nutrition is essential to the prevention and management of their chronic health condition. According to ADA's statement on sociological determinants of diabetes and prediabetes, those with severe food insecurity have about twice the risk of diabetes compared to those without. Ensuring access to nutritious meals is also critical for those already diagnosed with diabetes. Missing meals can disrupt blood glucose levels and put individuals at higher risk for hypoglycemia or low sugar. Additionally, if the only accessible meals are unhealthy, An individual with diabetes may experience high blood glucose or high sugar levels, which can increase risks of hospitalizations, poor mental health, which has been touched upon earlier, and diabetes complications. And for those that may not be aware, diabetes is actually the leading cause of heart disease, of stroke, of kidney failure, of blindness among adults, and amputation in the lower extremities. We know diabetes is an epidemic in America, and the district shares this national story with 9.1% of adults diagnosed with diabetes citywide. But if you focus in a little closer, the picture changes, and we can see that in Ward 5, 12% have diabetes. In Ward 7 and 8, estimated 12.7 to 13.5% of adults are diagnosed with diabetes. Recognizing there's concerns of balancing programmatic costs in the budget, I urge you to consider we simply can't afford to let seniors experience chronic disease complications. Americans with diabetes have medical expenses 2.6 times higher than those without. In 2017, it was estimated that the total direct medical expenses for diagnosed diabetes in DC was $428 million, and indirect costs from loss of productivity due to diabetes was $271 million. For a total cost of diabetes at $699 million. This far exceeds the cost of this program implementation. According to DC Hunger Solutions, the district also has the highest percentage of seniors who are food insecure in the nation, a staggering 14.3%. Approximately 12,000 individuals in the district, seniors, lack consistent access to enough food for active, healthy life. So for that, what I just outlined, just thinking about those 12,000 with those chronic disease conditions, just thinking of the cost they endure and the cost the city endures because of what they have to go through. It's imperative to address this disproportionate impact of food insecurity in the district and prioritize funding No Senior Hungry, which will help connect the district's food insecure older adults to critical nutrition programs such as SNAP and the Child and Adult Care Food Program. We can and must do more, and I urge the DC Council to fund No Senior Hungry. Thank you so much for your time and consideration, and we're happy to be a resource at any time needed. Thank you.
Thank you very much for your testimony. I think we have, maybe before you go, I wanted to make sure I collected. Are you saying that there are 12,000 in the District of Columbia that have diabetes, or are you saying that this is a number that a nonprofit has identified as potential?
That's the number that was identified as how many food insecure seniors there are in the district. I don't know how many of those may or may not have diabetes, but we do know that the populations with diabetes in areas of Ward 5, 7, and 8 are just so much higher than the general population in the rest of the district. So we don't have the correlation between the two, but it's going to be probably similar when you overlap the maps.
All right, and you're saying Wards 5 and 7 have the highest?
5,
Okay.
7, and 8. Portions
And,
of
and
Ward
8
5,
also.
portions of Ward 5 and Ward 7 and 8 have the highest incidence of diabetes.
All
much
right,
higher
okay.
than the general perspective of the city, which
All
is
right. In other words, these are not numbers that are coming from the medical profession. These are not individuals who actually are being seen by their physician. These are people who may have diabetes and not know it or have not been diagnosed.
No, those are percentages of people that have been diagnosed with adults with
Okay.
diabetes. So there's even more that may have diabetes and are unaware.
All right, okay. And so if they have been diagnosed, is it fair to assume that they have a meal plan that they're following?
No, sometimes the problem is people are diagnosed and they may be given some information depending on the provider. They may be given some information on how to eat or what to eat, but sometimes that doesn't happen. And oftentimes people lack the resources to know exactly what the best food sources should be for them. And a lot of times that's what we're looking for. We think that, you know, the No Senior Hungry would allow that nexus to help establish a place where they have more access to folks that can share information with them, provide the resources they need, connect them to the food security that they so desperately seek to be able to eat the appropriate types of food and have access to those types of food.
All right, well, I would think that if my physician indicated that I was to eat certain foods, I would do that as opposed to the government saying do it. I would be more inclined to listen to my physician, so I'm a little confused, but thank you for that additional information.
I'm sorry, if I may just add one more point. There, especially in Ward 7 and 8, the access point to getting healthy foods is much smaller for individuals, especially in those wards. It's like 3 times that of folks that are in other wards are able to access healthier food. So even if you have that information from your doctor, which is not assured that you do, then you don't necessarily have the access to get to that space. So we really think that this is an opportunity to increase communication and ability and availability to what exists that already exists in the district to get folks to the right type of food, as well as getting access to that food.
All right, well, thank you. Thank you very much for that. I was a little confused. Okay, thank you. Then Daryl Ditz.
I'm there, maybe.
Oh, okay, I'm following 2 things. The camera and then, of course, all right. And you are Mr. Humans?
Turner.
Mr. Turner?
Yes.
All right, Mr. Turner. Okay, please go right ahead.
Thank you, Councilperson Bonds, and thanks for the opportunity to speak as a member of the Executive Board of the Washington Senior Wellness Center and as a Ward 8 liaison to the AARPDC. I'd like to add my congratulations on your BD. And this is the 4th or 5th time I've testified before this committee, representing Washington Senior Wellness Center membership and communicating their concerns and challenges that our senior members have expressed. Each time I've testified in the areas of senior self-determination, transportation, and the nutrition or the meal program at the Wellness Center. But the previous speakers have spoken eloquently and specifically on those issues. So I'll just echo their appeal, and I'll primarily focus on the Washington Senior Wellness Center building at 3001 Alabama Avenue Southeast. That was the first building that was built to be dedicated as a wellness center for seniors. And more than 30 years since then, there's been no improvements to our building to increase its capacity to serve our members or serve our increasing senior population. I've read that our senior population has increased 30% since that time. Our active senior participants are around 350 members, and there's not enough space to properly serve the needs of our membership or our existing programs, and definitely not to allow expansion of those programs or adding new members. Because of our location, we attract residents from both Ward 7 and Ward 8. So some of the events that we've had, our members had to eat in classrooms or in the patio, weather permitting, where they missed out on seeing or fully participating in the activities and enjoying those activities. We have a balanced class that has had to meet in our computer lab, which means that the our members that want to use the computer can't use it during that time. The well-renowned Simply Memory class, because of the number of participants that are interested in being involved with it, has had to meet in our multi-purpose or dining area, which limits or inhibits any members from enjoying other activities there. These are just some of the ways the enjoyment, the activities, and desires of our members cannot be fulfilled due to the space limitations of our present building. Our membership asks that funding be added to DACL budget so professional feasibility studies can be done to study the best way to increase our physical footprint. I understand that the land around our building is under the authority of GSA, which is an indication that the DC government possibly owns that land. Also, depending on our architectural studies, there might be the possibilities of adding another level to our building or a multi-level addition to our building. I was handed some information when I came in, and I'd like to read some of the items on it. Ward 8 Wellness Center has a movie theater. Ward 1 Wellness Center has a rooftop terrace that looks over the entire city. Ward 4 Wellness Center has an open-air giant water display. Ward 5 Wellness Center has a brand new extension to provide more space and activities. And I understand that Ward 8 Wellness Center also has an addition. In addition to that, a new center is being built. But us at Washington Senior Wellness Center are still functioning in a over 30-year-old building. I just ask that, and we know that it's a couple capital budget item and the money can be put in for the next year to build a building, but at least we can get a feasibility study to find out the best way in which to add to our capacity to serve more seniors. I'd like to leave with four things in answer to some questions that you had asked before. In reference to the transportation, I am a participant in the Transport DC and the Connected Card program. Using both of those programs, I can attend the Wellness Center maybe 10 or 12 times a month. That's if I don't go to any doctor's appointments, do no food shopping, go pick up pharmacy drugs at the pharmacy, or any other activities. And in reference to the lack of home health care aides, I've been trying to find one for 6 months. And in reference to the call center that was suggested, I suggest if there is a call center established, let it be established and manned by seniors, and given a subsidy for manning the center. And one last thing I'd like to point out that most of the agencies, departments, organizations for our seniors in our city employ or have very few seniors in any decision-making position. I just want to know why. Thank you for the opportunity to testify. Any questions, I'm welcome to answer them.
Thank you, Mr. Turner, and I'm not trying to be catty, but I would love to have more of us. Okay. Thank you. All right, now we can go to Mr. Ditz. Okay, Mr. Ditz, we'll take your testimony.
Yes, thank you, Council Chair Bond. Good morning, I should say. Good afternoon now. I'm still thinking about cake, so happy birthday to you. My name is Daryl Ditz. My wife and I are 30-year residents in Ward 3. And I thank you for the opportunity to be able to share our experience. I'm testifying today in support of the modest funding for the dementia specialist to help coordinate or navigate the DACL regardless of age. And this is relevant for the estimated 15,000 DC residents who have Alzheimer's or other dementias and their caregivers. I was diagnosed with early onset Alzheimer's disease 3 years ago at the age of 60. I had 2 independent brain scans as proof, and I thought that would have been made me eligible for Social Security disability because it's a listed disease under DC. I was denied. We hired an attorney to try to challenge the decision. Months went by. Eventually I qualified, and it was kind of a nightmare, I could say. But Medicare doesn't fully cover the expenses, and we're going for Medigap, and it's quite difficult to do that when you're under 65 years old. The point I really am trying to say is, does it really have to be so difficult for people? I really think not. We're very fortunate. We've got all kinds of benefits. My wife turned to doctors in her family, lawyers in her family, but so many people don't know where to start. And I think the idea of this dementia specialist is to kind of open doors or paint the path for people to follow. It can be maddening. And these are people, especially someone like me who's not quite on the ball for all this stuff, and for caregivers who are struggling with all kinds of other things. We really think I really think anything that can make this simpler or easier for people to navigate is an important thing. Anyone dealing with Alzheimer's and other dementia knows that time is precious. Please consider the benefits of easing the burden with a dementia specialist. I've learned recently that other counties and other states are already doing this, and I think if DC could set its mind to it, it would be a great benefit. Thank you for your attention.
Thank you very much for your testimony, and thank you for your patience. You've been here since we began this morning, so thank you. I've seen you here. I know everyone else has been, and you've been here as well, 100%. Now, I know that some were out having a little refreshments, so yes, okay, all right. So you didn't get the refreshments. There are refreshments, so you.
I'm waiting for the cake.
Well, the cake, most definitely. We have chocolate cake and we have regular, what is it? The yellow cake. So we do have cake. And the cake is available to you, and we have enough for everyone. We have big cakes. I don't know how to, we're doing a hearing, so you go to I hate to ask you to do this, but go to 404, right around the corner, and there is cake.
Excuse me, I think he's mentioning when we invited you to Congress Heights Senior Wellness Center again, what you owe us of your personally made cake, and that was a 2-year ago commitment.
I will do that. Thank you very much. Thank you. I will definitely do, but no, there is actual birthday cake in the building, in room 404. So those who are very mobile can go and get for others. And we have plates and what have you. Okay, please do enjoy. Otherwise, I'll be forced to try and eat a lot myself, and I do not need it. Thank you. Okay, good. Please.
You can bring it back in. Keep listening.
Yes, of course you can. Our next witness, is Susan here? Okay, Stephanie Chow, who is the Executive Director of the Northwest Neighborhood Village. And then I'm moving to Robert Brennan, who is here, public witness. All right,
well, good
Hi.
afternoon.
You are.
Happy
Yes, we-
birthday.
Thank you very much.
I hope you get a piece of that cake that you're talking about. Well, thank you for having this hearing on your birthday and spending your day with us. I want to thank you, Chairperson Bonds and members of the committee. I'm Stephanie Chong, as you mentioned, and I'm the Executive Director at Northwest Neighbors Village, one of 13 member villages of the newly formed DC Villages Collaborative. I want to thank Mayor Bowser, Councilmember Bonds and her colleagues on the council, and Director Hines for your ongoing support of senior villages. I want to share my support of the proposed funding for villages in the FY25 draft budget. Villages, as you know, are the grassroots response to our cities and our nation's older adults' burgeoning desire to remain in their homes and live independently for as long as possible. Our work reduces social isolation, supports instrumental activities of daily living, and offers a local and trusted resources that helps older adults remain engaged in and connected to their community. This is all done in a cost-effective way by leveraging the time and talents of trained and vetted volunteers. My colleague earlier, Denise Snyder, the Executive Director of Foggy Bottom West End Village, shared statistics from the DC Village's impact in the first quarter of FY24. Her reporting underscores our growth. In comparison, collectively last year, 1,300 DC Villages volunteers provided over 24,000 services to their older neighbors. These caring local volunteers dedicated time equivalent to 16.5 full-time employees, in comparison to the 20.5 full-time employees that Denise shared earlier. They work to reduce barriers to accessing medical care by providing door-to-door rides to both preventative and vital medical appointments, tackle our nation's loneliness epidemic through one-on-one social visits, group gatherings, and transportation to social events and opportunities. They've maintained members' safety with the help of simple home repairs, and provided crisis prevention by reporting concerns about a member's well-being to village leadership for follow-up and connection to appropriate services and support. Thanks to DACL support, the DC Villages have become a trusted resource in the community, an important part of the city's aging services infrastructure. Together, the DC Villages supported 9,700 older adults last year, and that number is expected to grow. Each of the 13 villages have experienced growth in membership, volunteers, programs, and services over the past few years. As my colleague, Ms. Snyder, demonstrated, the need for the DC Villages' effective and affordable service delivery model is clear. While each village is designed to meet the unique demands of their community, many have witnessed the need in nearby underserved areas of the city and have expanded their reach to help more older adults access benefits and get connected with DACL services. As a collaborative of 13 villages, we have leveraged our collective strengths to serve more older adults with comprehensive services and programs that were made possible through our work together. This unique and truly special partnership has led to the DC Villages creating a formal collaborative, of which I'm delighted to share is led by our inaugural director, Dr. Katrina Pohl. Dr. Kat, as she is known, has spent the past 2 decades working on issues at the heart of aging in the community. She brings an incredible level of professional, academic, and lived experience to the district's village movement and understands the critical role villages play in a network of services for older adults in Washington, D.C. Since assuming her role in February, Dr. Kat has hit the ground running, leading our collaborative efforts to strengthen and expand village services. I am so very excited about the future of the village movement in our city and very grateful for your ongoing support. Thank you for the opportunity to testify at today's hearing, and I'm available for any questions you may have.
Thank you. Thank you very much for your testimony. And I believe for this panel, do we have Ms. Sellers? Not yet. Okay. All right. Mr. Brennan, I'll hold you since you're here. Okay. All right. We've got a duel. We got the video and trying to make sure. I appreciate you all's testimony very, very much, this panel, and I understand what you're saying, Mr. Turner, and I heard you loud and clear, and you're wondering, but you know, sometimes there are structures in our city that have stood the test of time, and they are built so well that 30 years is like the beginning of their life cycle. Have you given thought to that? You think maybe just going up might be a solution?
Architectural study, part of the feasibility study could be an architectural survey to find out if there's enough support, or would they need more support beams put in, or what it would take in a couple of elevators it would take to put a second floor, a pop-up on it. I mean, pop-up seem to be the rage in this city, so pop up the wellness center.
All right. Well, let me ask you, is the neighborhood where the center is located, is that too growing in population?
Yes, it is. We have Skyline Tower, a Skyline development that it was built. They has some housing units in it. They have additional housing units being built near where Naylor Gardens is, garden apartments are. So yes, they're increasing the stock of housing, and so, and we are increasing. And although we're baby boomers, we're still the largest group in the city. So one of the largest groups in the city. So we still have the need, and we love the building. There's nothing wrong with the building. Sometimes old things are good things, but we just need more capacity, more space. Yes.
All right. And so you're feeling strongly that you legitimately have and the enrollment is outside of the space. The space is constrained.
Yes.
You have to deal with
I really
that.
do believe that,
Okay.
because I've heard that from some people when some people have come to our orientation, and I'll see them later and ask, you know, why didn't you continue coming back? They say, oh, well, I went over to Congress Heights, they got more space.
All right. Well, thank you. Thank you very much to this panel. Thank you.
Thank you so much, and hopefully you'll enjoy your birthday dinner.
I will, and remember 404, and that's for any one of you who would like, it's there for you. We planned for you to have some, apparently. I didn't plan it, but the team did, so I'm very thankful for that. Yes.
Thanks for one last thought. I've really been humbled by what I heard the last several hours, the struggles that people are going through, the budgetary difficulties and all that. But one thing that really sticks with me, I heard early this morning that DC doesn't have an Alzheimer's strategy. And we are basically #1 in the country, not something to be bragging about. And I have this feeling like, after hearing all the agencies and the complications, it's like we have this giant jigsaw puzzle on the table, but no picture. And you know, whose job is it to kind of create that for the city, for the district? That with you. Thank you.
All right. Well, we are going to tear into that. And you know, the budget process, yes, the mayor has done her best to send to us a budget that reflects those categories of expenditure that the agencies have presented. And now we've had the additional, or we will have the additional input from those who are partakers of the services. And for my money, that's where the rubber hits the road. And that's how we hope to, we have to do that because we have to service the population that needs the services. So that's what we're about. So And the very best to you, sir. All right, okay, and you see you've got a team of people already helping you. All right, that's the way it works. That is definitely the way it works. Thanks again to this outstanding panel. Mr. Heller, I made some notes. You're being very modest in what you're asking for. So let's see, and this, it seems to me when we have times when we don't have all that we would like to have or all that we are familiar with, it's time for us to buckle down and make sure that where we perhaps have not put resources, but we know that the resources are needed, that we make sure that we do just that. So that's how I'm looking at some of the testimonies that we've already heard today. So thank you very much. And Ms. Child, thank you so very much for the work that the villages do again and again. I take it. We are going to, if you would just give us 10 minutes, we just need to take a personal break. And you know what I mean. Thank you very much. Be right back. 10 minutes max. Okay, thank you.
Hello, hello. Hello. Hello, hello, hello. Hello.
our hearing is resumed and our first witness at the witness table is Robert Brennan. And then we have Roberta Human and Betty Gentile. Kevin, okay, Eugene Lewis. Anthony Brown. Laura Grant. We have Hillary. Okay. Hillary Kay. You. And we have, and Eva Lucero, we have you. That's it. Who? These are already, okay. All right, we're gonna go with this team. We could take one more at the table if you're on our list.
Council member, Mr. Brown is coming back. He went to get some cake at the last.
All right, okay. All right, so we have a full complement. Hillary Kay, you're missing it. All right. All right. That's fine. So don't be shy about the cake. There really is cake if you would like it. Yes. Well, we're glad you are celebrating with us. Thank you very much, Mr. Brown. Thank you. Thank you all. Thank you all you're very kind. Thank you. I didn't plan it this way. It just happened this way. So I appreciate it. It was good. Excellent. All right. Thank you. So we are going to start with Mr. Brennan. Would you start?
Greetings and salutations, Chairwoman Barnes and members of the committee. My name is Robert Vincent Branham, and I am pleased to offer testimony on the fiscal 2025 budget for the Department of Aging and Community Living and the Department of Human Resources. I want to commend you and Director Sharon P.W. Hines for your leadership. I also want to join in this collective room filled everlasting praise for your birthday. May God bless you. It would be difficult to conjure up a duo of district agencies so critical and so interconnected to the well-being of district residents and employees across race, income, age, and ethnicity. The services provided by DACL and DCHR bear great fruit and benefit. These agencies with proper funding, direction, and oversight contribute mightily to the quality of life for many, particularly seniors. I strongly urge the council not to reduce appropriations to these agencies. I would recommend the council consider revenue enhancements to secure the funding for these agencies. Madam Chair, please know that I align myself strongly with the poignant and heartfelt testimony, written testimony to this committee by Joan and Joe Bowser, mother and father of Mayor Bowser, who you and DACL Director Hines know well. Let me say, as one who has dedicated my community service to include sacrifice and assistance to seniors for much of the DC community family, I sympathize with you and government leaders as you collectively prioritize public policies The choices presented are serious and will have a distinctive impact on us all. As I look across this council and this government, represented by the directors of these agencies, I see people who seek to serve. I see friends. Yet as I breathe and walk closer to my ancestors, bearing joys, triumphs, sadness, and disappointments of life, I am reminded friends can break your heart and disappoint you. They can be guests in your home. You can be a guest in theirs. Still, friends can break your heart and disappoint you. You can come before this council to testify on their behalf. You can walk with them, talk with them, march with them, vote for them, maybe even get arrested with them on behalf of democracy and statehood. Still, friends can break your heart and disappoint you. One of the saddest things in life is to have a friend betray you or to no longer trust him or her will keep their word. The question then arises, when does inner peace come? It comes when it no longer bothers you like it used to. That's peace. True friends bring out the best in us and sometimes are able to spot our strengths better than ourselves. True friends and people of honor and integrity don't lie or bear false witness. A heart at peace gives life to the body, but envy rots the bone. This 2025 fiscal budget should represent and present a bond among friends, an honor among friends, a commitment to serve those who are the least of these. In earlier testimony, Madam Chair, there was reference made to the Affordable Connecting Program. That is a federal government FCC program that I participate in. And my carrier, you praise Infinity. I want to give a shout out to Verizon since they were the ones that I deal with. And I just want to say that it's good to be here, and it was great to come in this morning, this afternoon, and see so many people of great experience testify before your committee. I thank you.
Thank you very much for your testimony, and I will have some questions about the connectivity program from your perspective later. Ms. Gentile?
Greetings, Chairperson Bunn and members of the committee. My name is Betty General, and I'm the Senior Advocacy and Community Engagement Specialist at Sum Incorporated. Thank you for the opportunity to testify. Since 1970, Sum has been combating poverty, homelessness, and hunger through our holistic, whole person approach, including vital senior programs. We aim to help our aging neighbors maintain independence and enhance their quality of life through offering affordable housing, community resources, and supportive services. Our partnership with DACL is foundational to Sum Senior Services' success in meeting the needs of low-income and isolated seniors in DC. Sum recognizes the challenges in the FY25 budget and the necessity of tough decisions for balance. However, we emphasize that this budget should prioritize meeting needs without burdening those historically marginalized and excluded. We urge the committee to prioritize senior housing stability, safety, health, and wellness over scarcity when evaluating the proposed DACL budget. For Sum, commence the proposed increases in outreach and activities and in assistance and referrals. While the specific purpose for the allocations are not named, it's widely recognized that senior isolation is a significant challenge in the district. This issue has posed considerable difficulty for DACL and the senior provider community. Therefore, Sum eagerly anticipate that these augmented investments will facilitate greater access for seniors to essential services and programs. However, our primary concern, echoing the sentiments of seniors engaged in our day programs in Ward 4 and Ward 7, is transportation. And we are unsure whether the $325,000 increase in the transportation line item will address some of the pressing needs expressed by seniors throughout the city. We continue to strongly advocate for the reinstatement of a transportation service similar to the Seabury Connector by DACL. While we value DACL's provision of transportation grants for charter buses during field trips, our ability to engage other senior communities has been hindered by limitations on such trips. Seniors frequently cite transportation barriers as a reason for not participating in our senior centers. Moreover, our Ward 8 Senior Center census remains below pre-pandemic levels, primarily due to the absence of safe, affordable, reliable, and responsive transportation that meets the mobility needs of many seniors. Despite not being a perfect substitute for group vans, the Connector Car has been valuable for many senior center participants and residents, with some hosting workshops to help seniors apply and use the Connector Car after receiving the ARP Community Challenge Grant. However, funding issues led to some seniors not receiving their entitled amount or being placed on wait lists. We hope DACL now has a better understanding of the need and has appropriately budgeted for it in the FY25 proposed budget. Next, Washington, D.C. continues to maintain a high senior food insecurity rate, leaving tens of thousands of seniors without consistent access to affordable, nutritious meals. While the increase in the nutrition programs is positive, we urge for stronger action to eradicate senior hunger through enhanced cross-agency collaboration driven by a strategic plan. We advocate for full funding of the No Senior Hungry Amendment Act of 2021 and the Senior Nutrition and Wellbeing Amendment Act of 2022. Also, despite the absence of funding for Give SNAP a Raise in the FY25 budget, we urge this committee and DACL to join forces with agency partners and council members to consider funding an increase in SNAP benefits for seniors. Seniors who often only qualify for the minimum benefit amount have benefited significantly from the temporary increase. Last, we strongly urge Director Hines and DACL to become vocal advocates for increased affordable senior housing in DC, despite DACL not being a housing agency. The 2023 point-in-time count revealed a troubling trend that adults aged 55 and over accounted for the largest proportion of unaccompanied homeless individuals at 32%, which is 1,326 individuals. Additionally, based on our interactions with seniors at some senior centers and in the community, their paramount concern revolves around affordable housing. Providing adequate housing for seniors directly translates to improved safety, better health outcomes, and an overall enhanced quality of life. Therefore, we hope that DACL will explore avenues for cross-agency collaboration to boost funding for low-income housing and subsidies for our older neighbors. Some values the chance to provide these remarks and the pivotal role we play in guaranteeing that every DC senior has access to the vital connections and support necessary for thriving. Thank you.
Thank you very much for your testimony. And you are Ms. Grant. All right, Ms. Grant, Ms. Laura Grant, please.
Ms. Bond, I'm glad to be here and to see you, and happy birthday.
Oh my goodness, thank you, Ms.
I
Grant.
want you to help me to get transportation out for the seniors, because I have transportation, but they don't have transportation, and I've been going there almost 10 years, and it's a nice place to go, and to keep you from being depressed and all that. So I hope you can help us to get a bus and come out, so the rest of them can come out.
All right, and
I have a bad, but because my son-in-law is a retired police, and he brings me back and forth. But people in my neighborhood used to come out because we had a bus with CDL, and now there is no election, and they don't have enough money on their check to pay to come, and it's so bad at the bus stop now. So could you help us? Thank you so much, and happy birthday.
Ms. Grant, can you tell me where the neighborhood is? I don't know what your neighborhood is.
It's 8th district, right behind the 7th district precinct.
I know where it is.
That's where I live at, right in those houses back behind.
Okay. All right.
Knox Terrace.
Yes.
On the Alabama Avenue.
So,
and I told I participated in some senior centers, and I've been going there almost 10 years, and had Denise, and I saw one of my other ones, Joan, and Betty been our.
all right. So your question is, how do we get transportation for the many residents and
would
not
like to come back out?
Yeah.
Like we used to have before the COVID.
I see.
And now they don't have, and then a lot of them where sometimes I have to catch my cane, but a lot of them have walkers and stuff. They would love to come out, cause my doctor told me it's hard to be sitting up in the house. And if Miss Emma Price didn't get me to Nice Stoney, I'd be sitting up in the house, look at the full water, and that's not good for us old people. So please give us a help. Thank
I
you.
will work on that. Thank
Appreciate
you.
that.
I hope we can help you.
Thank
And you have supporters. Most definitely. Thank you. Mr. Brown. All right.
And good evening to all participants. I was speaking on the same thing about transportation. It's been really hard because like right now I'm sitting down in severe pain because of transportation problems. You call 2 and 3 days ahead of time, you with the Connectors program. When I use the card, I'm going to the same 2 places. I looked at the last transfer and it charged me $43 to go to a $12 place. So all the money is gone off my card. Then what happens then is when you try to make a complaint, what happens is you get put on these automotive things. So what you talking about? We talking about 4 to 6 months before you hear anything. So if Lyft took my money, I called Lyft and reported to the Connectors part, you still gonna wait 3, 4 months before you receive anything, if you get anything. And where we're located on Marionberry Avenue now is I just found out that I could have took my ID and got it changed for free because they changed the name of the street. I didn't. We have some severe problems right there where we're located. We're across the street from the library and the little shopping center. What they have is like a stop, slow down. I've witnessed at least 5 people, and I'm new to Ward 8. I lived all over the city for years, but Ward 8, I have seen more complete crazy stuff. And I'm saying that as nice as I can, because when you leave from where we're located at to go across the street, you need some skates on and somebody pushing you. Because when we come out of our door, we're right at the corner. They have the slow down signs. People speed through there. They cut around the buses. It's no place for you to get out of your cab or whatever close enough, that we don't have to walk, like from here to the door around the corner. So those are the things, and just like Ms. Laura was saying, you can't get participants when they got to spend the little bit of money that they already got. The SNAP benefits and stuff like that. But I mean, $60, everything is better than nothing. But $60, what am I going to buy with $60? Before I get to the counter, I just spend $60 looking at food. So when we, the transportation piece is vital. I'm missing going to doctor's appointments and stuff like that. And then the people, they don't call back. So I'm calling you to find out why you didn't come. Or you called me and told me I didn't show up. But you dialed the wrong number. I'm still standing in the front door. I'm an hour and a half late and I just had surgery. Get ready to have another one. You cannot keep putting these kind of things off. And the budget is, that's what we hear all the time about this budget, this budget, this budget. Well, the only way to get people to participate and coming out And explaining these things to you is we gotta get some transportation.
All right. Okay, Mr. Brown, I hear you loud and clear. And as you were speaking, I was just trying to figure out how we can help you immediately. We have medical transport. That should not cost you. Are you aware of that?
The medical transport has left me at my home more than once.
Okay.
Just this year, at least 4 times, I was either late or had to change my appointment.
All right, okay. I will ask, Smith, can we get Mr. Brown's information? A number that works now. We want a real telephone number that works so we can be in touch with you. All right, we'll get that. I want to see if we can help you solve this dilemma.
I
Because
appreciate it.
yes, yeah. Make sure you can get to your medical appointments. That's important. Yes,
All right, thank you.
definitely. Definitely. We'll now turn to Hillary Kay, who is online. All right, Ms. Kay, you have the floor.
Thank you so much. Good afternoon, Committee on Executive Administration and Labor Chairperson at-large Councilmember Anita Bonds. Happy birthday, Councilmember Bonds. Many more to you.
Oh,
And
thank you very much, Ms. Kay. Thank you.
thank you for the cake. I'm sorry I'm not there. I'll eat some virtual cake with you.
Okay.
Thank you also to your committee fellow council members and staff for this opportunity to submit testimony about the Department of Aging and Community Living, including adult protective services and our DC fiscal year 25 budget to you. My name is Hillary Kaxer, and because of my last name is hard enough, it's just SYK, but I am a DC resident, a product of DC Public Schools, and a longtime district advocate, although I haven't had the opportunity to testify before you yet until today. I know we have a tight budget. And here is a cost saving for our overall budget that would alleviate strain on DACL and APS by better provisioning other DC social and healthcare services. As I say, I have testified for over a decade before the Committee on Health, but I have had opportunity to interact with your staff who have been very supportive over the years. I did have to tune out for a telehealth appointment, so I might have missed if this topic did come up, but I would be pretty surprised if nothing came up at a DACL hearing about an extremely widespread but also very closeted condition. Due to continued shame, stigma, judgment, unfortunately, in the district, what tends still to be swept under the rug is hoarding disorder. And for the captions, I'm going to spell that HOARDING. The diagnosis, defined as hoarding disorder or HD, directly relates to adult protective services because DBH lack of early intervention results in APS making costly emergency interventions that could be prevented by DBH providing HD behavioral health services. HD currently represents an unmet behavioral health need. Currently, Adult Protective Services receives referrals out from DBH, Department of Behavioral Health, for DC residents living with the diagnosis of HD. APS work for HD is emergency, crisis intervention, and costs a lot more taxpayer dollars than if DBH were to provide early intervention. APS performs costly, heavy-duty clean-out, places people living with this untreated HD diagnosis under costly guardianship, and houses people living with late-stage crisis HD in costly long-term nursing care because the individuals did not receive timely behavioral health support that could reduce harm long before the case of HD reaches stage 4. With your oversight over DACL and APS, if DBH provides no early intervention, can your committee do anything to help reduce harm for district residents undergoing removal from their homes by APS? APS needs for DBH to provide HD support to save DC taxpayer money spent on costly late-stage APS intervention. We need early intervention and harm reduction. As for numbers of folks, my written testimony will include references to the additional individuals who testified 10 days ago about HD to the Committee on Health. However, not many folks are asking for help, but please do not let that give you to think that folks do not need help for HD. Calling DACL leads to an in-home assessment by a mandatory reporter who may feel obligated to cite the person living with the behavioral health diagnosis as a case of neglect or self-neglect. Therefore, calling DACL for HD is a deterrent to early intervention that would reduce harm and reduce the need for more drastic interventions that APS and DACL currently implement at greater cost than would early intervention. And early intervention would also allow folks to remain at home and would avoid radical emergency intervention, which traumatizes the individuals. So what we really need is some interagency collaboration, please. The Washington Post had an article, hoarding is a serious disorder. They said up to 6% of people live with HD. That's as many as 40,000 people in our current population of 700,000. Numerous other jurisdictions in the DMV have hoarding task forces. What can the DC Council do to fix this unmet need for DC residents, please? Thank you very much.
Thank you very much for your testimony. You are asking an important question. What can we do? Well, we certainly can have a task force as well as a starter. And I think if anyone has been in that situation or have relatives and friends that are in that situation, you know, it is very, very difficult because it can lead to it can lead to expiration on the part of the individual who is the hoarder, really and truly. And so we should be jumping on that, and we will examine that issue with the director when she comes up a little later today. But thank you very much for that information. And this 40,000 number, that's a big number. That's a big number. Absolutely.
Thank you very much.
We can, let's see, we are. Oh, all right. I see, Ms. Sedgwick, you are on. We see your, okay, we see your light. All right, there you are. We can't hear you. Fix your.
Okay, there I am. Okay, sorry.
Gotcha. Yes,
I wanna
thank you.
Wish you a happy birthday and thank you very much for allowing me to testify today. I was hoping to be there in person to be with you. It's been a while and I managed to come down with COVID. So I've just gotten back from the doctor and things seem to be on target for me to recover soon. But my name is Susan Sedgwick. I'm in my 80th year. I've been living in DC since I married 45 years ago. My husband is now 84 and he's lived in DC for 60 years. We came to serve with the federal government and stayed in DC because we love it. We're now part of the local, not the national community. Our son and his wife were both born and reared here in DC, and we are very lucky that they, with their young children, have decided or live near us, and DC is home for us. I want to thank you, Madam Chair, for being our champion on matters affecting older adults in the city. Your support for the Senior Villages model of neighbors helping neighbors is reflected in DACL's budget. As a member of Capitol Hill Village, I can assure you there is a big bang for the buck when it comes to investing in the senior villages. Recognizing this is a hard budget year, We need you to take a hard look at restoring the funds cut from the in-home services in the DACL budget. These are the funds that provide for home health services to our elderly neighbors who are not on Medicaid and cannot afford the private rate for help that they need. But there is a broader problem that needs your attention. It's the continuing shortage of home health care aides and certified nursing assistants. This is the direct care workforce. Some months ago, in a Zoom with you and Capitol Hill Village members, we talked about how siloed the district government is and how that was hindering the development of programs to address the shortage. We continue to urge you to find ways to get agencies to work together to solve this problem, and we urge you to support the Direct Care Worker Amendment Act of 2023 that was introduced last December. The bill recognizes and provides actions that, if implemented correctly and in a timely manner, will alleviate the current shortage. Why am I concerned? The shortage is personal for my husband and me, as we are counting on hiring trained aides to care for us when we need them. Our desire is to reduce and minimize the burden on our son and his young family. The fact that the number of aides certified to work in DC dropped by 30% last year is troublesome. But even more troublesome is the fact that these jobs, based on the low level of pay, are not considered worthy of OSSI's and the Federal Department of Labor's workforce development programs. There will not be enough aides to take care of us and the growing number of those in our age cohort. It's important to note that this critical healthcare workforce is primarily made up of people who are Black, brown, and immigrants. This historically low pay these trained and certified workers receive should be considered a systemic equity issue. We can do better by these workers. Raising the wages so these jobs can be considered good jobs worthy of workforce development would be a start. And thank you very much again for this opportunity to talk.
Thank you very much for your testimony. And as you said, that's an area that we really need to pay a little more attention to and see if we can't get some resolution. And let me just ask, does your association with the care provider community inform as to some of the reasons why those who are home care aides have decided that they no longer want to do that work?
What we're hearing is that they can get jobs that are easier for the same rate of pay, and they can work at McDonald's, other places so they don't have to take this type of job, and they don't make enough money, and they can make better money elsewhere doing other jobs. And that seems to be one of the key reasons why people are leaving the workforce, or maybe not even entering it, not even seeking the training.
All right, thank you. That's very helpful. We will have the Department of Employment Services before this committee on May 1. So we will be examining that issue then in depth, most definitely. Thank you very much. And finally, for this panel, we have Eva Lashiro, who is representing one of our villages. I think it's the DuPont Circle Village. Please go ahead.
Good afternoon, Chairperson Bonds, and happy birthday. May this next year bring you an abundance of joy and blessings. Can you hear me? Is this?
We can barely hear you.
Is this better?
Oh, much better. Thank you. Thank you.
Thank you for allowing me this opportunity to testify today. I always find this hearing very informative and inspiring that so many are using their voices to speak out for our seniors. My name is Eva Lucero. I am the director of DuPont Circle Village, one of the 13 villages in DC committed to enriching the lives of older adults across our city. I am pleased to testify on behalf of the DCB membership and older adults in our community who benefit greatly from DACL's efforts and Mayor Bowser's leadership. The DACL Villages Partnership dates back to 2017 and has always been in close alignment with Mayor Bowser's commitment to seniors. We both are committed to ending isolation and loneliness. We both are committed to keeping our seniors safe. We both are committed to increasing access to technology and transportation. We both support innovative programming. We both make sure that older Washingtonians have the support they need to live healthy, connected lives. And lastly, and most importantly, we both endeavor to make DC a great city in which to grow older. The Village's partnership with DACL enables us to realize Mayor Bowser's commitment by being an important and effective part of DC senior support services infrastructure. In FY23, the DC Villages reached 9,704 older district residents with a range of services such as transportation, health and well-being activities, vaccination clinics, medical note-taking, short-term case management, prescription delivery, household repairs and maintenance, errands, hospital discharge planning, cultural outings, friendly visits, calls, emergency preparedness, and so much more. The list I just read is documented by the over 1,200 trained and vetted village volunteers whose time completing over 24,000 service requests is equivalent to 16.5 full-time employees. Other results of the Village's impact are trust, belonging, and security, and are mainly anecdotal, but equally important. I would like to just share this testimony as relayed to me by a new DCV member. I relocated to DC in September 2023 with no family and just a few friends to welcome me. The Villages immediately became the next best thing to family. To say DCV was welcoming is an understatement, as the staff and members went out of their way to include me in social activities, provide resources for every aspect of my new life, and inform me of the medical and health services that are available when I might need them. I feel confident that should I not be able to communicate with my scattered family, DCV will have the channels necessary to accomplish that for me. It's a source of security. Having shared my all-encompassing experience with DCV with many friends across the country, they are now in search of a village in their location or investigating launching one. If it weren't for my village, I would likely still be searching for support both socially and practically, and would certainly not feel as comfortable that support is there should I need it. Just an email, text, or phone call away. As you can see, the villages are a vital resource for many older Washingtonians, and the partnership with DACL is a model collaboration of respect and caring for some of our most vulnerable members of our community. It is my hope that the partnership only grows stronger and bolder, and we continue to make DC a great place in which to age. Thank you, and I am available for any questions that you might have.
Thank you very much for your testimony. Thank you all for your testimony today. I know it's getting a little late and I don't want to keep you all day, but I appreciate getting your testimony, and I think we continue to hear that one, we want to at least pay more attention to our budget as it relates to the services that are being provided. And there are some needs for some additional services or more money going into the bucket. And I've heard loud and clear today, transportation is a big area of concern. And we must keep you mobile. We must keep you mobile. And Mr. Brown, we're committed to seeing what we can do about you taking a trip to your doctor and it costing you $43. Okay, we want to work on that. That doesn't work. Okay, that doesn't work. Yes, I was wondering, Ms. Gentile, has thought been given to, you're at So Others May Eat. Maybe some of our service groups creating a network for those that frequent your clinics and your services. Have you given thought to having a pickup system for those who are coming to your clinic? I was just trying to figure out, how do we begin to address this big issue of transportation?
I'm not sure, but I can ask our senior services staff, had they thought about that at all, and I can get back to you through email.
Would you please, I'm just thinking, if you're an organization and you have transporting like a van, 12 passenger, 8 passengers, something, if it would not be cost effective for you to pick up your clients. And we'll ask the same thing of some of the other institutions, nonprofits, the hospitals in particular, to see if there's a way to at least take care of the medical in an easier system where you, for instance, people are not missing their appointments because of the tardiness of the transportation arriving. Just trying to think through how we might do this. I know that there are some medical transporters around that are doing this. And the villages may also have a similar need, although they have a number of volunteers that are available, but it doesn't always work out that the volunteers available when someone has to, get their prescription quickly. I know the fire department has a service also. So maybe we need to look closer. Maybe we need a task force on transportation. Maybe that's where we really are, Mr. Brennan. Ms. Gentile?
They're trying to catch their van.
Oh, yes, all right. Okay, please, I'm very sorry. We will see you soon. I'll see you soon. Take care. Don't rush, no slipping. Okay, all right. Thank you all so very much for coming by and talking with us. And thank you all on the monitor. Thank you, as always. Bye-bye. Our next panel, I believe, well, I'll start this way. Maria Anderson, who should be on the monitor. Lillian Ingram. All right, Miss Ingram. Dolores Walker. Miss Walker is here. Ronald Mitchell, he's here. Elaine Sanders. All right, Thema Burles. All right. We have a full panel. Please. Oh, Maria. Okay, she's here. All right. Oh, and I see Miss Bailey is here. Okay. All right. And Carolyn Cook. Oh, and there's another woman here. Oh, and see Miss Tomlinson. I see Miss Tomlinson also. All right, we're going to switch up, and we're going to go to those on the monitor first and then come back to you. So just bear with us, please. We'll start with, I see Miss Bailey. Miss Bailey is representing the East of the River Family Strengthening Collaborative. Ms. Bailey, please go ahead.
Thank you. Good afternoon, Chairperson Anita Bonds, and happy birthday. Good afternoon to members of the Committee on Executive Administration and Labor. My name is Aisha Bailey, and I serve as the Deputy Director for the East River Family Strengthening Collaborative Senior Programs. It is an honor to share my experience and perspective of services provided to seniors residing in this region. I would like to thank Director Hines of the Department of Aging and Community Living and her team for providing funding that allows our agency to continue to provide services to decrease social isolation and hunger in wards 1, 7, and 8. East River Family Strengthening Collaborative is the grantee of the Ward 7 and Ward 8 lead agencies. This fiscal year, Department of Aging and Community Living partnered with us to manage the Ward 1 lead agency. This new partnership led to management of 5 community dining sites for seniors, the outreach and nutrition programs in Ward 1. We are also the grantee for 2 senior wellness centers in both wards, the Congress Heights Senior Wellness Center in Ward 8 in partnership with Far Southeast Strengthening Collaborative and the Washington Senior Wellness Center in Ward 7. We have provided services thus far this fiscal year to over 2,300 seniors to include participation at community dining sites, which are our friendship cafes, nutrition programs, outreach events, care coordination, transportation, and reassurance calls. I appreciate Mayor Bowser's and the council's continued support of DACL and the district seniors. The funding has helped seniors to cope post-pandemic and returning to in-person services. The funding allows seniors to engage in recreation activities, health promotion, physical fitness, and receive a daily nutritious meal at any of the 14 friendship cafes across all 3 wards. Additional services we provide are chef demonstrations to include a recipe bag and food tasting, planned grocery trips to assist with shopping, nutrition education presentations, and group mental health counseling sessions. The in-person support groups held in the community at various senior buildings are led by a licensed mental health professional, and we have introduced robotic pet therapy via dog and cats for seniors. We continue to provide reassurance calls to isolated and homebound seniors. Each senior receives a call weekly and can be connected to services to assist the senior to age in place. We also continue to provide outreach events and activities to engage out-of-network seniors to include pop-ups, large ward-wide events, grocery delivery, and a flash table. Flash tables are meals prepared by a chef to include a cooking demonstration. Our care coordination team continues to partner with Department of Aging and Community Living social work team to provide short-term services to seniors not consider case management on a temporary basis to include utility assistance, medical and food stamp applications, and prescription delivery and/or medical appointments. We continue to manage the citywide heavy house cleaning program and the citywide deaf and hard of hearing program. East River Family Strengthening Collaborative experienced significant budget reduction to the Ward 7 and Ward 8 lead agency grants during this fiscal year. However, we have managed to maintain the great team and continue to provide services to seniors without disruption. The funding from the Ward 1 lead agency in partnership with DACL also assisted with providing the same services in Ward 7 and Ward 8 to the newly engaged seniors in Ward 1 at the Friendship Cafe and nearby senior buildings and communities. We thank Director Hines for working to maintain the current funding and services provided to the lead agencies to continue this much-needed services to seniors across all 3 wards. We have been creative in delegating the time of the dedicated team at East River Family Strengthening Collaborative to continue with this mission. However, we are still in need of the following to ensure the quality and quantity of services can still be provided this upcoming fiscal year to hopefully include an additional $300,000. That is $100,000 for citywide transportation for the deaf and hard of hearing program participants to travel from their homes to the program. Also $75,000 for a licensed social worker to provide clinical oversight of the care coordination program, at least 50% of the staff's time. The budget reduction this fiscal year did not allow continued funds for the program administrator who provided supervision to the 2 social workers that we have on staff. 1 additional outreach and partnership coordinator to schedule pop-ups, flash tables, and also ward-wide events in Ward 8 to reach out-of-network seniors. and also 75,000 for a licensed nutritionist for Ward 8. We currently have one licensed nutritionist managing all of the nutrition services for Ward 7 and Ward 8, to include conducting nutrition education services and nutrition counseling services. Funding from the Department of Aging and Community Living allowed us to serve over 5,000 seniors during FY23 who live in Ward 7 and Ward 8. Our goal is to maintain the much-needed services for seniors with the additional requests. We are grateful to all of our community leaders who partner with us and assist in providing resources in Wards 1, 7, and 8. We are thankful to Mae Best, Executive Director of the East River Family Strengthening Collaborative, for her leadership guidance on providing quality services to seniors in the district. Thank you.
Thank you very much for your testimony. May I ask the number that you serve in Ward 1?
We are currently at, I have that number here. We have currently served 603 seniors. We just recently have partnered with Department of Aging and Community Living as of October 1, 2023.
All right, thank you very much for that. Make sure I have this right. 300,000 for your work you do with the deaf and hard of hearing.
Yes. Yes,
And then-
Councilmember Barnes.
All right, and then 75,000 for a licensed social worker. Where would that individual be working? Any particular ward or just in?
It would be for Ward 7 and Ward 8 to oversight our care coordination
Okay.
program.
And then 75,000 for a Ward 8 nutritionist.
Yes.
That's all you're asked.
And one additional outreach and partnership coordinator for 65,000.
All right, well, I thank you very much for that. I did want to ask you about some of your services, but I'll go on and we'll get the others. If you could just please stay with us for that.
Absolutely.
All right, thank you. I wanted to, Ms. Walker, we'll take your testimony. See, Ms. Walker wasn't prepared. She thought she was at the bottom of the list.
Good afternoon, everyone. My name is Dolores Walker. I am a very proud member of the Geneva and Johnson Senior Daycare Program. And I would like to state that becoming a member of the Senior Daycare Program has really changed my life tremendously. I'm doing a lot of better, greater things for myself. The entire staff at the G&J Senior Daycare Program, each and every one of them, they are very awesome. They lovable, they very caring, they very dependable, and they are very, very loyal. They treat each and every one of us as if we was a daughter or son of their own. And there's never any disagreements. Everyone is on the same page at doing everything. They work as a great and awesome team. So I would like to request that the funding for the GNA Center even increase, get a lot better, to make sure that the G&J Center remains open and function for senior citizens such as myself. And I thank you all.
Thank you very much for your testimony. Thank you. And now, Mr. Mitchell.
I hear you, Madam Chairman, and happy birthday to you. Oh, I hear you.
Thank you.
Happy
Thank you
birthday
very
again,
much, Mr.
and
Mitchell.
to the committee for having me. My name is Ronald Mitchell, as stated before, and this is sort of my vision for Ward 4 and beyond. As a participant of Genevieve N. Johnson Senior Daycare Center, I, Ronald Mitchell, have had the privilege of a wide range of activities. These moments of joy have included programs fulfilling my whole day. Although I can only vouch for this center, hopefully all senior centers in Ward 4 are able to provide similar events. Just to mention some enrichments such as morning cafe, an exercise program, and closing the day with a chew and chat, leading to an ending of fun and games. If I have given some useful information, it is because of the staff of Genevieve N. Johnson and the support of all Ward 4 that selected me as their king for the calendar year. In closing, I want to convey the necessity for more funding and financial support for senior programs affecting Genevieve and Johnson, Ward 4, and all of Washington, D.C. Thank you.
Thank you very much for your testimony. Thank you. And now let's see. Ms. Ingram,
Good afternoon.
good afternoon.
Is it on? Okay. Good afternoon. My name is Lillian Ingram, and I am a veteran social worker who worked in the city of Washington, D.C. since I had a master's degree in social work. And by that, I'm saying is that I have a lot of experience in terms of working with different individuals. As I'm hired by Genevieve N. Johnson Senior Day Program, I was really thrilled at the idea that when I came into the program, they were already functioning as a top-notch agency. They had different activities going on, as these two participants have talked about. And especially they had counseling programs that was going on so that they would be able to discuss their concerns when needed. So it is an excellent program. It's an excellent program to model, because we were able to keep the participants together, have them to be able to learn different kinds of activities while they're there, go on trips, and be able to just feel good about being in a day program. They rarely miss any of the programs and everything that is going on in the community, because they were invited, they went and they came. And they were excited about coming back to the center. When we're closed, they're wondering, when are we going to be back? What day we're going to be back to the center? So that's one of the most wonderful things about this senior center here, is that they care so much about their participants. Now, after hearing many of the testimonies today, I heard a lot about social workers and the need for social workers in this city. And I am a strong advocate of that. Since we have become a lead agency, we have been receiving many referrals in relationship to services that were not being provided in the community. And it was because of because of a lack of social workers being available to provide all of those services. So since we are a lead agency, it is our job to seek out those individuals who have not received any services. This gentleman that the previous presenters indicated that he needed transportation. That's something that we address on almost a monthly basis, because if we find out that our participant can't get here or can't get to the center, then we figure out a way in terms of trying to make that happen. So if you want me to take over that case, I will. But as far as transportation is concerned, we do have many different seniors across the city. And in particular, I have been exposed to a number of seniors who are living alone and don't have any support and don't know how to get the support. So what we've been trying to do is to reach out to many of the different agencies and different things that we are involved in, and to just try to find out in Ward 4, where are the social workers? What's happening in the ward? And we are now understanding, that there was sort of like a mix-up in relationship to who's supposed to do what. So where we are right now, we want to be able to close that gap. We want to be able to communicate with the social workers that are in the city, and we want to be able to do that by way of meeting and being able to discuss what's going on in our different wards. So it's important for us, as you have indicated earlier in the previous meetings with the members from different organizations, they need help. And we need to figure out how we can help them and make this much more streamlined than what it is. It's not just this person can get it now, but nobody else knows how to do it. So we want to be able to do that and to be able to have a sufficient amount of funds to be able to fund that particular project.
All right, I'm hearing you loud and clear, and I appreciate that. And yes, I would like to follow up with you so we can help Mr. Brown and others. And I think I'm hearing you thinking that a monthly meeting of the social workers that are engaged with our senior population might be a very good idea. So let's see if we can put that into legislation so that we can make that happen.
Okay. All
Thank
right.
you. Thank you
You're
very
welcome.
much. I
Thank
think
you.
it's an idea that we need to explore. And let's see how we can make that happen. Thank you very much. And thank you for being here today.
Thank you.
And now, Ms. Burles, please.
Good afternoon.
Good
A little
afternoon.
loud. Good afternoon, Chairperson Anita Bonds and your committee and everybody else in the room that stayed. I feel like breaking into a song, saving the best for last.
Go right ahead.
But I want to say one thing, other than happy birthday, I want to tell you that I'm the daughter of Mr. Lee Junius, who was one of your biggest fans.
My
And I
goodness.
remember hearing your name as I was growing up, the late Mr. Lee Junius. Always talked about the great work that you did. So I'm glad to be sitting before you at this time.
Thank you very much. You look familiar, and I was like, I can't place that, but it's your dad.
That's right.
It's your dad.
My name is Thelma Burles, and I'm the Executive Director of Genevieve and Johnson Senior Daycare Center, but also the Project Director for the new Ward 4 Lead Agency. So we're very excited. I'm excited to be here. I am always excited to talk about the great work that we do for our seniors in the community. It's one of my passions because of my dad. I grew up with a senior, so I've loved seniors my whole life. So we love what we do, and we're so happy that we were able to have two of our seniors here with us. Ronald Mitchell, as he said, he's our new king for Ward 4, and Mrs. Walker is last year's queen for Genevieve and Johnson. So we're very happy that they got a chance to speak. And of course, we have two of the most amazing social workers in the city. So I'm glad we were able to bring one of them with us, Miss Lillian. I'm here today to advocate for more funding, just as everybody else is, for not only Genevieve and Johnson, but all of the centers and villages and adult daycares in Washington, D.C. We do such amazing work for our seniors, and something that a lot of people do not know, because Genevieve and Johnson is one of the best kept secrets in Ward 4. Although we're a new lead agency, we have been around for Come next month, 42 years. So congratulations to Seabury, who's celebrating 100 years, but we'll be celebrating 42. And we're also extending an invitation for you and others to come and celebrate with us next month. Our namesake, Mrs. Genevieve and Johnson herself, believed so much in the work that Zion Baptist Church, who oversees our facility, that they do for seniors. And so we continue to live out the mission of Mrs. Genevieve and Johnson to make sure that we create a safe environment for our seniors so that they have a place to come and network and socialize. And I want to just say that Genevieve and Johnson primarily takes care of seniors with Alzheimer's and dementia. We may be one of the very few adult daycare centers in Washington, D.C., who has 98% of our seniors with some level of Alzheimer's and dementia. I also, want to say that I support the request and the need that Department of Aging and Community Living has set forth for additional funding. We thank Director Hines and her amazing team for working with us and also for selecting us as the new lead agency for Ward 4. But the funding is so very limited, so very limited. There's so much more we could do with an additional, I'm going to be modest here and say, based on our numbers, at least $500,000. And I'm going to be modest because what we could do with that is not only support dementia-specific programs, we would support caregiver support, and not just caregiver support. We have created an amazing caregivers lounge, which is different from a caregiver support group. So different. And we want to replicate that program throughout Washington, D.C., because it is something new for the caregivers that not only give them respite, but it gives them at least 2 hours of free time where they don't have to think about their own problems. It takes them out of themselves for a couple of hours. A very new concept. Also, with that additional funding, we would be able to support, as everyone else has already said, transportation. Transportation is a huge issue for everyone, but when you're working with seniors with Alzheimer's and dementia, it becomes even more challenging because our seniors cannot jump into Metro Access or the yellow cab. They need supervision, and they can't always tell the driver where they want to go. So it does present a huge challenge for us. In addition to that, now that we're a lead agency, we're getting attention from seniors all across DC. They're finding out that Genevieve and Johnson specialize in dementia care. So now we're getting calls from people in Ward 8, 7, 6, 5, 3, and 2, and 1 saying, can you take my mom and dad? Because we want to enjoy going to a center ourselves, but we want somewhere for them to go. Because we don't have but one van, it makes it one bus, it makes it extremely challenging to get everyone to Genevieve and Johnson who may live in Ward 8 and Ward 7. But they're calling us, they're asking. And we have started transporting some of those seniors, but what that does is, one, it gets them to the site late, and they may have to leave early, so they might miss part of the program. So we do need better or more transportation. The other justification for that increased funding that I just mentioned would be for home health support. I heard somebody mention that earlier. And one of the challenges that we have at Genevieve and Johnson, we have seniors who really need to attend a senior daycare program like Genevieve and Johnson, but because of their behaviors, they may not qualify unless they have an aide who's able to escort them to the site. So that's a challenge. And then as Lillian has already talked about, the case management, so as the psychosocial counseling. And then we have 2 sites in Ward 4 that keep asking us, if you're the lead agency for Ward 4, why don't you provide a dining site for us? That's LaSalle and Emory. They're not dining sites, they are recreation sites. Who's looking for some attention, from us. So now in my written testimony, I want to go back to that. The overall goal of the lead agency for Ward 4 is to provide a safe environment designed to enable seniors to successfully manage their quality of life in order that they may be able to comfortably remain in their homes. That's all we want to do. We want to make sure that they remain in their homes with their family so they can age gracefully and safely in place, and therefore maintain a reasonable quality of life for as long as possible by providing a myriad of rehabilitative, social, and recreational programs and activities and services. And those programs I just listed to you earlier. Very, very important for our seniors, not just our seniors with memory loss, but our seniors across Ward 4, especially those we serve as the Ward 4 lead agency. We pride ourselves on serving as a catalyst for change, because nobody was thinking about a caregiver's lounge until we brought it up, by the way, and also a music memory cafe. So we're very excited about those 2 things that we can certainly talk to you about. A clearinghouse for resources, identifier for gaps in service, and the provision of results-oriented linkages and coordination of service deliveries. Now that says a lot, but we humbly ask that you appropriate funding, that you continue to provide funding, that we extend the funding so that DACL will receive it in order to provide it to us, so that we can allow our seniors to be the beneficiaries of the great work that we do, and so that we can keep soaring towards excellence. And a lot of people are just starting to find out about the great work that Genevieve and Johnson provide for our seniors. I started 5 years ago after maybe 30 years in long-term care. And this has been the best job ever because we get to touch the seniors with early to moderate stages of dementia, and some that don't have dementia. We get to touch them before their families have to make the decision to put them into long-term care. So this is exciting work that we do, and we can see every day the impact that we make on our seniors and their caregivers. So if I have another minute or 2, I would like to share with everyone just a brief PowerPoint, very brief.
I think we've had the opportunity to look at your PowerPoint throughout your presentation.
Oh, wonderful.
And you're 5 minutes over. So this was a full-blown presentation that you did.
Yeah, and let me tell you, that's the benefits of saving the best for last. How about that?
All right, well, thank you.
Chairperson Bonds, I would like to say that we have been trying very desperately to contact your office to get a one-on-one meeting with you so that we can not only talk about some of the wonderful ideas that we have for our Ward 4, but also so that we can discuss the new project, the affordable housing project that we're looking forward to discussing with you. So I just wanted to put that on the record.
Well, thank you very much. And just so you know, I had a conversation with Mr. Abney yesterday. So he's doing much better. And he told me that the organization and the center was moving forward. So that was good news.
Wonderful. And thank you for your time, and thank you for this exciting opportunity to testify before you.
All right, thank you. We still have a few online that I'm pretty sure are available to, we'll get just a little more testimony here. Maria, Anderson, I believe. Yes, okay.
I'm here.
All right, please go move forward.
Good
Let us
afternoon.
get your testimony
Good
now. Sorry.
afternoon, Chairperson Anita Bonds and members of the council. Happy birthday to you.
Thank you.
I am Maria Elena Anderson, an advocate for disadvantaged seniors in DC. And I'm also a participant at Vida Senior Center located in Ward 1. I want to thank you for the opportunity to testify on this occasion. Well, I don't want to repeat what what many people have said, many previous speakers. One of the main issues faced by the Hispanic and many seniors in the city are transportation issues. And in the case of Hispanic seniors, there are only two Vida Senior Centers, one in Ward 1 and one in Ward 4. And so all seniors living in other wards have to find some means of transportation, and attendance to the centers has declined because of the lack of transportation. So I'm not going to repeat all the issues that were mentioned before, but my recommendation would be perhaps you mentioned a task force to look at the issue, but perhaps there is a need for a comprehensive independent evaluation to determine the causes, because there are many programs that are available that the city funds, but somehow when one most needs the transportation, it is not available. So it's important to include funds in the 2025 budget for this purpose. And also the training of city bus drivers is important so that they consider seniors when they're getting on and off the buses. Then many seniors have difficulty accessing programs, and in DC, there are about 9,500 Hispanic American adults. And these are persons, they are Americans who have worked here, lived here for many years. Now they should be able to enjoy all that is offered in different senior wellness centers and villages and programs. However, there is a language issue, and perhaps it would be useful to have perhaps an analysis of census data that shows where these seniors are and how to provide services for them. And I think it would be important to include some funds for that. On healthcare issues, Vida service model provides preventive health care. And in the information that I provided, I list all the programs that Vida provides. So, but basically, I think that it would be useful looking at providing more funds for Vida, compensating for the Medicare and Medicaid savings, because a lot of the work is done within the Vida Senior Centers. And then another issue is the stay-at-home program. The programs are very good, and there are a lot of programs available, but it is very difficult. I have an 88-year-old friend whom I'm helping to try to access these services. We're finally going through the Services My Way program, but from the beginning until now, we have not yet gotten to the point where she's getting the aid. But it has 12 months have passed just in administrative processes, I'm going to say. There have been very helpful persons in DACL and also in GT Independence, a very helpful person, but it has taken her and I hours to fill out forms. And it's just too difficult. How can anybody access services if it's so difficult to do so? And yes, there is a need for social workers that can help, and language issue comes up again for Hispanics. And one final point that I want to make is the one about housing. I know it's a big problem, but once a senior is in place, it should not be difficult to stay in the apartment. Information is somehow being manipulated to essentially separate some seniors from their units. This is a constant source of anxiety for many seniors. Imagine if you had to think every day whether you would have a place to live in, in the next month, next week. So no senior should have to go through that. Unfortunately, many do. So my request is that funding be provided for an independent evaluation of a sample of subsidized apartments throughout the city to determine why this happens and to take preventive measures to ensure that seniors feel safe in their homes once the government has determined that they should have subsidized housing. Thank you very much. I'm available for questions if you have any.
Thank you very much for your testimony. And we have, I believe, do we have two other? All right, we have possibly two. Looking here, I see Mosi Toblinson.
Yes. Good
All
morning.
right.
Good afternoon.
Yes, thank you very much for your patience.
Yes. Greetings, Chairperson Anita Bonds, members of the Committee on Executive Administration and Labor and Committee staff. My name is Mosey Tomlinson, and I serve as the Program Director at the Washington Seniors Wellness Center with East River Family Strength Collaborative. I am testifying today on behalf of Washington Senior Wellness Center on the proposed budget for fiscal year 2025. I want to extend a special thank you to the DACL Director, Sharon Hines, and staff, Grant Monitor Sherelle Fennell, and Executive Director for East River Family Strength Collaborative, May Best, for all this continued support and assistance with Washington Senior Wellness Center. I also want to acknowledge the staff at Washington Senior Wellness Center for their hard work, and the seniors, most importantly, for their daily wellness deposits they have made to themselves, and also for holding us, the staff, accountable. The Washington Senior Wellness Center continues to provide services and programs that improve the health outcomes of our seniors. These programs and services consist of minimizing the impact of isolation and loneliness that may cause depression, anxiety, and a decline in overall health in seniors. We provide nutritional education classes, individual assessments and counseling, and cooking demos. We enhance our seniors' physical function and independent living through fitness and evidence-based programs and activities. We address the negative impact caused by chronic disease through preventative health and disease education and health promotional programs and activities. We also offer recreational and socialization programs to motivate and engage seniors. We have efficiently managed our budget by leveraging our relationships with our community partners and collaborating on programs and expanded our services beyond the walls of Washington Senior Wellness Center, but more importantly, across Ward 7. We've increased community engagement by collaborating with our Brother Wellness Center, Ward 8 Senior Wellness Center, Congress Heights, and hosted activities that increase the participation of senior men. We held successful community health fairs in Ward 7 targeting senior residents. We completed a patio beautification project and created an urban garden. That urban garden was titled Food is Your Medicine and Your Medicine Should Be Your Food. We increased participation of men by 40% with a men's health initiative that was sponsored by AARP DC. We decreased the digital divide and modernization operations within our center by converting to a digitized system where our members are no longer signing in with pen and paper, but they're being supported with touchpads. All this is through innovation, collaborating with strategic partners, community partners, and outside funders. The staff of Washington Senior Wellness Center have assisted in closing the digital gap and ensuring that no senior gets left behind. As other panelists have stated, access to reliable transportation is a struggle and it's a challenge. With the change of the city's landscape with Vision Zero out and trying to reverse, pandemic isolation, our seniors are struggling. They're struggling to get to the center. They're struggling on reliable transportation. They're waiting. Sometimes Metro Access, Yellow Cab will say pickup time is 2 o'clock and the members are at the center until 5 o'clock. Sometimes the members are supposed to come to the center at 9 o'clock and they're not getting them to 12 p.m. So the citywide structural changes and challenges with digital technology have made it difficult for those seniors to take advantage of current DACL programs. The sustainability of transportation programs and increase in funding is vital to address isolation among seniors. Access to safe, inexpensive, and convenient transportation options are associated with lesser feelings of loneliness and may ease the transition into driving cessation, improve older adults' ability to socialize, and improve overall perceived quality of life. We continuously service the seniors at Washington Senior Wellness Center and Ward 7 by meeting them where they are and providing them with the services that they need. Our goal for fiscal year 25 is to continue to close the gap between seniors and the use of technology with program enhancements, expand our community partnerships beyond east of the river, and collaborate with other senior wellness centers to increase our capacity. In conclusion, Madam Chair, it is important to prolong the equitable resources that benefit our seniors and equip them with the necessities to age in place. I want to thank you and happy birthday.
Thank you very much for your testimony. And I believe we have one additional, Carolyn Cook. All right, this may be it. Well, thank you all very much for your testimony today, and we are right on time. It's just a few minutes after 3, and we've completed the public testimony. Oh, I'm very sorry. We do have one more. Katrina Polk. Ms. Polk, we'll take your testimony. You're here. All right. Okay. I see. Okay. Thank you all very much from G and Johnson. Thank you very, very much. And Ms. Ingram, I will be talking with you for sure. Thank you. Ms. Polk, welcome. We didn't mean to leave you out. We were just thought we were nearly done. All right.
That's all right.
The floor is yours.
Okay, can you hear me?
Yes, we can.
Okay. Greetings, Chairperson Anita Bonds and DC Council members of the Committee on Executive Administration and Labor. I am Dr. Katrina Polk, the Executive Director of DC Villages Collaborative. And as you know, I also co-chair the housing domain for the Age Friendly DC Task Force and a member of AARP DC Executive Council. I appreciate this opportunity to submit my testimony for the budget oversight hearing for the Department of Aging and Community Living on the behalf of DC Villages. DC Villages is a collaboration comprised of 13 villages in the District of Columbia, supporting the needs of seniors in the city. More precisely, this alliance provides innovative service delivery models through volunteerism and strategic partnerships that serve seniors who want to age in place within their community, cultivating a collaboratory, synergistic approach. We aim to tackle social isolation and improve access, awareness, and utilization of citywide services. In 2023, our services reached approximately 10,000 seniors across all 8 wards. Villages are a unique grassroots solution that offers customized place-based services to address the gaps between seniors, their unmet needs, and the DC Senior Service Network. Our villages are also cost-effective and help save money for the city. DC Village's commitment to helping seniors age in place through Villages services has led to the following remarkable outcomes in FY 2023. In the category of social isolation, we conducted 1,886 friendly visits, 4,443 programs and activities. In the category of transportation, we provided 7,029 one-way rides. 62% of the riders were for medical appointments. In the category of in-home supports, we made 2,168 deliveries and 575 errands. 869 tasks were completed in homes and yard projects, 513 tech support activities, 1,235 referrals for services and benefits. Additionally, more than 1,300 trained and vetted volunteers locally provided 34,328 service hours. The villages have experienced a significant increase in membership and services with a 16% rise in recent years. Our progress is due to the trust, strategic partnerships, and financial support we have received from DACL. With their help, it was possible for us to achieve the efficiencies and effectiveness required to impact the lives of seniors in DC. We thank the mayor and DACL's director, Sharon Hines, for the commitment to DC Villages, which includes the 13 villages, by supporting the proposed increase of funding for FY 2025. However, we need some clarification on the proposed funding amount. The published budget tables for DACL indicate a $215,000 increase, while the executive summary states a $350,000 increase. Accordingly, we request that the DC Council and this committee supports the $350,000 increase, which will provide the necessary resources to improve the infrastructure of villages to keep pace with the aging service demands. This additional funding will help DC Villages demonstrate visibility for the villages and begin to educate the public on the importance of villages and how to start a village by hosting citywide small and large-scale information sessions. Number 2, we can expand our service connectivity through our help desk and faith-based ambassador demonstration projects. And 3, we can increase outreach and support efforts across the city with emphasis on wards 5, 7, and 8, creating and implementing village startups. Currently, we have initiated conversations with Pennsylvania Avenue Baptist Church and Zion Baptist Church of East Lynn Gardens to assist with establishing a village in Ward 7. In closing, I would like to bring an aging in place concern to the attention to you, Chairperson Bond, the DC Council, and this committee that impacts village members, individuals receiving services through villages initiatives, and seniors across the city. There has been a $920,000 cut in home supports, which directly impacts our strategic partnership with Home Care Partners, which received this funding in 2024 to eliminate a backlog of eligible participants, which includes waitlisted individuals. This issue is that the decrease in the funding has the potential to cause and create a new backlog. The DACL proposed 2025 performance plan highlights a growing number of adults needing this service, from the homemaker service to bathroom modifications, as well as installing emergency response systems and smart home devices to assist with aging and community efforts. Accordingly, we want the DC Council and this committee to restore the funding of the in-home supports and to seek other sources to support this much needed services. Again, DC Villages and I thank the mayor, you, Councilperson Bonds, the DC Council, this committee, and Director Hines and her staff for continued support and trust in the villages.
Thank you. Thank you very much for your testimony, Ms. Polk. And I do want to make sure I understand. I missed all of the superlatives that you were pointing out. I have 1,800 visits, 4,000 activities, 7,000 rides, and I think 800 tasks that were performed in homes, 1,300 volunteers, 34,328 service hours, which I think previously a few of the village directors have indicated equates to more than $1 million. And then that villages reach 10,000 across the city. So I believe I'm missing a couple of those.
Mm-hmm. So 2,168 deliveries and 575 errands that were also made. And there was also 1,235 referrals to services and benefits.
Okay, I just like to have all my little numbers here. Thank you so much for that.
And I also submitted this through your portal.
Okay.
So you have that
Okay,
documentation.
all right, we'll look at that. You also, when you say the 920,000, that's the safe at home?
Yes.
Okay. I just want to make sure that I understood that. Okay. And not the home care aides. Okay, all right.
Since I didn't mention it, I'm not going to add it, but
All right,
that is a
thank you.
concern as well.
Okay, all right, thanks so very much. You also mentioned the discrepancy in the budget documents.
Yes.
At one point, it says 215K thousand, and the other point, 350,000.
We're advocating for the 350K.
All right, I knew
Just so you know.
I knew that. All right, okay, all right. We'll be examining the entire budget with our director very shortly. So thank you very much for that.
I'll be staying tuned. I want to hear how much we're
I
getting.
know you do. I know you do. And we do have Carolyn Cook. She is online now. Ms. Cook, the floor is yours.
There we go. Am I on now?
All right. Yes. we
Okay,
can
sorry
hear you.
about. Okay, I'm sorry, my computer is just about to die here. Okay, so happy birthday to Chairwoman Bonds. What a beautiful
Thank you
day for
very
your
much.
birthday. So my name is Carolyn Gary Cook, and I live with my mother and take care of her in the Ward 3 community. Which is a conundrum these days, when our 1967 public commons that has fostered enrichment and community, regardless of circumstance, is in jeopardy of being privatized, especially when we don't have the benefit of a senior wellness center. But that's not why I'm here. Why I'm here is that I wanted to elaborate just briefly on a key point that I wanted to make in my prior DACL testimony this year, and that was the establishment, or for your consideration, the establishment of an ombudsman for older adults. And in thinking about this, it could either be its own independent function, or perhaps there could be an opportunity to expand the office, the Ombudsman for Children, to include other vulnerable residents such as young adults, those leaving foster care, and of course, our elders. And the main reason for this now is that over the years, I've observed a disconnect between the government agencies, specifically as far as their online platforms that are difficult for seniors to navigate, and even sometimes caregivers. They may not contain all the necessary information in order to get your business done at one time. And there's also doesn't seem to be an automated response to give you further direction if other information is required in order for an application to be processed, which then leads to delays. It would be great to have a helpline, such as an ombudsman, for resolving these matters, because sometimes the agencies are sort of behind a wall and you really don't know who to contact. You're kind of, looking at a black hole. And I think that this would help to sort of recover and get back on track quicker. And so as a former HR professional on the other side of things, I recognize and empathize with how these online systems, though gloriously convenient for those of us who use them, they can generate a deluge of complaints, particularly to DC government staff and specifically council staff. And that hampers their productivity, their responsiveness, and morale. And not to mention, it confuses and discourages DC low-income seniors who already feel left behind in a rapidly changing city with new ways of doing things that they don't even recognize. So as a DC native, as a former ANC, as someone who founded Club 60 Plus because our community center didn't have anything for seniors, we didn't have a senior wellness center, and now as an elder caregiver, I remain committed to seeing our government work better for both staff and residents. An ombudsman for older adults could centralize complaints for accurate tracking by ward and citywide. It could certainly alleviate council staff involvement, which I think is really important for them, as well as elevate DACL's operations, understanding, and influence among all its stakeholders, both internal to DC government as well as externally with the public. Not only would this data that he or she would collect on the ground anticipate the potential impact of public programs, policies, and systems innovations as they come down the pike or even in the pre-planning stage, but this data could also guide a process for addressing unintended outcomes expeditiously or even before they arise as we aspire to be an age-friendly city. Thank you very much for your thoughtful consideration.
Thank you very much for your testimony. And as I was listening, I also was taking a second look at Ms. Bailey's testimony. And I think Ms. Bailey is still on East River Family Strengthening Community, and almost verbatim, a couple of things that you are mentioning, they too are mentioning. Each senior receives a call weekly to provide outreach on events and activities. And then it goes on to talk about the value of being in touch with seniors. I know you're saying, I hear you, Ms. Cook, your point is that there would be a reciprocal for incoming calls from seniors to help them navigate their electronic devices primarily, but it could also be to just help them, really be referred to the right agency. Well, believe it or not, some of what occurs through DACL is designed to do that. And we have a generous network, but I hear what you're saying, and I do not want Ward 3 seniors to feel left out. I hear you talking about not having your wellness center, but as you know, we're working on that. So I'm hoping we can begin to address some of these issues more definitively and faster. That's the key, faster. Um, so I appreciate that. Thank you very much. It's nice to see you.
Good to see you too. Thank you.
Haven't seen you in years. Mr. Fruman, do you have questions that you or?
And no real questions. I too want to thank Carolyn Cook, who's been an advocate for a wellness center in Ward 3 for quite a long time. Thank you for your testimony also on the villages. Really, the villages play such an important role. Thank you for your work on that. Thank you for the effort to expand the village network. Really critical that we get to a place where the whole city is covered. And so the work, for example, that you were talking about on Pennsylvania Avenue, I guess I'm assuming with the Currys,
Absolutely.
would, really important work, great partners, very hopeful for you there. I went over the weekend to the gala for the Capitol Hill Village, which might have been one of the first villages in the area.
It is.
And it was so much fun. And people, it was just so great to see people get together. They had a dance party and it was all 60s and 70s theme. And they had trivia contests, all from things from those eras, which so I knew the answers in a way that I wouldn't know for now. So thank you again for your work. And with that, I'll look forward to hearing from the director. Thanks.
All right, we have been going at it. We're going to take about we'll take 10 minutes to set up because we need to have a moment to do that. And we will, the next voices that you hear will be from the executive director, Sharon Hines, and her team.
Enjoy your birthday.
Man, something bit me down. I know this is too cute. You all are too nice. Oh, thank you. Thank you. You all are too nice. I didn't intend it. My staff didn't know it was for Tony. I was like, so then I said, I had to do it. Thanks. Thank you. I had no idea. Oh, Miss Vines.
Okay, no worries. Never mind.
Okay. All right, so, all right, we're gonna scoot for a minute. Good afternoon. Good afternoon. Good afternoon. We are reconvening for the second time. And as promised, we will now have an opportunity to hear from the director. The director will talk with us about this great program called the Department on Aging and Community Living. Madam Director, you have with you some of your staff, and we'd like to swear you in.
Yes.
All right, so if you would raise your right hand, and do you affirm that the testimony you give before us today to be correct and accurate?
Yes, I do.
Thank you very much. And you can begin when you're ready.
Thank you. Good afternoon, Chairperson Bonds, and happy birthday. Members of the Committee on Executive Administration and Labor, committee staff, and members of the community. My name is Sharon P.W. Hines, and I am the Director for the Department of Aging and Community Living, affectionately known as DACL. Today, I am pleased to testify on behalf of Mayor Muriel Bowser on the fiscal year 2025 proposed budget for the agency. With me today are Angela Richardson, DACL's Chief of Staff, and Ragat Hagos, DACL's Chief Operating Officer. I want to start by expressing my gratitude to Mayor Bowser. While we all know that this budget season has been particularly difficult, the state of our district is strong. And that's because we have a mayor who is committed to making strategic investments that will not only accelerate our city's comeback, but also increase our capacity to make big investments in the years to come. Her leadership is truly commendable, and I am honored to be a part of her administration. I also want to acknowledge and thank the incredible staff at DACL, our entire senior service network, and our seniors from across all 8 wards that have been here throughout this lovely day. The team's commitment to our seniors, adults with disabilities, and caregivers is paramount to the agency's success and our ability to ensure district seniors can live boldly. And just as I did at our FY 2024 performance oversight hearing just 3 months ago, I want to again thank our seniors. I am pretty sure everyone knows my motto by now. For without the seniors, there is no us. And I will continue to remind everyone of this, especially as we embark on recommitting ourselves and our agency to continue providing core services that sustain our residents and our city. Seniors, thank you for holding us accountable and sticking beside us in the great times and the not so great times. Earlier this month, the mayor proposed her FY25 budget and financial plan, a fair shot, strategic investments, and shared sacrifice to the council. This budget is one that invests in a safer, stronger DC right now, and it looks ahead 3, 4, and 5 years. As the mayor shared just a few weeks ago, this budget requires us to be smart. It requires us to be strategic. It requires us to value each of our investments, moving us closer to the DC that we want to be 5 years from now. And most importantly, it requires us to stick together. Madam Chair, the mayor's proposed FY25 budget includes a set of guiding principles that we at DACL are wholeheartedly committed to. Maintaining and enhancing the core services of city government and preserving programs and services that protect the health and safety of our community. Prioritizing programs with track records of success that focus on equity, resetting our spending so that it aligns with our resources. And while the city continues to focus on setting a path forward for all Washingtonians, including our oldest residents, DACL also remains focused on leaning in and maintaining core services for our seniors, adults with disabilities, and those who care for them. Under my tenure, I am extremely proud of our agency's unwavering commitment to those we serve. Over the past year, we stayed laser focused on 5 core areas that are necessary in supporting older residents: socialization, transportation, nutrition, keeping seniors in their homes and communities, and providing high-quality services. And our commitment in fiscal year 2025 will be no different than previous years. Despite the challenges our city has seen, we will continue to prioritize what matters most to our seniors. Madam Chair, I would now like to take a moment to highlight some of the mayor's strategic investments for seniors and the core services we will continue to maintain. Last year, the council allocated $250,000 as a one-time investment to support Alzheimer's disease and related dementias, ADRD, efforts in the district. During my performance oversight hearing, I announced Iona Senior Services and the Genevieve and Johnson Senior Daycare Program as recipients of the ADRD grant. In the mayor's proposed FY25 budget, this commitment to our ADRD community remains with a $450,000 investment. This funding will sustain programs that connect older adults with dementia to community resources, offer education, and manage behavioral symptoms. With this continued investment, we will continue to make a tangible difference in the lives of individuals and caregivers impacted by ADRD. Just as she has continually done, the mayor has sustained her investment in her signature program, Safe at Home. Madam Chair, since the inception of this program in 2016, DACL has made more than 6,500 households safer through the installation of safety adaptations such as grab bars, hand railings, stair lifts, and bathtub cutouts. By prioritizing a program with a proven track record of success, we are ensuring seniors can age in the communities they know and love, fostering independence and choice. It is a commitment to equity, empowering them to age on their terms. Madam Chair, as highlighted earlier in my testimony, the mayor's priority remains firmly on ensuring that DC government agencies uphold and improve essential services that safeguard the well-being of our community, particularly our seniors. At DACL, we are wholeheartedly dedicated to this mission. Throughout this budget cycle and beyond, we are steadfast in our efforts to sustain programs crucial to our seniors' well-being. Take, for instance, the Connector Card, benefiting over 4,000 seniors by providing access to any destination within the city. Similarly, Senior Med Express helps over 4,500 seniors in reaching vital medical appointments and appointments related to public benefits. Moreover, initiatives like Food for Choice, alongside our array of meal programs, offer access to healthy, nutritious food to more than 13,000 older adults, regardless of their circumstances. These programs reflect our unwavering commitment to preserving vital services, regardless of challenges. In conclusion, Madam Chair, while navigating the challenges of our city's economic landscape, we are steadfast in making difficult decisions without compromising the quality of service we provide to our seniors. Our focus remains on investing in the needs of our older residents while preserving and maintaining the programs that matter to them the most. Thank you for the opportunity to testify today, and I look forward to answering any questions you may have.
Thank you very much for your testimony. And I wanted to, if I could, start with just a few points that you made. I like on page 3 where you talk about you stay, or that the agency stays laser focused on 5 core areas that are necessary for our seniors' socialization, transportation, nutrition, keeping seniors in their homes, and providing high-quality services. Can you help us understand what socialization means in the way of a program or programs that are delivered through DACL?
Yes, I can. In many cases, you see evidence of socialization via the Department of Aging and Community Living through our programs that are offered at our senior wellness centers, whether that's bingo, fitness classes, it could be line dancing, it could be nutrition classes, it could be our Wild Tech program where seniors have the opportunity to participate on travels abroad via Zoom. Also through our DACL app, there's an opportunity if you want to live chat with a staff member at DACL that, you know, you may not be able to get out to a senior wellness center at the time, but you have a quick question that you would like answered. So those are some examples of the ways that we address socialization. In addition to partnering with the Department of Parks and Recreation, we just this past February did an inaugural event called Red, White, and You on Valentine's Day that some seniors, you know, it was a new event. So they were excited about coming to experience something new and exciting. There was dancing, there was opportunity to fellowship and bond with their neighbors and new friends.
All right. What kind of programming does DACL engage in to identify those that you've heard a lot today about, those that are isolated, or to combat loneliness?
So when we're talking about our seniors who may not want to leave home just yet, we know that we tend to say that the pandemic has ended, but for some of our older adults, there is still hesitation to come back out to large gatherings, or even if it's a smaller gathering or an event. And so we utilize our DACL senior ambassadors to kind of be our message surrogates and check on seniors who they may not have seen at the Senior Wellness Center or any of their neighborhood events and activities. Another one of our partners, who are senior villages, also work with us on helping our seniors who are unable to get, you know, back out in kind of like the mix of things. But there's never a time that we are not thinking about how we can reach even more of our seniors, especially those who are not showing up on a regular basis to events or to our senior wellness centers.
If I can also just add, our lead agencies also do wellness checks on seniors. So if they haven't seen someone in a while, they haven't talked to them, they're regularly checking in on seniors.
And that is the wellness centers or the lead agencies?
The lead,
Both.
both,
Okay.
but definitely the lead agencies are doing wellness checks.
And so how many seniors have been identified or were identified in 2023 that would fall in the category that have been referred to DACL from the lead agencies that would be considered kind of isolated or in need of a little tender loving care? Or do you collect that kind of information?
We wouldn't be able to provide that right now in this moment, but I will get that to you.
Okay, but you do collect that kind
Yes.
of, yeah, I think
Yes.
that would be very
So we
valuable.
keep data around the numbers of seniors that we engage with, but we would have to get that information from the lead agencies.
Okay, I think that would be very helpful, and it could help inform us as to the value of the outreach efforts that we're putting forth, and whether we need to look a little deeper in order to reach seniors. We heard today from the many of the public presenters, various numbers of seniors, here and there and what have you. And my fear is that we being the different agencies, organizations, are probably servicing the same 10,000. And that doesn't get us to where we want to be. And so we really need to pay attention, I think, to who we're serving and how we're getting information to out in the community. So I was very curious about that.
Duly noted. We'll follow up in our monthly check-in on those numbers for you.
All right, well, that would be good, and it would be helpful if I can hear back by May 1. Given we're in the budget demands. Because I go to Pencil prior to May 5. If you got it, okay.
Duly noted, May 1st.
Okay, thanks so much. Transportation was one of the other issues. Transportation, I think we all are aware that there is money in the budget for the connector card. And there's also resources in the budget that help to get those who need medical attention to the hospital or to their doctor clinics. Are you aware of any other transportation systems that can be used other than the for-hire groups like Lyft, Uber?
I actually have an upcoming meeting with the director for the Mayor's Office on Veterans Affairs. You and I had this conversation as well about identifying various transportation programs across the government within our sister agencies. And so take, for instance, our connector card is by far the most popular transportation program between MedExpress and the connector card. The huge difference between the two, MedExpress, which is a transportation program for seniors where they can go pick up their prescriptions, they can go to doctor's appointment. We have federal dollars, so we get more on that side with the federal dollars. Our local dollars are where we have the grant program for the connector card. With the Mayor's Office of Veteran Affairs, veterans who meet that income eligibility can participate in the transportation program that they have called Vets Rides. And so what we're actually doing with our team is looking at our connector card list, identifying who are veterans to see if they are eligible for that particular transportation program. What I would say around some historical knowledge that I've learned in my research around how we can explore other transportation options for seniors is prior to the pandemic, and we heard about a lot of seniors talking about this today, there was transportation service where buses, vans would go pick up seniors from home and take them, for example, directly to the wellness center. That's when we had a lot more funding to do that. We did find that it was very expensive. This is prior to my tenure, but in meeting with the team, it was a very expensive program and costs continue to increase. And so that's why it was made a change to bring it in-house and use it through one of our grant programs with the connector card via Yellow Cab. But in reflecting on all that I heard today from the seniors, we will continue to look for additional transportation options. And I also want to make sure that seniors know where to call if they're experiencing a challenge with any of the transportation programs that they're using, whether that's a DACL program or a non-DACL program, because I did hear that pain point from the seniors as well today.
Okay, so if you're experiencing transportation crisis, where do they call?
So seniors can still call us at 202-724-5626. Because as we continue to research transportation options, even the gentleman who spoke earlier today, between your office and DACL, we've already gathered his information, are trying to research where he ran into an issue with his particular transportation program. But we want to make sure that seniors are matched to the best fit of a transportation program as well, and that they're utilizing that actual service.
And, I think as a rule of thumb, we all appreciate, the matchmaking that goes into these kind of situations. But when an individual needs transportation, they really feel they need it then. And so we need to have some sort of emergency situation, particularly when we have individuals that are very low income and have no recourse other than to depend or look to the government to help them get around. So we really need to explore that avenue. Yes, and I was here when we had the general transportation and the buses and the what have you. The real deal about that is that the contractor, we were paying for and purchasing the vehicles, and we were paying the maintenance on the vehicles, and we were also paying for the operations. So it was really our transportation system, but we were not running the transportation system. So I think that in today's world, we not only learn something from it, but we can perhaps look at it anew. And there are systems that can be put in place. As I was suggesting, it might be that some of these organizations acquire their vehicle and that they utilize it, but there are ways for us to come up with a system. Transportation is tantamount in this city for a number of reasons, and particularly if you are not in the downtown area, as you well know. And so we just got to find a way to get our senior citizens around a little more. That's the least that we can do, in my opinion. I'm kind of out of time, so I'm going to give Mr. Ruman opportunity for his round of questions.
Thank you very much, Chairwoman Bonds. Just a couple of questions today. So there was a lot of testimony, your testimony today about a kind of dementia care navigator position inside of DACL. It's not so much that want a commitment here today, but it does strike me, this is a growing population. It's a very important issue. Good coordination seems like an important thing to do here. And DACL does seem like it should be the home for it. So I'm curious your receptivity to having such a position, and then assuming that there is receptivity, then I would hope we could work together and with Chairwoman Bonds to try to make something like that happen.
I absolutely welcome the partnership with the committee. And I am committed to looking at how we can grow a position at the department that's focused on responding to our residents who have symptoms that are characteristic of ADRD. It's not just the testimony from today, but looking at data trends, having meetings with the Alzheimer's Association, having interaction with seniors who I'm encountering out in the community, even walking into DACL one day. A relative of a senior ran up to me and he said, "What's in this building?
And I said, the Department of Aging and Community Living. He said, isn't there a center here too, like a day program? I said, somewhat. He said, I have my grandmother in the car. I need some help. I just need some resources. And I said, bring her right in. And I'm going to connect you to our senior wellness center. And that's just kind of a trend that's happening now. I had an opportunity to speak on a panel with Mother Hughed and learning about mothering up. And that's like adult children caring for their aging parents. And we're seeing that a lot. I just talked to the senior leadership team about that, how even for our senior wellness centers, some of the seniors that may have ADRD symptoms, they're coming with their caregiver to get the resources that are available closest to them in the neighborhood. And so I definitely look forward to us having longer conversations about how we can grow a program. We do have a colleague at the Department of Health, DC Health, that sits on our Commission on Aging. And so we've had increased conversations as well via our Chief Program Officer, Melanie Johnson. So definitely receptive to us exploring a program position.
All right, wonderful. That's, and it's great to hear that there's already the shoots of potential collaboration that are there. Staying in the ADRD space, there is, the mayor generously put put funding for ADRD, $450,000. Last year it was $250,000 that we added for that program. And what's the planning for how to implement that? Because it can take time. I don't know whether you're thinking about doing a new grant, whether you're doing, so how do you think about getting those dollars out the door? And frankly, I raise it because I'd like to see it be as seamless as possible, where it's an extension of things that happened in FY24 that continue in FY25. I'd hope that they would continue well beyond that. But how are you thinking about that transition?
Well, it sounds like you're kind of tapping into my thinking with your question and your response, which I appreciate. And with Mayor Bowser's FY24 ADRD investment of $250,000, I'm all about equity coming from the world of education, making sure that we have equitable services and access to those services. And although it took a little longer, making sure there was an RFA process for that funding allowed us to reach the masses, so to speak, because as you know, we can't specifically say that funding will go to one particular organization. And so I do anticipate having an FY25 RFA process. We have a draft from last year, of course, which would allow us to get started sooner. But that's my thinking. That's my thinking.
So if you were going to do that, do you have the ability to put that RFA out this summer so that you could make selections and when you have the funding for FY25?
That is possible. That is quite possible, because the benefit this time is because although we had this one-time enhancement in FY24, it's a little bit bigger in FY25, but it still has the same focus and scope and services around ADRD programming, specifically around dementia navigators. So I'll definitely make sure we keep in touch on that.
Yeah, let's do that. So, because everybody wants to see a continuation of services, and if there's a way to get in front of it by getting the RFA, if you feel that you need to do an RFA, then get the RFA out sooner so you can make decisions. That would be great.
And what else I'll add to your question in response, Councilmember Bonds during one of our recent monthly meetings asked if DACL could do a home visit with a senior. Some neighbors have reached out that were concerned, and I had the opportunity to, it was magic. It was really like advocacy magic happening with cross collaboration between the agency
and the council. And so we had the opportunity to partner with the council members, with Councilmember Bond's office and with Iona Senior Services to visit one of the seniors. And initially she wasn't receptive, but as I continued to talk with her daughter alongside Councilmember Bonds and staff, we've been able to make some progress with that particular family. And so that's as a result of ADRD funding. And so I'm excited about this investment from the mayor and the council, and I look forward to us continuing it and growing our outreach and service and advocacy for seniors who are in a very vulnerable place right now.
All right, well, really grateful for that, and let's do stay together, so hopefully this can be moving smoothly into the next fiscal year. When you talked about that home visit, it takes me to my next topic, that there was one-time money last year for in-home services or an enhancement for in-home services. As is the case in many places, one-time money didn't get extended in this next budget. But you saw the magic of that in-home contact. And I'm wondering, I think it falls to us at this point to look into, are there things that we can do to enhance that funding so that we can have skilled people get into those homes, deliver services? It's part of this, the issues around isolation that Chairwoman Bonds was talking about. Sometimes the one contact folks have is the person who comes and provides those in-home services. Are you looking for ways to find funding for in-home services to buffer the fact that the one-time money wasn't extended? What's the risk of, since it wasn't in the mayor's budget, that there could be a discontinuation? Even if we added money, could you continue services in the way that you're delivering them now?
Right. We will be able to maintain our standard of programs and services that we have in FY24. My message point to our entire SSN has been, although we are facing challenging fiscal times, we are able to maintain our level of programs and services. In a recent conversation you and I had, I talked to you about, yes, it's great to receive one-time enhancements, but they're not sustainable because they're not guaranteed. So from one fiscal year to another, and in this case of talking about in-home services, in FY24, there's a one-time enhancement made. And then if that one-time enhancement is not made to the same funding level in the following fiscal year, it is perceived as a cut, where in actuality, you're just not receiving an enhancement. You're still going to have that same funding. I'm going to turn to Regad Hagos, the Chief Operating Officer, because she can get more granular to let you know with in-home services where they were funded for FY24 and where they're funded for FY25. So there's no discontinuation of services, but I know we've been talking a lot of numbers today.
Thank you, Director. So with the in-home services, the one-time funding that was reduced in 25 is for the Safe at Home program. The in-home services will stay the same. The homemaker service, it's funded at the same level in 25 as it is in 24. For the Safe at Home program, the 1 million was a one-time enhancement to serve the wait list and to expand services. But for 25, Safe at Home program also will be funded at the same as minus the one-time funding, which is the 4.3 million.
So that in FY24, there was an extra $1 million to work through the wait list. And is that a wait list for making improvements in the home in order for people to be safe in the home? Is that the idea?
Correct.
And now, is there a wait list today?
So the Safe at Home program is very popular. So there is always a wait list. Even though we're working to make sure that, we go through the wait list, we do receive a lot of referrals. So there will be a wait list for next year also. Yeah.
Is the wait list shorter today than it was before FY24?
We can get back to you on those numbers. It is not, I will say it is not as long as the connector card.
if we really had connector card money, that's where the seniors come to us the most. But with Safe at Home, where we have a wait list because of the mayor's enhancements that she gives and alongside the council giving funding, we're able to complete those projects. It may be right up until the closeout of the fiscal year, but we are able to complete the projects.
Okay, very helpful. Thank you very much.
Thank you.
Thank you, Councilmember Fruman. I think we've been joined by Councilwoman Henderson. And you see, everyone loves the seniors. And so she's here and give you a moment to make a statement and ask a few questions.
Thank you, Councilmember Bonds, and good afternoon, Director, and happy birthday, Councilmember Bonds. I haven't seen you today. Okay. Want to ask a couple of questions. Actually, I'll start with the transportation pieces because I think that Councilmember Freeman was talking a little bit about the connector card program, which I think there were several people who testified about that today. How much money was budgeted for the program in FY24?
In FY24, the mayor invested $1.5 million for the connector card.
Okay, and have all of those funds been expended for this year?
For FY24?
Yes.
No, not yet.
Okay.
But it is, yeah, the funding is not enough, the 1.5, because we do have a wait list on a connector card, but no, it has not been expended, not all of it at least.
Okay.
Mhm.
At least for the individuals who are already enrolled in the program, the 1.5 should get them to the end of the year. Is that what we're anticipating?
Yes, so to date, we have served more than 3,800 seniors on the connector card.
Okay.
Our wait list right now is at about 600 seniors.
Okay.
One of the changes that we had to implement, and Councilmember Bonds is aware of this, you know, we have our monthly check-in, but we realized on the application for the connector card, income eligibility was self-attest. And so you had the option of indicating your income, and we did not require documentation. As we started facing this budget pressure and digging a little deeper into the numbers, and we realized that we needed to verify income to make sure that seniors were at the right funding rate instead of all seniors getting $100 every month automatically. That just didn't make the best fiscal sense.
Okay. So did
because
you
we
make
couldn't afford that.
Did you guys make those changes for this fiscal year?
March 1st, 2024.
Okay. So
We
recent.
worked with Yellow Cab on verifying income. Also, you know, calling when we saw high balances remaining on the connector card. So calling the seniors to say, are you aware you have this connector card? We see you haven't used it. You had some inactivity. And in some cases, seniors may say, I'm not going to be able to use it. I signed up for it, but I'm not using it. Or, you know, I've been out of town. And so for different reasons. So we've been working through calling through all of the seniors to make sure no one has been removed from the program.
Okay. In terms of the enhancement for this program for FY25, would that be enough to clear the wait list?
We could always use more for the connector card. It is a very popular program. And so the council member has, the chairwoman, you know, has challenged me and the agency on finding additional transportation programs. And so that's looking at, you know, our federal partners at ACL for any grant funding that they have. I've talked to the senior villages about the way they utilize their transportation program. Because one thing the team knows, I don't like saying no to a senior. And when they've explained their situation, we do our best to find whether it's a temporary way that they can participate in some type of transportation program. We're doing our best with that, but right now it's getting, I would say, a little bit better as a result of us implementing the new income eligibility changes from March 1st. But every day seniors call for the connector card.
Okay. I just wanted to confirm that the enhancement was not necessarily enough to 100% meet the need, or at least the demonstrated need that you already have thus far.
And we did not get an enhancement for FY25
Okay.
for connector card. Our enhancements for FY25, and forgot our enhancements for FY25.
Oh, no, I'm gonna get there. Hold
You
on.
good?
Yeah, I'm
Okay,
good.
great.
All right,
All
thank
right.
you. Okay, so I want to talk a little bit about the senior wellness centers. So we talked a little bit about this at performance oversight, and I think obviously I saw you at the Hayes Center a couple of weeks ago. You know, there have been a number of work order issues raised at some of the sites across the city. And so it was a little disappointing that you all don't have any capital dollars as it relates to the Senior Wellness Center included in the FY25 budget. Besides Model Cities, which is already in play or already in progress. Are there plans for a future capital investment in some of the sites, especially some of the older sites that could use more than just a facelift, but need some technology upgrades and some other things?
So what I will say to you is, although this wasn't a capital project, so when we talk about Hayes Senior Wellness Center, last year we replaced the HVAC system. That wasn't on the capital projects list, but we had funds available, so we did repair that. Model Cities is receiving additional parking that they already had the space on the land to do that. They also received an additional, I would say an additional multi-purpose room that's connected to the studio where the Model City steppers use. Congress Heights Senior Wellness Center, they received a new addition or a new wing that has an opportunity to split this additional multi-purpose room into 3 smaller rooms. So whether that's card games happening, a craft, or sip and paint, or if they're doing indoor pickleball, they have the opportunity for that. But we do not in the immediate future have a capital projects budget. And I did hear the advocacy today, particularly from Washington Wellness Center in Ward 7, because when I'm there, they're always asking me about, can we build up?
Yes.
You know,
or do
and I'm
something with
like,
the garden on the side.
they have a garden on the side of the building, and they were talking about, I mean, is there a way to build out there? So we've been having these conversations without knowing if we're gonna have dollars for that.
So I guess then the question, if there is a major maintenance issue at one of the centers, what's the protocol in terms of you all being addressed that, right? So for Hayes, for instance, there have been HVAC issues there for months. Was that just does DGS have any money available?
Well, I prioritized it. I was just coming in to the agency as the acting director, and the temperature was very high. The temperature readings were high. And so there were oftentimes we had to switch to grab and go meals. We did have a repair, there was a work order in, there was a temporary repair that was done to diagnose what the issue was, but the end result was that the system needed to be replaced. So we actually work with DGS. We absorb costs on both ends to get it replaced.
Okay. But that's my asking. If there is a
So
major
if there's-
capital
right, so the-
maintenance issue in FY25.
Right. And so the other thing to your other part of your question around work orders. So senior wellness centers will submit work orders. At DACL, we have 2 facility staff that liaise with DGS to monitor work orders, the status of when they were open. My team goes and put additional eyes on the work orders. And then DGS will dispatch contractors out for the various repairs. The timelines vary based on the repair level, but if you have a specific question around a work order, Ragat can answer for you.
Okay. I don't have a specific question about those work orders. I'm just sort of thinking in general, every other agency that operates facilities has a maintenance budget and you guys don't have one, which I think is a little curious. But in my last minute and 22, let me talk a little bit about nutrition. So No Senior Hungry hasn't been funded.
No.
ARPA funds are set to expire for programs like the Senior Farmers Market Nutrition Program, which is has been super popular.
That's not DACL.
Right, not
Okay.
DACL, but amongst the individuals that you all serve.
Mhm.
And so I guess I'm asking, in your role as sort of being the chief in the Bowser administration dealing with issues around seniors,
Mhm.
what are the plans in place to sort of deal with some of the nutrition needs over the next fiscal year, knowing that some of these programs are either at capacity or haven't received additional
Mhm.
funding?
So we have a variety of nutrition programs at our agency. We have our home delivered meals where we serve almost 2,500 seniors. Those are our seniors who are homebound. So they receive meals every 2 weeks, and that's across all 8 wards. We also have our congregate dining sites, which we have over 40 across all 8 wards that serve about 2,200 seniors. We have a food for choice program that has about 450 seniors who receive a $125 gift card monthly that allows them to shop at select grocery stores in DC. We also have the Eat Well, Live Better nutrition program, where about 750 seniors receive deliveries 2 times a month of boxes consisting of fruit, vegetables, beans and legumes, whole grains, fish protein, and plant-based items. That's all 8 wards. We also have Hungry Harvest, which feeds almost 300 seniors. They also can receive a 12-pound box of produce for eligible seniors. And that's actually connected to enrollment in either SNAP or CSFP. And then we have a nutrition supplement program that provides supplements to over 300 seniors in all 8 wards. So we do the best that we can with the variety of nutrition programs we have. Where we see our highest participation, with me going over those numbers, are at our community dining sites, which all of our senior wellness centers serve as community dining sites, in addition to a variety of other sites across the city, and then the home delivered meals program. But to your point, because I know you chair the Committee on Health, what we're also working on with our COO cluster is looking at kind of a footprint of our nutrition programs across the city, and kind of plotting out where our seniors are receiving nutrition or participating in nutrition programs. Because at the end of the day, if a senior calls us to say, I don't have any food, we're able to provide them with food, particularly through our Adult Protective Services unit, who does emergency food distribution. We also can work on that through our nutrition program as well.
Thank you. Thank you, Councilmember Bonds.
All right, well, thank you very much. I wanted to just talk a little bit about the overall, if you could walk us through the overall budget changes from the 24 budget to the 25 budget, and where things are located. And that way we get a comprehensive view of what is in store as we move into the FY25 budget. So let's start with, well, we talked a little bit about, I don't think we need to look at the connector card per se, or what we can talk a little bit about Safe at Home. Safe at Home is currently listed as $1 million. And the expansion, no money for expansion, right?
I'm going to have Ragat Hagos, the Chief Operating Officer for DACL, walk you through the budget.
All right, okay, very good.
All right, so yes, Safe at Home, it will maintain, it will be maintained at 4.3 million. The one-time enhancement for expansion would not be there for 25. That's under in-home services.
And let me ask you, what does that mean when we think about the fiscal year 2025 and the volume of requests that you got, let's say in 2023, because we haven't finished 2024. So Are you anticipating fewer requests for the adaptation in the home, the railings and things like that, or?
So not that we are expecting a fewer referral, but we will serve as we receive them, meaning we will start the wait list from 23 is being served right now, and then we continue to the 24 referrals. And then once we run out of money, we just keep the wait list and then restart again October 1st with the new funding.
All right. And this money is designed to be used to pay the contractors that do the work. And then I guess the home association that really runs the program, correct?
That is correct.
And I think today we heard a little bit about where they are and what their thoughts are as far as, the need. And I'm asking, based on your current wait list, how much in the rears would we be if, maybe I'll come at it from that angle, if we were not able to service the wait list that you have? Or do we have enough to service the wait list that we have?
So we have enough to service the wait list that we rolled over from 23 to 24. And then the new projects in 24.
Okay, and the new projects in 2024.
yes.
Okay, so in other words, come October 1, we may not have a wait list.
Yeah, we may. Or
But I
we
mean,
may not.
based on
Yeah.
how we have proceeded in the past, that's what I'm trying to understand.
So if we look at like the historic of like Safe at Home, we're always close the year with the wait list. So we haven't had a year where we complete all projects because we do receive, it's a popular program. We get a lot of referrals and we serve the amount of projects that the budget allows us. So most of the time we close with a wait list, but we start from where we stopped when we opened the fiscal year. Yeah.
All right, so in anticipating that you might have a wait list that is as large as the wait list that you have now, what is the dollar figure you can apply to this wait list?
So I think I'm gonna have to get back to you on that because I don't have the exact number of the wait list right now.
Just approximate. Are we talking 1.5? Are we talking 2.5? Are we talking 900,000? We're at the budget. We're
yes.
trying to figure out what we need to do for programs that seniors say they must have.
So what I would say, Councilmember Bond, just in follow-up to Regard with Safe at Home, we are able to complete all of the Safe at Home projects. It may linger a little bit into the next fiscal year, depending on the type of project that's being worked on. And it depends on at what point we're able to get to that particular senior. So,
okay. So
if that helps.
All right, well, not really, but we're gonna get there. See, what we tend to do here at the council is based on the information, we try to estimate what dollar amount is necessary that would be put into the bucket. And it's always helpful to have, historical data to work with. So I was trying to figure that out, but we'll look at it and we'll move forward. The other part to this Safe at Home are those households that have the chairlift, for instance, and the problems that they have with, the battery either going dead or needing repair. I assume that's not factored into the budget. Or
That is
do we take
correct.
responsibility for that?
It is the senior's responsibility. once, if they need a battery replacement, they do have to pay for that. Through
If
Safe
I'm
at
very
Home.
low, if I'm very low income and you've been kind enough to put all of this in my home, I don't have, I may have $34 at the end of the month. Would that be adequate to take care of my chairlift? I'm an amputee and would like to get up to my bedroom. So what do I do?
Well, I know we're kind of creating a potential or possible scenario. As I always advise, any of our seniors who are experiencing a hardship as it relates to programs or services, we always ask them to give us a call. All seniors have different situations and cases. And so I don't want to globally give you a yes because we are in a scenario-based situation. But for our seniors, you know, talking to you seniors now directly, when it comes to Safe at Home, because we do have our partner, Home Care Partner, who is one of our strongest partners in making sure that Safe at Home is implemented. They actually have a contractor that they work with. If there is a challenge or issue that they're having, please call us and let us know. And we'll work with Home Care Partners and the contractor on however we need to. But I'm just gonna, I'll leave it at that. And remember, 202-724-5626.
All right. We could talk more about that, but I'm just trying to understand how we get resources in this budget that are sorely needed. And of course, where they come from. Right now, we have your budget, your $64.5 million. And let's talk for a minute then. Am I overtime? Oh, I don't have, oh, we can talk on. All right. So, how do we identify pots of money within your agency that are not utilized as much as it was intended, perhaps when the program was put in place, and we therefore can find those dollars to take care of some of the programming that was discussed today?
We use
Without us
we
making
use
some
every penny
rash
for the seniors.
decision.
Yeah, we use every penny for the seniors in our budget, council member. We leave no money on the table. And we're in the process now because it's spring. It's May, although today is April 22nd. It is May, because it's next week. But as you know, our fiscal year ends at the end of September. And so what we're looking at now with our grantees is our burn rate to determine if they are not able to spend any of their funds, because then if they're not, we are able to apply it to other programs and services. So now I'll go back to the scenario. Let's say in the event there are some dollars left that aren't spent from one of the programs and services that our grantees have, then it's possible if we receive some calls from seniors about, I can't afford to replace the battery in my chairlift, then we may be able to move funds to Safe at Home for that. But I just want you to know, we spend all of our money on our seniors.
I don't doubt that you spend all of your money on your seniors. My question though is that in any program, there's always a pot or two of resources that may be intended for a purpose. Somehow it is not utilized in that way. And I understand your position. You know, you have to protect your dollars and protect the budget that we receive. But I'm in a different position. I have to think about, certainly about the testimony we received today and the testimonies that we receive ongoing. about some of the service needs. So I'm just know I'm wired like that. And as a result, I'm going to be very, very concerned about certain buckets. When I look at your buckets in particular, and I look at what was approved in some of the areas, and I see where, you know, maybe there monies that were left on the table, I'll be concerned with that as you're moving through FY24. Doing an estimate of what whether it's going to be 7% more that you'll spend or 20% more that you'll spend, given that we have, what, 5 months left in the FY year. So, but I just thought I'd ask, so you know where I'm coming from.
Duly noted, thank you.
So you know where I'm looking. And as I can identify resources otherwise in the government, where, you know, same type of evaluation perhaps is underway. If we can get any into the budget, we will. Because I think you've heard today that there are anticipation that we might be able to come up with monies because the need has been identified, the desire has been identified. And you heard the audience of seniors here applauding, and you know that's an affirmative that that they would like for there to be more resources in DACL and for things that they consider important. Let me ask you, as it relates to the task force that we set up for designing the new wellness center for Ward 3 and another one for Ward 2, two separate entities. Is there, I guess there was no anticipation you would need any capital money for planning. Is that correct? Or was there a thought that you had money somewhere in the event you would need it, or you would not need anything going into 2025?
So thank you, Councilmember, for that question. As it relates to the task force, that is for feasibility study per the legislation. So we do have $500,000, I mean, not 500,000, 500, yes, $500,000 in capital funding that is being reprogrammed. $250,000 is being reprogrammed for us to do the feasibility study. Now, the additional $250,000, we know that will not be enough to start planning for a capital project for those wellness centers if they do deem to be feasible.
So where do I find that 500,000 in your budget?
I'll pass that to Ragat.
It is under capital budget. It wasn't from this year, it was from FY24, I believe.
I don't think we found it.
So the capital
And
funding
that's
is
easy enough
under
to find.
DGS. It's funded under DGS, so you probably wouldn't see it under
Of
DACL.
course, that's why we didn't find it. Okey-doke. All right, well, we'll just, so why isn't it in your budget? You're spending it. So then that's an alarm to all of the committees to know to look in DGS. All of the capital dollars may be piled up there. Is that where you find maintenance dollars as well? Okay, very, very savvy. Okay. But I think it's perhaps maybe a good idea. It does cause the various committees to network together to develop a strategy for the entire budget. So thank you. I'm sure that's the case in other agencies where we were, where's the capital? Especially when the capital budget, we do have a plentiful of dollars in our capital budget. So thank you very much for that. I'm hoping all my colleagues aren't listening so that they'll be running and grabbing their money, but I'm sure that they will to the best of their ability. I wanted to ask you about, according to the proposed budget on your table BYO-2, identify the source of the additional federal grant in the amount of 1.027 million and removal of local funds in the amount of 1.3 million, and discuss the spending plans and impact on the reduction of these local funds. And you got it? Okay.
The reductions are, it's mostly one-time funding. Are you looking at table 5?
Yes.
Yes, so the local reductions are one-time fundings that was given to us in 2024. That's not gonna continue to 2025. That includes the 1 million for Safe at Home, the 250,000 for ADRD and other programs.
All right, I'm looking at it. That's the federal resources.
The local reduction.
All right, the federal resources, what is that? The FPRS. Are we looking at the same table?
Yeah, table
Okay.
5, right? You're looking at
Table 2.
Oh, you're looking at table.
Yes, table 2.
So the federal fundings are the federal funds that we received from ACL. So there's a little bit of an increase. It's mostly the way we project our federal fundings for the following year. We do a projection instead of the actual. So that's why you see a little bit of an increase there. But that is our Title 3 fundings.
Okay,
Mhm.
thank you. And according to the budget chapter, you looking at the same table, could you explain the elimination of intra-district process that is replaced by the interagency projects?
So the intra-district process has changed, I believe, in 2024. So when we don't, well, it depends. If we're paying for it, then we will budget in our budget, but the funding that we receive from other agencies, we don't formulate for it. So that's why you see a decrease or none in that line. So yeah, the funding that we receive from other agencies will be shown in their budgets, and what we give to other agencies will show in our budget.
All right,
Mhm.
okay. Similar to, I guess, what's happening with the general services.
Correct.
Yes,
Mhm.
okay. If you could walk us through this is table 3 now. There seems to be an enhancement of 243,000 in line, oh boy, the continuing full-time line, but a reduction of 207,000 in the continuing full-time / others. Can you distinguish what that is, please?
Sure. So the increase is to show step increases, any adjustments from 24 to 25. And the reduction that you see is a reduction of 2.3 FTEs that was reduced from our budget for FY25. So that shows the reduction.
Okay.
Mhm.
And so when you talk about step increases, how many employees receive step increases in your agency?
So every year everybody, depending on when, the person was hired, they will receive a step increase every year, up to 5, I believe, up to step 5. And then after that, I think it's like 2 years. So when we do our budget, we have to make sure that we incorporate that step increase for the following year.
Okay, and so for your budget plan for 2025 includes how many of your total FTEs?
I can get that number for you.
All
I
right.
don't have the
Would you
exact
please?
number, but I can get that, yes.
All right. That way I won't have to talk to the Department of Human Resources about that.
Okay.
Okay, looking at, this is table 4. You indicated that the executive administration is showing a reduction of 5 million. Is that correct? It's
Table 4.
line AMP 30. Table 4.
Oh, the executive admin, it's showing a decrease of 2.8 million.
Hmm.
That decrease is an ARPA funding that was formulated under executive admin that is gonna expire in FY24. So we wouldn't have that ARPA funding for 25.
You're saying it's 2.8 million?
Yeah, you're looking at executive admin?
Yes.
Yes. So the budget is 5 million?
Mm-hmm, yes.
Yeah.
All right, then.
So-
What are the programs that fall under the category under 3608, supportive residential services, which has a reduction of 250,000?
Supportive residential services, that is our group homes. But that reduction actually is not for that. The 250 reduction that you see is for the ADRD program, the one-time council enhancement. It was loaded on a incorrect line in
All right,
2024.
okay,
Yeah,
okay,
yeah.
all right. All right. So that also relates to the increase of 215,000 for senior villages. Is that correct? What is listed there?
Yes, that is correct.
So
You-
it's 215, not 350.
So the increase, the enhancement was for 350, but there was a reduction of 135,000 to meet the mark of 2025. So that's why you see that 215.
So help the public understand, help me understand, what does that really mean? You get an increase of 350 and then you take 100,000 away. What does that really, what are we trying to accomplish here?
So when we formulate our budget, we had to meet a mark and we had to provide cuts from like different places. And one of the cuts was from the villages. That was 135,000. So that cut was accepted, but in addition, we were given 350,000 as enhancements.
So in theory, then the difference from the 350,000 is the increase that the villages receive.
Correct, yes, the 215 increase.
And not the 350 that you heard today that some were saying, we want the 350. Okay, all right. Just want to be clarity as to what's going on. Can you continue with table 4 and walk us through the commodity and farmers market services, which it's showing 123,000, is that correct?
Yes, that is correct. So
Okay.
the the commodity and farmers market service is 410. But in 2025, when we formulate our budget, there was an FTE that was included into that line. So the increase that you see is not necessarily an increase, but an FTE was formulated into it, which is an existing FTE. It's not an additional FTE.
All right, so the FTE is included. So that means you have a 4-year, this amount of 123 can be carried for 4 years. So you're not treating it, you're not treating it as an enhancement.
No, it's not an enhancement.
It's just adding to the sum that's on that budget line that can be spent.
Yes. So the 410, it's an MOU with DOH. That's the funding that we provide DOH to provide the commodity and farmers market service. Part of that MOU is 1 FTE.
All right.
Yeah.
And so I think that relates to the No Senior Hungry issue that my colleague was previously discussing as it relates to the Department of Health. And that long list of nutritional devices that we use in the community. And so this is in that lineup, am I not correct?
That is, yeah, that is
Okay.
correct.
All right. We're just checking. We don't want to touch the wrong line. Okay, and then for home delivered meals, saw an increase of 689,000. How do we justify increasing that?
So that increase is a federal funding projection as well. So for 2025, we projected that we may have 689,000 additional, but we wouldn't know exactly until we get our federal funding as of October 1st. But we do projection when we formulate federal funding, it's mostly projection. Then we adjust it depending on what we receive.
You mean the final budget?
Yes, when the final
Okay.
budget comes from ACL, yes. No, this is federal funding, it's not local.
This is the
This is
federal.
the federal.
All right,
yes,
federal,
uh-huh.
okay, all right. So it could be more.
Yeah, it can be more or it can be less.
In the process, what did you ask for? Did you ask for 689,000 or did you ask for 2 million?
For our federal funding, we actually do not, ask for a specific amount, but we do receive based on how many seniors we serve. So they will look at the data. We do give them a report every year.
All
So
right,
how
and
many-
so from that report,
Mhm.
so what would have been the projection? Is this the right number based on the report that you gave the feds?
The projection would be yes, or that or within that range. But yeah, we wouldn't know exactly for sure. But yes, we do hope, we hope to get that amount for sure, but I couldn't say. I couldn't be certain
All
because
right.
it depends on what we're gonna receive is what I'm trying to say.
Well, what does our history show us? Do we usually get what we project? And is it based on real numbers of those we're likely to serve or how do we do this?
So far it's been either the same amount or just a little bit slight increases, but it has not been a huge increase.
All right, so this represents, I'm assuming, a slight increase. You are projecting a slight increase.
Yes.
All right, okay. I'm trying to learn your language so that I can, so we're fully communicating on this. Thank you. Let's talk a minute about information and outreach. There are currently 8 of the 15 commissioners on the Commission on Aging. What's the status of the balance, the 7, in order to make a full membership?
We are currently recruiting seniors to apply to be members of the Commission on Aging. We're working alongside the Mayor's Office of Talent and Appointments.
Of those that are members now, how many of these members actually participate?
We generally have 100% participation of our commissioners.
Of
For the commission, we meet hybrid. We're in person at DACL once a month. But they have the opportunity, if they're not able to make it in person, they can join online.
So we usually have 8 or more members who
Yes.
participate.
Yes.
What is the budget for the commission? Is there budget figure? Well, how do they?
They're
do what they do?
volunteers. They're volunteers.
All right,
So
they're
this
volunteers.
This is not one of the boards or commission that has a stipend connected to it. It is a
And
volunteer.
I understand that. Being a member, I understand that.
Mhm.
What I'm asking is that all of the boards and commissions, are usually staffed. And so what numerical value, dollars and cents is attributed to staff time working with or staffing the
Mhm.
commission?
So
Or is
one of
it
my
not
members,
staffed?
one of my members from the External Affairs Communications team at DACL staffs the commission.
Okay, and when they,
That's a part,
what
that's a part of
percentage of their time is
job.
what I'm asking? What percentage of their time is
I
spent
would
there?
say it's once a month, so I would say probably about 20%.
All right, and 20% of their salary is,
It's not tied to the commission. That is a part of their role, or if you would say their position description as a member of the External Affairs Communications team, because we're engaging with seniors. So if you want to know specifics about what they do for the commission, of course, they send out meeting notices. They set up the Teams link. They make sure that our ex officio members, as well as our commissioners who are joining via Teams, are present. They also prepare the minutes for the Commission on Aging.
And if I can add to that, they also work very closely with the Mayor's Office on Talent and Appointments for recruitment, as well as helping seniors to apply for the recruitment and working with them to get the posting up online.
all right. And so is that, all that work that you described, you said is about 20% of their time?
I was generous by saying 20%, since we're
10%.
hypothesizing.
Yeah, 10%. All right. So 10%. All right. So 10% of the time, is that a 10% of your chief of staff's time or some other individual?
A member of the External Affairs Communications team. So one of our engagement specialists is considered our Commission on Aging liaison, so to speak. And if I'm going to tap into your mind a little bit, I don't need a separate person to do that. This is why we're able to utilize our staff on the External Affairs Communications team, because at the end of the day, it is the Commission on Aging. And so our chairman is Guilford Bobo, our vice chair is Carolyn Matthews. And so as the leaders of the Commission on Aging, they advise me. They develop agenda items. They let us know if they need assistance in reaching out to guest speakers from sister agencies, or if they need our assistance on reaching out to guest speakers related to meeting topics that may be external to government from a nonprofit or community-based organization.
Thank you for that. I
You're welcome.
understand what some of the tasks might be. I have, I am in no way thinking that you need a dedicated staffer. What I am concerned with is the utilization of the staff that you have as it relates to, serving, I'll say, for the greater good of seniors. So that's my role to ask these questions.
As we like to say in government
you
at
know.
times,
Mhm.
it is a mutual relationship. It's a good engagement opportunity for my staff to work alongside the Commission on Aging. Because remember, without the seniors, there is no us. And it's a great opportunity to sit and listen to issues that affect our older adults in DC. One of the most powerful meetings that I was at was having the opportunity to observe one of my former MOKers that I supervised when I directed the Mayor's Office of Community Affairs. His name is Adrian Sutton, affectionately known as AD. After he graduated from MOKers Land, he moved over to Octo and is one of the IT specialists that train seniors on how to use their smartphones and other devices. And for me to walk into the meeting to give my greetings and see him there present, presenting to the seniors about the different technology programs from Octo, it's a very much of a heartfelt moment. And so as a little bit of a plug, and Jocelyn Johnson, if she's still here, who chairs our Ward 4 Mini Commission on Aging, we recently had a meeting where we talked about Tech Tuesdays and Website Wednesdays. This is breaking news for Jocelyn. So AD is actually going to work with the executive board of the Ward 4 Mini Commission on accessing their virtual minutes, their meeting minutes, because they have a monthly meeting, and I already heard that you're on the agenda for June. So that's an example of the collaboration and sister agency partnerships that we have at DACL as a result of DACL EAC staff being the liaison to the Commission on Aging.
All right, and I appreciate all of that, and it's all good stuff. But what I want to know is what happens to the discussions, the complaints, the concerns that are raised by the commission as it comes to you through your funnel, your staffer?
So
What happens?
I'm generally present at the meeting. If I'm not, my chief of staff, Angela Richardson, is in attendance. So we're there through the duration of the Commission on Aging meeting. So taking notes as it relates to feedback and concern from the seniors, if they're expressing some challenges on, it could be an agenda item that they needed a resolution around. Not like a council resolution, but as a resolution solving a problem, or rather a solution. That's where me as the director and or senior leadership team is always present at that meeting.
So you answer their questions.
I do.
And they get solutions to any complaint that they raise in that forum.
Yes, because
Okay.
the makeup of the Commission on Aging, in addition to the commissioners, we have ex officio members from sister agencies. So we have representation from DOES, DPR, DC Health, there's some DDOT. Those are the four agencies that I can think of, right? MPD. So each of the clusters generally has at least one representative when you look at the structure of the government of the District of Columbia.
Okay, so we're going to continue with this because I'm very curious now. So in providing the resolution, is it treated as a constituent services complaint? That is, whatever the issue is resolved, or the solutions are provided by the agency that is affected, or is there a
Exactly what you just
reporting
said.
system? So it's treated as constituent service.
Yes.
Gotcha.
So the agency that
Mm-hmm.
may be the topic, they are responsible for the follow-up. But DACL will follow up to make sure that there is a solution and that the issue has been addressed.
Okay. On page 24 of the performance oversight questions, we asked, are there plans for DACL to track referrals to programs and organizations, both inside and outside of the government? Programs that are things like single-family rehabilitation program, home purchase assistance, the DC Housing Authority, nutrition programs, connector programs, nonprofit organizations, just trying to understand how we relate to the outside world. You heard today that the organization is a part of the age-friendly manifold, so to speak. And so I'm trying to understand how do we do this relate to these other agencies? Because you also heard today that there's a strong feeling that there needs to be some repository, some way that seniors can get answers. They may be referred, like a constituent services complaint. Oh, it's a health event or concern. I'm going to refer you to the health department and they'll take care of it. And then as the referrer, I check you off my list. That's what constituent services usually does. And so I'm trying to understand, how are we really getting down to the root of concerns that the senior community has? How do we process this? And whether or not we're really spending our money the way we should spend it to really assist them. And I know it's a little painful, my approach, but I am trying very hard to figure out what is it that we're doing that really works and works fast as much as possible. And what is it that we are doing that just sort of like kicks the can down the road again and again.
A multifaceted question to give you a multi-pronged approach. For example, when seniors contact the Department of Aging and Community Living via our information referral and assistance line, that's the number that I always take the opportunity to put on record, whether I'm in front of the Council of the District of Columbia, on the radio, walking down the street. So when a senior calls 202-724-5626, one of our customer service specialists takes the call. We have a prompt in place. So if you're calling about nutrition, for example, you press one number. If you're ready to go straight to getting somebody on the phone, you press another number. That information, that intake information, is placed in our database. More than likely, the senior may get assigned to our case management team. Case management follows up. It could be a housing, we have seniors who call who are ready to downsize. They may be wanting to move into a senior apartment building, less steps, elevators, just easy access. We have a housing specialist on staff that maintains a database of senior buildings. He will go do, set up an appointment for the senior. He will do a pre-visit to kind of do a walkthrough and see if they have available units, what the criteria is for the application. So he walks alongside, and I want to acknowledge that's Platham Watson at the Department of Aging and Community Living. So seniors will call him to say, thank you for this information. I'm getting ready to go visit XYZ place. When it comes to a nutrition program, a senior may call to say, I just got home from the hospital. I have limited mobility. I'm unable to cook. I'm seeing if I'm eligible for home delivered meals at the time. That call will go over to our nutrition team, and we start that referral process and going through the application. All of this is done over the phone because what we do at the Department of Aging and Community Living is reduce and eliminate barriers to our programs and services as best as we can, whether that's a service provided by DACL or if it's a service provided at one of our sister agencies across the government. And so we do have a larger database that we use at DACL called C-Stars, so that if a senior calls back, for example, or if, I meet a senior out at one of the community events and they're like, I'm having a problem with XYZ. I'm on the phone to my senior leadership team. I'm standing at, Deanwood Recreation Center. Senior walked up to me. They were checking the status of their EPD waiver. Can you see what we have on them? We're able to go in and say, oh, yes, we found the senior. This is the last interaction we've had with them. It's going through the process. So we have an organized approach to maintaining our seniors' data so that if they call, and we're improving, we're still improving, because I know that's important for you to hear as well, how we are able to see, in my big vision over the next few years, as I've talked about before, I would love to be able to pull up a senior and know all their different programs they're connected to across government. It's kind of like a senior profile. We've talked about this. So my IT team is, they're brainstorming what that looks like. In addition, I talk about our DACL app a lot because a lot of our seniors are tech savvy. And so when you go on the DACL app and you pull it up, and remember, I talked about this early on last year at the performance oversight. When you go to the DACL app, you have an opportunity. You can click on submit a complaint where you add your name. We ask, can we contact you for any further details about your complaint? Email, phone number, your zip code, and just give us a little bit about it. You also could click on live chat and just type it right there. Or then if you click on hotlines, it gives you our main number if you need to reach 311, and then if you need APS. So we have a variety of ways that we are in touch and engaging with the seniors, but also storing that data. So if seniors are calling back, we can say, oh yes, Mr. or Miss So-and-so, we talked to you on XYZ date about this. How's that program going? Do you need information on a different program? And we also do follow-up. So our case management team, I think about our community transition team that assists our seniors who may be in long-term care facilities or in a hospital who need to go into long-term care or short-term care. CTT is very vital in making sure when it's time for them to be discharged back home, that they have a smooth transition, whether that's they may need to relocate to a senior apartment. And I say a senior apartment building because oftentimes, as you know, as seniors are aging, it's a matter of, I'm tired of those steps. With or without a chairlift, be safe at home. They need to age in place in somewhere that's comfortable to them, but within their community around a supportive system. So I hope I gave you that multi-pronged approach in response to what you were looking for.
You did. You gave a lot of information. I guess I'm concerned with a number of things, and I'll start with my basic concern is understanding how many seniors we are reaching. Different seniors, and when I say different, because seniors, like any other population, will partake of many different programs. So I'm just trying to understand what is going on in senior world from your perspective. As we talked earlier today, there are about 110,000 seniors in the district who are residents of the district. And understanding their housing needs, their nutrition needs, transportation needs, is a very big swap. So when we talk about the uh, so-called protocol that you use for responding to their concerns or their complaints, it's I just wanted to try and understand really what's going on there, because we at the council, of course, we hear a lot of what they feel is not working, or they have tried to get assistance and it hasn't worked, or they don't know where to go. And that's becoming more and more of a concern. And so when I think about not knowing where to go, it leads me to ask these questions like earlier about how are we reaching our senior population? What is getting their attention? Today you heard that the connectivity program is going down, and that's done by the various, I guess, telecom providers. And they're feeling like, oh, I'm going to lose my internet connection. And that was the way that I was navigating the assistance programs that are available that I know of, but that's going down. I can't afford it. So what am I to do? You have other seniors who they're in the mode of yesteryear. They'll walk from agency to agency looking for the services that they need. And so I'm just trying to understand, how is DACL translating these different situations that our seniors may be in, and what are your protocols for handling them? You gave me a couple of examples. I appreciate that, but it doesn't tell me really, as an entry point, what are we doing to reach majority of our senior population? That's what I'm trying to understand.
In
And
a
I know time
7-day,
is
say it
of
again.
I know time is of essence, but
It is. It is. And I know I have a brother director that's waiting to get in this seat.
oh yeah.
And so I've talked extensively over the course of the year and 2 months that I've been in this role about all the ways that we engage with seniors. Did you reference 110,000 seniors? We've engaged and connected with about 35,000 of the 110,000. I think that's a pretty good performance statistic at this moment. It is our goal that we connect with as many seniors as possible on a day-to-day basis. The strength in that connection comes via our external affairs and communications team, who is present in the chamber today. We had well over 90 seniors come out today for the budget oversight hearing because they want their voices heard. And they know that DACL is an agency that's going to listen and respond. And so, you know my work before I got into this seat. I have a long history of community advocacy, engagement, and leadership, but I also take opportunities to provide a monthly column to the Beacon newspaper, free publication that's circulated throughout Washington, D.C., Maryland as well. My column also appears in the Washington Informer, a very powerful and informative independent local newspaper, taking opportunities to present testimony and have questions and answers twice a year via our performance oversight hearing and our budget oversight hearing. Not to mention having the opportunity to sit alongside Mayor Bowser annually at the senior teletown hall as part of her budget engagement forum that she's been doing all the way back from 2015. So when we look at a comprehensive approach to how we connect with seniors, always say we can do more. And we continue to do more by attending AARP meetings. It could be citizens or civic association meetings. It could be a block meeting. It could be our Commission on Aging. It could be the Ward 4 mini commission. I even joined the AARP Anacostia Bellevue Congress Heights chapter when I was there as a guest speaker. And so all of those opportunities allow us to expand our reach. And it's almost, let's say a proverb from the schoolhouse, each one, teach one, reach one. So every time we as an agency are out in the community engaging, we're telling the word about DACL. And then we have our DACL senior ambassadors that continue to tell the word and spread the word. I think about we have upcoming, we heard from our 2023 Miss Senior DC Queen, Cerisi Lane Turner earlier. She hit the ground running as the queen, advocating with seniors, representing seniors across DC, representing the Department of Aging and Community Living. And then we're gearing up for a 2024 queen in less than 60 days. And so I look at all of those engagement opportunities of ways to continue to reach seniors who may not come to our brick and mortar, whether it's the agency or at one of our senior wellness centers. But I hear your challenge to continue reaching more, especially the seniors that we don't see. Upcoming, we have the big Senior Fest. Mayor and DPR having Senior Fest, and this year is up at UDC. And we generally have seen upwards of 4,000 seniors participate in that event. And there's some seniors, as you talk to them, that's their event that they go to at all times. And so we'll be there as an agency connecting with those seniors, making sure that they have information about our programs and services and how we can stay in touch with them.
All right, well, I appreciate that. I was looking again at table 4, and it shows under communications that the proposed 25 budget is down about 73, I guess, $1,000. And I think I'm hearing from you that there's a general feeling that by nature, outreach happens to the senior population through the various activities that you're engaged in. And so that would explain why it was fine to lose any money in that bucket. Okay. Method to my madness. Okay. I wanted to, I'm not going to hold you much longer because I know it's been a long day. But there are a couple of things that I wanted to talk about. Today we heard about Alzheimer's, and you made a somewhat of a commitment that you're going to look very closely to the dementia specialists. And you know that definitely is coming. That train it's coming to your agency. But it does us no good to have a person if we don't have a plan. And today, most of the discussion about any health concern has been focused on Alzheimer's. We know that senior population has other health concerns, including diabetes, that we heard very little about today, other than that we need to think about how we implement a piece of legislation that is price tag at $76 million. I think that when we talk about the health of the senior, we should be a little more holistic. And there are other concerns that seniors may have. And so on that note, I want to know, where does DACL fit in the discussion that the administration may be having about senior health needs? Perhaps through the deputy mayor for, yes.
Yes, DACL sits on several, I would say, groups. Let's just generally use the term of several groups that are focused on health disparities and health improvements across the district. And to your point, yes, this is under the lead of the Deputy Mayor for Health and Human Services Cluster, under the dynamic leadership of Wayne Turnage. We also participate in the Long-Term Care Coalition. We also participate in the District of Columbia's Developmental Disabilities Council. So where we have a seat at the table to listen and learn about ways we can improve our outreach, our programs and services, and also identifying strategies and preventive measures for seniors, we try to be there as much as possible. You touched on the Alzheimer's disease-related dementia programs and our agreement around having a staff person at DACL that's focused on that work. We're already participating in the Brain Health Initiative. And as I indicated earlier, through DC Health, their dementia and chief program officer, help me with that title at DC Health. It's the dementia services coordinator is currently working on a DC Alzheimer's plan. So similar to our state plan. So there is that cross collaboration from agencies. But what I'm also looking forward to as we have further conversations around a dementia specialist position, we've been in conversation with the Alzheimer's Association. So they've already talked to us about providing training to our staff on how to best serve our seniors that may be exhibiting symptoms of ADRD. So that's a part of our discussions and meetings that we've been having thus far.
Thank you very much. I wanted you to put that on the record because it's very easy to come before a council committee at this time during the budget season to advocate for something, and it sounds so wonderful, and to forget that we need to check throughout our system to see where such a service may already exist that may need a little bumping up, so to speak, or improvements, or maybe even financial enhancements, but it sounds like we may already have something in progress. And I would hate for us to duplicate that effort. So you can hold your fire for a moment. It's the impression I'm getting from what you're putting out and you're sharing with us. So thank you for that. Let's talk about our food. You heard a little bit of criticism of the food contracts. Those are real concerns. I think even you and I have witnessed a couple of situations where it has left a lot to be desired. I know that your contracting season for food is fast approaching.
Yes.
And so I'm hoping that we can have a little more variety, and that those who've been with us forever are not necessarily the only ones who can do food today. so many entities can do food. The question is, can they do it to the specifications that we need it done? But I'm certainly hoping that you'll have an opportunity to explore that more thoroughly than we have in the past. And I'll just sort of leave that be.
Thank you.
Yeah, you have to have a domain that, you can get straight. And that does need to get straight very, very quickly. Um, Tell us a little bit about the lab at DC that you engage with to address senior food insecurity, and of course, the home delivered meals. That seems to be a favorite program of DACL's.
Yes. What would you like to know about the home delivered meals program?
Well, what are the planned improvements?
Well, our longtime vendor for the home delivered meals program has been Mom's Meals. We do receive positive feedback from seniors about their delivery service, about their customer service. I had the opportunity to accompany one of the local drivers. I say local because we're in DC. On Valentine's Day, while I was delivering the Cupid Kids cards from our DCPS students, Mom's Meals was making deliveries. It gave me an opportunity to do some real-time secret shopping in person to see the relationship building that has taken place between the seniors and their Mom's Meal delivery driver. He gave them a heads up about what time he was coming to make the delivery. They were happy to see him. Some seniors who needed him to put their box on the counter, he did that without hesitation. And so having the opportunity to witness a high standard of engagement with our seniors was very important and was on display in a very positive way. The Home Delivered Meals program is a very popular nutrition program because, again, this program is for our homebound or frail seniors that are not able to prepare meals as they used to. And so they have the opportunity to select breakfast items, lunch items, or dinner items. And so there's that autonomy that comes in place where.
Right, and I'm sorry, but did
Mhm.
you, I think you indicated to my colleague that there are 2,500 that received the home.
Close to 2,500 seniors receive home delivered meals.
Okay. Is that the same as in-house services, including nutrition? That is,
On the budget, is that on the same budget line?
I'm trying to
No, it's not.
understand this table that I have. here.
The home deliver meals budget is on table 4, the second portion, the last portion of table 4. In-home services is Safe at Home and the Homemaker program.
Okay, I'm looking at table 4 and it's where?
Home deliver meals. The third on the line. Third line.
I don't have it, see? Had me losing my mind up here trying to find it.
It's right below the commodity and farmers program that we.
Okay. And that there's a slight increase in that
That's
because
what-
you're anticipating more
of federal
customers.
funding. Correct.
Yeah, you kind of rounded out your numbers, so, okay. And is this a federal program or local program?
Both. We have federal and local funding for home delivered meals.
So do you have it broken down as to the number that meals that you attribute to federal dollars, or is it
It's under.
just commingled?
Yeah, it is commingled.
I see. So it's kind of hard to distinguish what. Tell us how it's commingled.
So we use the entire funding for the home delivered meals. They do use the, the funding that we provide for them. So basically, we do use all of our federal and all of our local funding. So the number of meals we serve would be equally maybe distributed between the budget.
So if I use, let's say, I think you're saying you're 8 million.
Mhm.
Okay, of the 8 million, let's say 2 million are federal. So does the 2 million federal pay for the dessert or the salad or what portion of those meals?
Uh, It's not the way that you're thinking. We receive federal dollars and local dollars. So it's not a matter of saying X amount of seniors get their mom's meals from federal dollars. We use both funding sources to purchase the food.
And when you report to the federal as to how you have used the money, how do you report that?
So we would report how much we spend on both. So we'll show separately our local funding and federal because they wanted to see how much we're also matching what they're giving us. And then we will show how many seniors we served within the total budget.
Oh. The total budget. And
Correct.
so they do the extrapolation of with the 2 million, how many approximately was served? We're not required to present that information to them.
Yes, no, we're not required to show separately as long as we show them how many seniors we served within the total budget of the home delivered meals, which is local and federal.
All right.
Mhm.
Hey. We have quite a few more questions. And I will do my best. Oh, yeah. Oh, yeah. I'll try to speed it up as much as possible. Do you make referrals for seniors to job training placement, like the Senior Community Service Employment Program that is currently maintained in DOES?
We actually participate. This is so timely because my brother director is here. DACL has made a commitment to participate and attend DCHR hiring events where we keep a special focus to look for applicants who are seniors. Just about, I have that percentage for you because I know you are into your numbers today. Chairwoman. At the agency, we have over 20% of our staff who are age 60 and over currently. And the great thing about that statistic is when you're visiting our senior wellness centers, oftentimes you will see the staff at the senior wellness centers fit DACL age profiles. And so that is a good way to see the senior workforce continue to grow. And some seniors like to have something to do and to get a little bit of pocket change while they're doing it. So it's not taking them over their income guidelines for different programs that they may be participating in, generally related to housing. So I know you like to hear that.
Well, I love hearing that, and I think today we've actually heard from a few of the public that indicated, hire us, let us do some of these tasks that happen through the Wellness Center as an example. So there is certainly a willingness, because a person is 80 does not mean that they are cannot and do not want to do. Just this weekend, I was talking to one of the former Miss Senior DC, who says that her docket for substitute teaching is filled. It's so filled that she did not have a day that she could give me to come and put a paper together that she indicated she wanted to do. She's in the classroom almost every day, a high school classroom, and she has taught the those young people that she has the opportunity to work with to not use profanity, but to come up with what rhymes and learn the consonants and et cetera, et cetera.
Innovative.
Yes, yes. So I say that to say that, there are people who are in our community that, you're right, that want to continue to give back. And they just don't want to have the fee for their lunch or for their transportation. They want to be able to cover that and still give. What you heard today
Yes.
about the steppers, they're willing to go and they love doing it, but they do not want to have the transportation costs. So employment is important, whether it's more related to a stipend or employment. But I was wondering about this particular program.
I actually have an upcoming meeting with Director Morris Hughes at DOES to talk further about the program.
All right, so
ways
there
that
may
we
be
can
some
partner.
breakthrough there.
Yes.
But currently you do not refer seniors to
No.
the program. Okay. But you are going to do things with
We
the
have-
Department of
we
Human
have
Resources?
participated- We have participated in DCHR job fairs, and there's one coming up in a few weeks that we will be participating at.
All right, so is this the first one you have participated in?
No, this will probably be the third one, I believe.
All right, and so from the two previous participations, did you glean any seniors that you then referred to?
We
work?
did not get any seniors at the two previous ones, but we did make hires.
No, you
of
hired
DC,
individuals for DACL?
Yes.
Okay, and
DC
how many
resident-
did you hire through those two programs?
I believe two.
Two?
Mhm.
Okay. So you will be talking with DOES about the senior services and I assume the Veterans Affairs programs that they both of those programs are there. That would be very helpful. Let us know how it goes.
Definitely will.
When we think about safe at home, I think we have a ceiling on the amount of resources the safe at home contract is valued at. Is it still 6,000 or is it less?
The projects, it does range depending on what adaptation seniors are getting. So I would just turn to my chief program officer for a second. Thank you. So it's still about $6,000, the average cost for a safe at home project to be completed, start to finish.
All right, and at this point, you're thinking that you have adequate as you move into the new fiscal
Yes.
year?
Yes.
All right. I don't know whether this has been brought to your attention or not, but the Wellness Center on Georgia Avenue, the Ward 1 Center.
Bernice Fontenot.
Yes, their outside door is rusting
Yes.
away. And I just wondered if that, which is in the category of one of the things that would make it safe for the seniors, if that could, if resources could be used in that manner to replace that door.
So yes, they're working on replacing that door. There was an estimated completion date of 4:30, but they had to order specific door and frame. So that might take a little bit longer, but they're working on that.
And this is DGS.
That's DGS, yes.
So it's not in the budget, but it's really going to happen.
Yes.
Did you have to transfer money to DGS, or did a portion of your budget be removed and put in their budget? Just trying to understand.
So no, we don't transfer funding, but DGS does have funding to provide maintenance and repairs for each of the buildings that is owned by the district. So that budget comes, the funding comes from that.
All right. Does that mean also that some of the other items that were discussed today might find their way into DGS budget?
As far as work orders?
Well,
What-
I know there's the work order process
Uh-huh.
for repairs, but since DGS is responsible for the renovation and what have you, just wondered have you checked to see if there is the potential of leftover dollars from some of their projects where they could set aside the funding to meet some of the needs that our seniors may have as it relates to repairs to wellness centers?
I will confer with DGS.
All right. That's all I can ask.
Okay, I will confer with DGS.
I think that they have some resources there.
They're very responsive to going out, verifying work orders alongside the DACL facilities team as well. But I keep in touch with them regularly as well. But as we know, the supply chain continues to still be impacted post-pandemic with supplies. But we are working, that doors is a priority at Bernice Fontenot. I've talked to the seniors about it as well. And I know Amelia was there last week, talking to the seniors too.
How many seniors have you referred in, or did you refer from 2023 to the single family rehab program run by DHCD?
I'll get you that number during our monthly check-in. I know DHCD had their budget oversight hearing today.
Same
I saw
time.
some of the team when we had our break too.
All right. Please tell me how DACL is relating to the Age in Place program, particularly when we talk about age-friendly and their goals, their annual goals. And I know that they're working on a new plan.
Staff members from DACL do sit on the various domain committees for age-friendly DC. And so Gail Cohen is actually also a member of the Commission on Aging as well and does presentations during that meeting. So we stay looped in on age-friendly DC matters.
All right. And so within your budget, do you assess staff time to that project, participating in that project? Is it 10% of staff time? Is it 20% of staff time? 5%?
The age-friendly DC meetings do not have a standing meeting time. So whereas the Commission on Aging meets monthly, the domain meetings are not monthly. Gail will send out a calendar invite, and that's Gail Cohn, will send out a calendar invite for, a various meeting regarding a domain. Oftentimes it could be, she will engage with DACL on a question to check in on a program or service, and it's a simple email response back that we may provide her with.
All right. So, do you, within your budget, are all of your team, fully engaged in a series of programs, the work of the agency? In other words, do we have one or two individuals that really are not engaged and may have hours when they could become engaged?
Can you repeat that? There was some feedback. Can you repeat that question?
My question is, do you have personnel that are on your staff that are not fully engaged during their entire work schedule because there are not programs for them to become engaged in?
Team DACL is all the way in when it comes to seniors. So at any given time, when I'm walking around the building saying, good morning, midday check-in, how's it going? How can I be of support? I'm getting ready to go see some seniors want to come ride with me. We're always immersed in the work of seniors, whether that's attending professional development opportunities. We just had a group of members from the staff go to the National Black Social Workers Conference. The team in July, we're gearing up to go to the U.S. Aging Conference. And so we spend our time looking for the best ways to support and advocate and be responsive for our seniors. So no one's sitting down kind of like twiddling their thumbs. Some of us are trying to, go play bingo at Hayes for a minute. I could be speaking about myself, or try to get in the line dance for a little bit, because it's nothing like seeing the seniors outdance you and they may be 20 years older.
All right. Well, thank you for that. I just want the record to be clear that
we work very
the
hard.
staff of DACL is very engaged.
I'm extremely appreciative and honored to have such a hardworking team. They give me energy and I give them energy. It's all about the seniors.
Thank you. I needed that on the record so that we are all very clear.
Yes.
As to the work of DACL.
Is
the
that our last
important
question,
work.
council
Yes.
member?
No,
It
no,
is
no,
your
we're not.
birthday. When are you going to celebrate with your family and friends?
We did not, as council, we didn't ask for days. They gave us the days. And this is one of the days they gave us, so. And I try to be diligent and would blame my staff for the many, many questions that we have.
Oh.
Okay. Shallow subsidy program. How many seniors have
It is
been
my-
referred?
I'm gonna kind of interrupt just a teeny bit if you give me that grace. It is my understanding from DHCD that there's no funding remaining for the shallow subsidy program.
Well, DHCD staff has made it very clear to us that there is money. Their concern is they have not promulgated regulations. So they're struggling with, how to determine not the qualifications, but I guess sort of the pecking order of getting the money out the door. It's really a shame because you and I know that there are seniors every day that could benefit from having as much as $600 added to their personal dollars so that they can pay the rent. And This is a real failing. I would appreciate it if you would have a conversation with the head of well, it's really the Housing Authority.
Yes.
And let's see if we can't move this along, because it's a very important program. When we put it in place years ago, we had a few seniors to take advantage of it. And it is for those who live in private housing. In other words, it's not for those who live in public housing. It's for those that live in private housing. And it can be a big benefit. And I'm sure that you have seniors that qualify, which leads me also to the concern about this Magna Carta that seniors must complete in order to partake of any of the entitlements that are offered through our government. I've heard 10 pages, I've heard 60 pages, a real book of questions that they must have answers to. And I think personally, that's criminal. It's criminal because the majority of the money that we spend on our seniors is local dollars, right? Local dollars, because we have to do match to the federal dollars. So it's got to be majority is local dollars. And to put our aging community through that doesn't really make good sense. There ought to be a unified application, one that captures the information about income, household size. What are we going to do about a household size? Maybe a senior with a household of 5. She may have 4 little ones that she's raising. The same situation we run across with trying to give seniors the 50% reduction in their property taxes. And it's based on the household size, household income. In other words, not based on whether or not the senior is the owner and the senior has $210 coming in a month. And they are in dire straits. So I'm just thinking, if you could, please take a very close look at that, so that we at the council will not come up with an application that just may not work because maybe we don't have all of the information. This is very serious. I think it would be appreciated.
Duly noted.
All right. Okay. Transportation. You've heard the discussion today. I know what your constraints are. What I want to know is, since you've changed the date for March 2024, do you have any plans in going back and looking at your current subscriber list to determine whether or not there needs to be an adjustment in the amount the individual's required to put in versus the amount that the government?
So we are just over 30 days with implementing the new income eligibility. And so I would say I'll be able to come back to you, let's see, in 90 days, what it looks like.
Okay, that's fair enough.
Okay.
And this one? The big question, of course, is can every senior receive a connector card funds, irrespective of income?
As of today's date, no. We do not have the budget to provide every senior a connector card. We currently have a waiting list of about 600 seniors that are waiting to be approved for a connector card. We don't have the funding. We're using that funding very fast. It is a very popular program. So when I think about investments that the council could fund, connector cards. Because seniors, they have the autonomy to go places other than the doctor. MedExpress will take you to the doctor. MedExpress will take you to get your prescription. Your connector card could take you to your house of worship, to the hair salon, the barber shop, if you want to go to see a play at Arena Stage. It's all about ground transportation within DC for the connector card. Seniors could even use it to go to their senior wellness center. Seniors could use it to come down to the council to meet with you or to come and attend a hearing with the connector card.
Well, I also know that it's being used for seniors to travel outside of the city for their entertainment or pleasure. I'm not knocking that, but I do know that the original intent was that it would be used in and around the District of Columbia, the metropolitan area, and not for New York and the plays or even a flight. I understand one senior told me, you can get on an airline with this.
That was years, we're gonna put that on the record, how long
It
that
may
was
be
years
true,
ago,
but
right?
they have a memory of that. And so your new guidelines, I'm pretty sure, stipulate the metropolitan area as the arena for use of the connector card. Am I correct?
Correct.
All right, because we really don't want to subsidize the entire region all the time. Already, we have 70% of our employees in the business sector that are non-DC residents, and we can't tax them, tax their income. So we want to keep some of the money in the district if we can. That's our goal, we say. Well, I'm looking at your chart and it says for, in group 10, minimum income, 26,707, maximum income, no max. And the customer contributes $70 and the program subsidy is 30. So when I do the math of $30 times 600, I get like, 18,000. Am I right? Is it 18,000 or is it 1.8 million? 18,000, I think. So 18,000 is what would be needed to just do the 600. Of course, that's just 1 month. So do that times 12 and I'm getting, so you're telling me that amount is, we're not able to do those 600 that are on the waiting list.
We are not able, we don't have any funding right now to move any of the seniors from the waiting list to active connector card participation.
Okay. All right.
So that's why I am going to be meeting with other directors of agencies that have transportation programs so that we can figure out an alternative to the connector card while we're in this budget pressure.
Yeah,
And
I wish you would.
Councilmember Trayon White referenced a program, a transportation program I hadn't heard of earlier that the team is going to look into. I think he said Empower Rides.
Yes.
So we're open to any suggestions around transportation for other transportation programs that we can match with our seniors. so that
All
they
right,
can
well,
have
please
access
look
to that.
in the Department of For Hire.
Mhm.
My thinking is that instead of us spending $43 to pay a lift from, let's say, I believe an address in Ward 7 or 8, to go to a doctor that may be, let's say, in Ward 5, $43.
Something else we're looking at
Why
too.
can't we have them to take advantage of the med access?
But we're also
Or
looking
better
at,
still,
yeah, he
the
should be able to
fire
see your Med
department,
Express.
you're aware of the fire department program.
You talked to us about that last
Yes.
week in our pre-hearing meeting.
Yeah, so there are some alternatives. So we should not be paying the for hire services at that rate. We just can't afford it for our seniors.
Mhm.
And she says, I'm almost done. Okay, great. They're getting tired of me. Okay. Of the 15.8 million that's proposed again in table 4, these are for your lead agencies. How many individuals are being served by the lead agencies? Or have you stipulated a certain number should be served?
We do not have a max participation rate for the lead agencies. Lead agencies are some of our strongest partners in implementing the programs and services for our seniors. And you heard from all of them today. So in addition to them assisting seniors with completing different applications for programs and services across district government, they also put on different events to reduce social isolation as well, which is very helpful.
So do we have a minimum? Like, for instance, when I look at 15.8 mil, are we saying that we would be spending $200 a year or $2,000 a year for each of the seniors that are engaged through the lead agencies? Because the lead agencies do pretty much the same kinds of things. Am I correct? Or
The lead agencies also operate the community dining sites across all 8 wards of the city. So they hire staff, the nutrition manager, nutrition aide that's on site for the community dining site. And then, of course, they have lead agency staff, recreation specialists that provide programming, recreation programming for seniors across all of the 8 wards. Case management is in-house for DACL, but some of the lead agencies, they do have social workers on staff. So if seniors are visiting the brick and mortar office of the lead agency, they have on-site staff as well to support the senior. If there's a need to refer the senior to DACL, then we're on the, a phone call away for that collaboration and partnership.
so the lead agency's budget, this $15.8 million is designed primarily to pay the staff with maybe a 15 or 20% operating or overhead included. Is that
Councilmember,
kind of how I should look at it?
I think it would be good if you gave me a May 1st deadline to get a few other figures back to you. I would ask if on May 1st, if then I could give you like a breakdown of how lead agency dollars are allocated. I think
Please.
that's what you're
That would
asking
be
for.
very helpful.
Okay.
But I can tell you, when we talk about lead agencies and we divide the city into leadership from these entities, I know that the public is assuming that if lead agency X is allocated 3 million and lead agency Q is, should be given the same amount of dollars to operate.
But keep in mind,
Unless we are doing it based on the number of seniors or some other criteria comes into play. We've heard a lot today about wards 5, 7, and 8 and how the need may be greater there. But we've also heard from the representatives of the Far East,
East River,
strengthening. Yeah.
East River Family.
I'll
East
get
River
there.
Family Strengthening
I'm trying to
Collaborative.
remember the acronym. I'm horrible
ERFCS.
with that. But when we hear about that, we know that the program is very robust there.
Yes.
So I'm just trying to understand, what is the criteria that can define how we spend money through the lead agencies?
And just so you know as well, for the lead agencies, as well as all of our grantees for DACL, we are not the only funding source.
Correct.
So that will be helpful when I think about the lead agency funding that we provide in my response to you for May 1st.
Right. And that I understand. I remember today, even Iona was indicating they are second to the bottom of the list.
But Iona also
does a
received
lot
$1 million
of,
in FY24.
they do
$1 million
a
grant
lot
from ACL,
of
which is great.
private fundraising, because I've been invited to their activities and know some of their board members who indicate that they're doing. So I understand that. That's what I'm saying. It would be helpful to have some sort of criteria to understand how we allocate the money before individuals get the idea that we need to move money around as it relates to the lead agency. So I just thought I would put it out there. And we are nearly done. When we talk about the senior villages and any costs associated with them, do these nonprofits affect services delivered by DACL? Or does DACL coordinate with the villages so that individuals, seniors that live within the village boundaries are referred to the villages when they make contact with DACL?
So our case management team will make referrals to the villages. I actually recently made a referral to the villages for one of our Ward 2 neighbors.
Okay. What is the management model that is used for the senior wellness centers?
The senior wellness centers have a director. They generally have a fitness health, I would say coordinator specialist. They have a receptionist front desk, administrative assistant role, I would say, who greets all of the seniors as they're coming into the wellness center, require them to sign in, address any questions as far as location of events that may be happening. At the senior wellness centers, you also have I'm mapping Hayes Nutrition, of course, who works with the community dining site program that's there, but also alongside DACL will provide nutrition education to the seniors at the senior wellness center.
I know that some of the wellness centers have like a community advisory team, and that's one additional layer. But I'm also concern, is it that the wellness centers are supervised by the lead agencies?
Yes, they are.
Is that what it is?
Yes.
Okay.
So
and-
either, let me make a correction. The senior wellness centers have grantees that operate them. So Bernice Fontenot is Mary Center. Ward 4 Hattie Holmes is Mary Center. Ward 5 is Seabury Model Cities. At Ward 6 at Hayes is Howard University. Ward 7 and Ward 8 is East River. But at Ward 8, far southeast manages Congress Heights Senior Wellness Center. But at the end of the day, they all report into the Department of Aging and Community Living.
All right. Through contractual arrangements, correct?
Yes. They're all grantees.
Adult Protective Services, what is the level of collaboration between Adult Protective Services and DACL? I know it's housed within
Yes.
your enterprise. Do they report to you?
Yes.
Okay.
Adult Protective Service staff are DACL staff.
Okay.
And this is an amazing team that is committed to seniors around prevention. And we have a 24-hour hotline for APS. That number is 202-541-3950. The APS team can receive calls about neglect, abuse, financial exploitation, emergency food needs, utility disconnection. And so there's someone that always answers that phone. We'll go out. We have an on-call APS staff person. So after hours, we have an on-call APS social worker. So if a call comes in, let's say even now, the referral information is taken. And if the staff person needs to go out to see a senior, they do that.
So if a senior they know of DACL, they just know that you're an office that is responding to senior concerns, they could call that number at whatever hour of the day, and they could have a complaint or concern or asking how to find something, and that hotline would inform them or send the call to DACL staff when DACL is opened.
Either or. It depends on what the call is, the
Okay.
call is about.
I see. Okay.
So if for example, I emphasize food. We have gotten calls from seniors who, I don't have any food. You know, I don't have any more money left from my, my monthly income or whatever that is. And so we'll be able to provide emergency food source. And then the next day, once DACL, I'll say big DACL, right? Is
Yeah.
open, then we can look to see if that senior is already set up for one of our meal programs and triage that way.
Right. So the city
Yes.
already has a hotline that can be responsive to a senior 24/7.
Adult Protective Services.
Okay.
And
All
we
right.
do, council member, as you can imagine, we do get what I would say is a non-APS call. When is the Senior Fest? Because that may be the number. You have hand cards, which is postcards, hand cards with APS information. But if that's the number that they remember, we take the call and provide them with the information or, the criteria for program or services. Or it could be a loved one that's saying, my parent, grandparent, aunt, neighbor, friend, uncle, cousin, next door neighbor, I'm concerned. I've been checking on them. There may be some hoarding issues. I see food stacked up. There's some memory loss that I'm observing. And DACL is here to help. APS is here to help.
How does APS deal with situations where they discovered that a family member is abusing a senior? Is there a different protocol for that
Well,
as opposed to an outsider?
if a senior is in immediate harm or danger, of course, we reach out to MPD for assistance. There are also other partners through the Deputy Mayor for Public Safety Justice Cluster. When it comes to financial exploitation, we work very closely with the Office of the Attorney General. Several of the financial institutions monitor senior spending. And so if they notice abnormal financial transactions, they flag that to APS so that APS is aware. And if there's an investigation that needs to be launched, then we're involved with that via our APS team.
So on the financial management, has DACL any record of receiving information from Iona? You know, they have the what is it, navigators.
So we work closely with Iona with the money management program as well, because that is one of the programs that assist seniors who more than likely are exhibiting ADRD symptoms. And so the money management program helps them, assist them with keeping their bills in order and making sure they're paid. Because what I have been learning through my research, one of the symptoms of ADRD is the mismanagement of funds, forgetting to pay some bills, but having the money. And so we work closely with our partners across the agency and our SSN to provide those much needed services when APS is called.
And do you have a protocol for handling hoarding? You heard about that earlier today.
Yes. And so with hoarding, we work a lot with East River Family Strengthening Collaborative, who's one of our lead agencies that you heard from earlier today. We also use, with hoarding, we work with DBH, Department of Behavioral Health. Oftentimes, seniors may need assistance with cleaning out the hoarding situation. And so APS has flex funds that they use for that service as well. So we don't charge the senior for that, but it is a process. More than likely APS is involved when that occurs.
All right, and so for seniors who may be living in rodent infested surroundings, how do you handle that? And where do I find that in your budget?
We don't have a rodent pest management line item when it comes to seniors, so to speak. Through DGS, of course, when we look at our agency, we look at our DACL agency, the senior wellness centers, we do have a pest management contract via DGS, so they come out to do ongoing maintenance. Seniors, again, that could be a form of neglect, which would be a call to APS about a complaint. And so each scenario is different. What's important to know also with APS is that it's a confidential matter. So, you know, you're protecting the senior's integrity, of course, because one, is a sensitive matter when we're talking about hoarding, which is why we have to have an interagency approach working with DBH, because sometimes there may be an underlying condition. DC Health may be involved as well. We also work with our lead agencies who are grantees to assist with any type of, rodent eradication, mitigation systems. It may require a relocation to another unit. There are a variety of scenarios and responses that DACL activates based on that initial referral and investigation.
And while we don't have a line item specifically in our budget for rodent treatment, APS does have a budget to respond to cases like this. So there has been cases where APS has funded for rodent treatment, or when it comes to hoarding and helping a senior remove the things that are becoming a hazard in their homes.
Does that also include bed bugs?
Yes, we
Yes.
have responded to cases of bed bugs.
All right, that's very important. If you would tell me what budget line any resources are expended for that, I would appreciate it. And the approximate amount that has been expended thus far in 24 and what was expended in 23, if any. That would be very helpful.
We'll make sure to include that in our post-hearing responses.
Yes, please, please. Let's see. And then, can you discuss your leadership style and any changes that have been made in the agency's, let's say, organization chart or how staff reports to you?
We'll provide you with an updated organization chart. My direct reports, though, include the senior leadership team members, two of which are with me today, the chief of staff, the chief operating officer. Behind me is the clinical services officer and the chief program officer. Our human resource officer is a part of my senior leadership team, and soon to come, recently accepted an offer for our next general counsel. In addition, there is an executive assistant that reports directly to me. As we've discussed before, I am a hands-on leader. I'm a charismatic leader. I am a transformative leader. I am a leader with an empathetic and compassionate heart. No nonsense when it comes to the seniors and residents of the District of Columbia. The team at DACL know that I take my role as a public servant extremely serious. I realize the confidence and trust that seniors, residents, especially the mayor with the appointment as the director for the Department of Aging and Community Living, I don't take that responsibility lightly. And so having hit my first year as the director back in February, we all have growing pains. I like to pop up in the office to see how your day is going. How can I be of assistance to you? Do you have any candy? I would prefer M&Ms. Want to go walk down to the playground? See some of the kids and parents in the neighborhood. Oftentimes grandparents bring their kids to the Hayes playground. Sometimes we take a walk to go get lunch. Sometimes we go visit some of the senior wellness centers. We did a ride over to Iona's Ward 8 Adult Day Center last week after we left your office to go visit. Because we have to be connected to our work.
All right, well, how do you find the rank and file responding to this? Oh, do you have any M&Ms? Those kinds of discussions that you have with them. I'm very curious now.
It is different. I can tell that the team initially wasn't used to the director leaving the office to come just be a person, to be a colleague and not my boss. Soon to come, I'll have a series of check-in chats with staff who've been hired within the past year. So the chief of staff and the human resource officer will be scheduling those just to check in on staff. How's it been going in your 30, 60, 90 plus days at the agency? Any ways that we can support you? I made it a priority even in this tight budget year to ask staff about professional development conferences and opportunities that they're interested in attending. We pulled, which conferences we went to in FY23, looked at the budget to see how many more people we could send, and then diversify, if a group of staff went last year, giving an opportunity for new staff to go this year. So I would say overall, I think I have a pretty decent approval rating. Staff will tell me, you do care. You care about us, you care about the work, but you come and check in on us. Some had to adjust to that because, again, they just weren't used to the director coming to say, hi, how is your day going? And we've had staff who've been promoted. They've applied for other positions. They've seen professional growth opportunities. And they applied and they did well on their interview panel. And then they did even better when they had their in-person finalist interview with the director. So I'm enjoying my experience. I continue to learn a lot. I continue to ask questions. I can only imagine how many phone calls the IRNA team will receive after today, based on me constantly singing the praises of all the great work that the DACL staff does on behalf of seniors, but also hearing about the great work that the grantees do alongside of DACL for our seniors as well.
Well, Madam Director, I'm going to let you have the last word, and we'll close it out here. I want to thank you for your generous time today. And please, let's do the quick follow-up so that your thoughts can be reflected as much as possible in the budget that I submit, and will be voted on by this council. So thank you very much.
Thank you very much, Madam Chair, for your time today and for the robust conversation.
I just wanted us to
get it all
touch
out.
those, points.
Thank you so
We
much.
have to touch those points. There's more. I am overlooking about 11 questions, but I think we kind of get where you're coming from, what is going on, and what I didn't learn, though, what were sacraments, those programs that must go forward no matter what, but we'll figure that out based on what we get back from you, May 1.
Thank you so much.
All right.
Enjoy the rest
Thank
of
you
your
very,
birthday.
very much. Thank you. I know you're tired. And thanks to your very faithful team that's been here supporting you through it all. L. Smith, are we okay? Keep going? All right. We're going to take 5 minutes to set up for the next group, which is the Department of Human Resources. All right, we are returning to our continuing our budget hearing. And we are now looking at the Department on Human Resources, and we have one public witness, Robert Brennan. If you'll come forward to the witness table, present your, and just take your time, sir. All right. And you can begin when you're ready.
Good evening, birthday girl.
Thank you.
It's been a long day.
It has, and you've been here with us most of the day, so thank you so much.
Madam Chair, I want to incorporate my previous testimony here, and hopefully that will speed up my testimony or my time. My major concern with the Department of Human Resources is not with the leadership of Mr. Hall. I appeared before committee to testify at his confirmation. My question or concern deals rather with a process that the agency used to conduct a employment or employee assessment before he arrived. And I participated in that, what I call a climate survey at the during the directorship of Mr. Christopher Rodriguez. And I was promised that I participated in with other employees of ACEMA. I was promised that it would be held in confidence, but that I would have I would receive a copy of the final of the report. Unfortunately, that did not occur. This was back in 2021. That did not occur. When I made an inquiry to find out when I would be receiving a copy of the report, I was told that it had been, the scope had been changed from an assessment to a confidential personnel matter. And my concern, and I raised it back, was that may be fine and well, but I was promised one thing. And I wanted to be sure that my comments or observations or concerns were accurately reflected in the report. And I don't know how that was presented in the report. And tried to get a copy and still have not gotten a copy. Just to verify what I said as to what was reported. Today, I passed along to Mr. Hall because I said I don't want to hit you blindly, but he said that he would look into the matter, see what the issue would, see what he didn't say that. I'm presuming that will be the response, that he will be looking into it to see if that is still the case. I don't want to put words in his mouth or make promises that he did, or say promises that he didn't make. But his response was very, was accommodating and to me and respectful, and I appreciate that. So I'm just here to request that the agency, at least if it cannot give me a copy of the report, at least let me know what, as far as my comments and statements, what it was reported and placed in the report so I can be sure that it was accurate.
All right, well, thank you very much for that, and we will be examining that issue with Mr. Hall. I think that our employees have rights too, and I want to make sure that they're treated fairly. So I will be checking on that.
Thank you. Happy
We're-
birthday.
Thank you, sir. Next, we will hear from the director, and we'll swear him and his team in as they move forward. Okay. And as he's coming forward, I just want to remind everyone that the DC Department of Human Resources provides resource management services that strengthen individual and organizational performance and enable the district government to attract, develop, and retain a well-qualified and diverse workforce. The department is organized into 6 administrations and all report to the Office of the Director. The divisions of note are Benefits and Retirement, Human Resources Services, which is concerned with recruiting and staffing and classification, the Learning and Development, where you would find the Capital Fellows and Special Projects, and then Policy Compliance, also the General Management, and Customer Service. Those are the divisions. Each division plays an important role in the functions of the agency and the overall district government workforce. The district government workforce is approximately 35,000 strong. And of the 35,000, approximately 25,000 are unionized employees. With all of these important functions that directly impact our human beings and our livelihoods, I look forward to learning about the work that the agency has done and plans to perform to improve the employment process. The mayor's proposed FY25 budget is $21.9 million, of which approximately 2.3% or 500,000 is a reduction from the FY24 approved budget of 22.5 million. However, with these reductions, the agency is only losing a 0.5 FTE, a half a person. So their total FTE is 157.7. In my world, that's 158 whole individuals. So given our budgetary constraints in FY25, I want to understand how the agency plans to continue its work to support the district government's workforce and recruitment of the best candidates to fill our government's vacancies, hopefully with DC residents. In fact, I want to insist that we fill our positions with DC residents more than 80% of the time. And I know that's a tall task, but we have to have goals if we are ever going to get our residents employed in this system. Additionally, I want to learn about processes that the agency has implemented or plans to implement to ensure that all current district government employees feel valued and respected. We just heard from Mr. Brennan about his concern where he contributed to a assessment and he a few years ago, and he's still waiting to get some result from that. And I think that there's a missed opportunity to treat him with fairness, as he is a retired employee, so he should have an opportunity to know that what was put in his personnel file. So with that, I am now going to thank you again for being here, and those who are still listening with us, we won't go long. Director Hall is a man of brief words, so we won't go long, but if he would raise his right hand so I can swear him in. Is any to affirm that any testimony and any statements that you make before us today to be truthful and complete?
I do.
Thank you very much. And you may begin.
Thank you. Good evening, Chairperson Bonds, members of the Committee on the Executive Administration and Labor, and committee staff. My name is Charles Hall, and I serve as the Director of the District of Columbia's Department of Human Resources, or DCHR. I want to thank you for this opportunity to testify on Mayor Bowser's proposed fiscal year 2025 budget and financial plan for DCHR. As a strategic human resources business advisor, DCHR enables the district to meet its governmental responsibilities by ensuring that we have a highly talented, diverse, engaged, and committed workforce that serves district residents. Our vision is simple: to be the best-in-class human capital organization that puts people first, promotes innovation, and serves as a model for others. The mayor's fiscal year 2025 proposed budget and financial plan, entitled A Fair Shot: Strategic Investments and Shared Sacrifices, allocates $21,939,998 to DCHR. This represents a 2.3% decrease from the fiscal year 2024 approved budget. This funding appropriately balances citywide priorities and ensures that we have a talented workforce to meet those priorities while being fiscally responsible. As DCHR looks forward to FY25, we also celebrate FY24 accomplishments to date. The past years have taught us the importance of resiliency, and we will continue to be resilient by adapting and evolving the way we do business as we face fiscal concerns in the upcoming year. In 2024, DCHR reinvented our processes by using technology to provide more accessible services to employees. DCHR collaborated with the Office of the Chief Technology Officer, or OCTO, to implement ticketing software to streamline employee requests related to benefits, retirement, 401A and 457B distributions, and customer care. Employees can submit a ticket via an electronic portal and track the status of their ticket to completion. Through the implementation of this software, DCHR can effectively monitor, track, and report on employee requests, ensure adherence to service level agreements, and better maintain online FAQs based on the evolving needs and feedback of employees. Since deploying this ticketing software in November 2023, DCHR has received and processed over 6,500 employee requests across service categories. In FY24 and FY25, DCHR will continue to expand services provided via the ticketing system to make our processes more efficient and our services easier to access. In addition to focusing on reinventing through technology, DCHR empowers employees by developing and enhancing their skills to adapt to the changing needs and expectations of residents. Thus far, in fiscal year 2024, DCHR has provided in-person instructor-led as well as virtual training opportunities for employees on topics including writing essential communications, emotional intelligence, quality customer care, as well as giving and receiving feedback. DCHR also collaborated with internal and district-wide partners to provide training opportunities for specific in-demand skills such as project management, grants management, and our human resources information system, PeopleSoft, and district budgeting. To ensure managers have the opportunity for peer networking and sharing of best practices, DCHR facilitated manager-specific courses such as Principles of Management, Building High-Performance Teams, Performance Management, as well as Mindfulness and Managing Stress. We also host a weekly manager peer coaching session, which provides managers with the opportunity to share challenges and gain encouragement and advice on addressing those challenges. This opportunity provides a safe space for managers to better understand themselves and their teams and create connections between managers across the district. In FY25, DCHR will continue and expand this work by providing additional opportunities for both managers and employees to enhance their soft and hard skills. DCHR is also enhancing communication and expanding partnerships to ensure the district government is an employer of choice, both locally and nationally. To that end, DCHR will continue proactively recruiting the best talent by collaborating with local high schools, colleges, and universities, forming and enhancing key partnerships with recruitment and nonprofit organizations, and increasing our social media and marketing presence. The way many job applicants learn about job opportunities continues to evolve. Not only do applicants want to understand clearly what they will do on the job, they also want to understand the culture of the organization and whether they will fit. To provide this information, DCHR will create a series of videos that highlight what it means to be a public servant within the district government. These videos will tell the story of specific public servants and provide a better glimpse of why they chose to serve the district and its residents. In addition to our quarterly hiring events, we will continue to expand partnerships with local colleges and universities, such as Howard University and the University of the District of Columbia, to engage students directly about district government opportunities. DCHR will also examine our ability to expand marketing through current partnerships with nonprofit organizations. This strategic, proactive approach supports agency needs and ensures that we have the right talent ready to serve our residents who deserve the best services. Although as a collective, we must make difficult fiscal decisions in 2025, the mayor's budget directly supports DCHR's vision to find and attract district residents to district jobs, develop their skills while they are district government employees to provide greater and better services, and create a world-class workplace that inspires people to serve as role models for their community. In closing, I take great honor in being a steward of the resources allocated to the DC Department of Human Resources. I thank Mayor Bowser for the opportunity to serve in this capacity, and I look forward to our continued work together to achieve our shared goals to serve our visitors and residents. This concludes my testimony. I want to wish you a very happy birthday, and I'm happy to answer any questions you might have.
Thank you very much for your testimony. And I am particularly interested in your testimony on page 3, where you mentioned the manager-specific courses, principles of management, building high-performance teams, performance management, mindfulness, and managing stress, and wondered if you have the number of DC employees that participated in these trainings and the date of these trainings.
No, ma'am, I do not have those with me now, but I can get that information. You want the number of employees and the dates?
Yes, please. Also, you mentioned that the agency will continue proactively recruiting the best talent by collaborating with local high schools, colleges, universities, and forming these partnerships with recruitment and nonprofit organizations, and the use of social media and marketing presence. And I wondered when we talk about the number of new hires that were made in FY23 and also to date in 24. I'd like to know how many were DC residents of the total pool that you were recruiting for or hiring at that time. And then I'm curious if there has been any conversations with these individuals that were hired as to how did they learn about DC jobs? What medium did they use to know that there were such jobs? That would be helpful to us as well.
Sure. So I can tell you that this fiscal year, 51% of our new hires are DC residents. So that's approximately, of the approximately 3,300 hires.
Okay, so 51% of 3,300? Or is it 3,300 that are DC?
There are, so 51% of the new hires are DC residents. I believe that averages out to approximately 3,000 persons. I will check that number for you.
Okay, so you're telling me that we have actually hired more than 6,000 probably,
Let me check that number, but I believe so.
or a little less than 6,000.
Yes.
Okay, all right. I would greatly appreciate knowing what that number is. And I think that would help the community to understand that we are hiring DC residents. But I really, the accurate number would be very, very helpful, as you well know.
Yes, so that is the accurate number.
All
So
right. And so I wondered if there were any discussions with these individuals as to how did they learn about the job? How did they discover we were recruiting for DC jobs?
yeah, that is something that we definitely can follow up with.
Okay.
Also, agencies, their HR departments may have conducted that kind of follow-up in doing 30, 60, 90-day reviews with these employees, but we can follow up.
Okay, that would be really great. I can see that helping us to understand what systems work well as far as getting the word out. Can you, looking at your table 2, explain the source of your special purpose revenue and the impact of the reductions? I think you have reductions in the special purpose funds. Not much, but just a little bit.
Sure, so I have Dr. Hurley here with me.
All
from
right.
The Chief Financial Officer's office.
Yes,
All
good,
right.
good evening.
Good evening.
Yeah, the special purpose revenue that's reflected on table 2 for FY25, approximately $8.7 million. The source of that is partly federal funds. The agency receives a reimbursement for expenses associated with its Police and Firemen Relief Board. So that's based on the expenses. It's about a little over $700,000 associated with that. In addition, if they service an agency like the Health Benefit Exchange, there's a.
I'm sorry, I can't hear you.
Okay, I was saying that in addition to those federal funds, there's also money that comes from agencies that are independent, like the Health Benefit Exchange. That's approximately $156,000. In addition to that, there's also an assessment that it impacts all agencies of the district government. That's an HR assessment, and that brings in the balance of the funds.
Okay, all right, great. All right, and looking at the reduction, again, looking at the table, this is time at table 4. You list in customer service, 14,000 reduction. And then line, I will, that's line, would be line 6. And then line 12 would be information technology services reduction, $353,000, and then line 14, legal services, $105,000, and line 30, executive administration, $3.035 million.
Okay, and let me start with a few of those. The information technology reduction is basically a contractual services reduction. The agency received a significant amount in FY24, and this is bringing it back down more in line with historic levels. That's why the reduction in contractual services. See that the staffing remains the same. Mentioned legal services, the
Yes.
reduction there is 1 FTE. That accounts for the reduction of 105,000.
And then the executive administration.
Yes, I must say that that's a bit misleading. The executive administration, in this table, there's an error in the column labeled FY24. The FY25 number, basically, if you look down where it says benefit operations for FY24, it has 0. That is an error. Basically, what that column did is add together benefit operations with the executive administration. That's the total. But if you add FY25, the two numbers, one for executive administration plus the number for benefit operations, it comes up to about the same, about $8.2 million. So there's really little change year over year.
All right, so what's the process for getting the numbers corrected?
We have our colleagues in the Office of Budget and Planning are working on a revision of the table. To my knowledge, that's the only error, that column FY24 in those two places I just mentioned, but they're working on a change or a revised table that will correct those errors.
Yeah, that's very important because I don't want my colleagues on the council to think that you can afford to lose $3 million. They may say, maybe we can zap a few more million out of that.
You're right. That would be misleading to do that. If you add the two numbers together, it comes up to about the same. So there's year over year, very little difference.
Yeah, thank you. Please get that corrected soon. And would you provide us with the updated budget sheet that would show the correction?
Yes, indeed. Be glad to do so.
When we look at the table 7, which in the budget chapter, what budget is paying for the employees, or whose budget is paying for the employees in the listed agencies, such as the Office of Finance and Resource Management, the Office of Contracting and Procurement? Just trying to understand who is paying and why are they paying? And this would be table 7.
Yes, in the two examples you just cited, DCHR is paying for the services from those two agencies. In other words, like Office of Contract Procurement, DCHR is paying for services from that entity, as well as OFRM, which is the agency I work for, as part of the OCFO organization. So DCHR is paying for those services.
All right. What is the total dollar amount in the MOUs where your agency is the buyer agency?
The two that you just mentioned,
Just the,
those two, plus there's also, I would have to look up the number also from fleet management associated is provided by rather DPW. That would be an additional agency that DCHR pays for.
And how many vehicles do you have?
We have one,
Just one?
just one,
All right. One vehicle.
just one.
So one vehicle in the total of the management unit. All right.
Yes, ma'am.
Thank you. Thank you. Can you discuss the medical examination and residency study that the government is funding from your list of contracts that you provided in? This is attachment Q9 in your pre-hearing.
It's a Q9.
Yes, question 9. Starts with absolute health and wellness. Goes on down to Neil Gross, True Screen, Urban Equity Consulting Group.
Got it. So these are medical services for the fitness for duty. Is it this what you're talking about?
I believe that's what the contracts were, yes.
So how did they work? Tell me how
Fitness
they
for
work.
duty. So if there is an employee who has been injured, or even if there's an employee who's exhibiting some behavior that may be concerning in the workplace, and we believe that it might be helpful to do a fitness for duty to see if that person is ready to either return to work in the case where they may have been injured, or they may have been sick and out for a long time. We can request a fitness for duty. In the case where there is behavior in the workplace where we believe a fitness for duty might be helpful, we can also do that. And basically what will happen is we would refer the employee to an external medical facility so that they would be able to be examined. And then we would get the results that would tell us whether or not that person is indeed fit to return for duty or if they need to be on a continued leave.
You have quite a few in this lineup. Vendors, the providers, and you indicate various contract types. What does requirements mean, and how is that different from indefinite delivery? I guess, I don't know what that other word is cut off. And then labor hour, I assume that means, what does that mean, sir?
Again, contract types, like you mentioned, there's different approaches, but the requirements is basically estimate of what the requirements are by the agency for the year. And so the contract is based on that number. In other words, the estimated quantity. The other ones that are indefinite basically are telling the vendor that there's no guarantee of a certain level. It's as needed. They do get typically some historic information to give an indication of how much might be involved. The hourly ones are based on hourly rates.
And if you added all of these up, they clearly exceed $3-4 million. Are all of these contracts necessary? Because we're paying, right?
Yes.
Okay.
In addition to what's shown there, other agencies may be contributing to the cost of the contract depending on the needs throughout the fiscal year. So their budget would be charged in those instances.
So you carry it on your finance sheet, but the other agencies would shell out the money in the event their employee needed the service?
For certain contracts, yes, not all of them, but certain ones, yes.
Okay, can you specify for me which are strictly that you would pay, you being the agency, separated out from those that the other agencies would pay?
Might be best if we give you that post-hearing.
Would you please?
So I
That-
don't miss
would,
one or.
I would really I need to get that information. Please by, I don't know if we can wait till May 1. If we could have it by next Monday, that would be very
Certainly.
helpful.
Certainly.
When I look at your, this is in question 12, your key performance indicators and target goals for FY 24 and 25, you indicate that great, your new hire turnover rate is down. That's wonderful. I suppose if everyone's doing what they should be doing, I hope you're happy. But then when I look at percent of employees that completed online training, you only have 30%. Why is that? Is that where you want to be at only 30%?
I don't think that it's necessarily where we want to be. A couple of things to consider. One, we still do offer in-person training. So it's not just limited to online. But we did see an increase in persons utilizing our online platform, of course, during the pandemic and afterwards. And it makes it a little bit more convenient for persons because they could do it, on their own time while they're home, or, if they have some free time at work, they might take advantage of a training online. But we have seen an increase in the number of persons who utilize online training. And we want to make sure there's a hybrid approach in place because some people might prefer or even need in-person training that would not fit into that online space.
So what is your understanding of the number of employees that DC government can expect that would return to the marketplace, to the office, at least 4 days a week? Are you thinking that's 50% or 40% or 70%? Do you have some algorithm that gives you a sense of what you might anticipate?
So of course, we'd need to make sure that we parse out those who aren't able, based on the type of work they do, to actually telework. For those who are under the mayor's authority and are able to telework, the expectation is that those persons would be in the office 4 days a week, and they can telework 1 day per week. There's also an option where it's operationally sound, where persons may work a 4-day, 10-hour work week, and then have 1 day off each week. But the expectation is that everyone who would be in a position where they are eligible to telework, they are to be in the office 4 days a week. And then 1 day per week, they have the option to telework.
Okay, so have you done any estimate as to what those numbers might look like? We talked about 35,000 being the workforce. So are we saying that 15,000 may decide that they can't do that or they don't wish to do that?
So it's still relatively early. As you know, we implemented the new policy in March, so it's still relatively early to capture a real picture. If the question is that, are we seeing a increase in persons leaving the district? One, I'd say it's still relatively early, but as you noted earlier, the attrition rate is lower than what we've seen in previous years. So we have not seen a lot of voluntary resignations.
All right. Well, yeah, and of course, that the trends that we see will affect the real estate that we need. And we have a lot of resources tied up in general services. So that's what I'm looking at. What are we really saying would be the cost of the district doing business as a government? And we have to take that into consideration as we think and move into the future, so.
Yes.
Are there any agencies in the government that, in DC government, that have more than 50% of their employees that are DC residents?
That is a question I'll have to follow up with you on. So agencies that have more than 50% of their
Yes,
employees.
yes, I would like those names, please. And I trust that I'm getting accuracy, so thank you.
I will say, just as a caveat to that, that it is going to be based on persons making sure that they update their address in the system. But we, to the extent that we can provide that
Yeah, you
information.
can go with what you have, and then, you know, there'll be some adjustments, I'm sure. But what you have, what you can report is all that I can request. In question 21, we did ask about to provide a list of all for-profit organizations that receive funds for programs that serve DC residents. And then, of course, we asked the starting date when they began receiving funds and the amount of funds they received in 22, 23, and of course, 24 to date. And then the amount that of funds that they spent in 22, 23, and 24. And what we got back was 22 involved 2 training vendors that received funding, Career Pathways Apprenticeship Program, to the Career Pathways Apprenticeship Program. The graduate school received 25,561,000, and CL Russell Group received $72,930,000. Both vendors provided related instruction for the Career Pathways apprentices. And what we were trying to discover is the fact we wanted to know if you would provide the funding to any for-profit organizations, because we don't have that information. You gave us the information for 22. I'm pretty sure by now you have information for 2023. If we could get that information, that would help us see what kind of trends we are engaged in.
Okay. I don't believe that there were any for FY23.
Okay,
I will confirm that for you.
all right. And are there currently any contractual arrangements for 24 that are currently underway?
Based on our submitted response, no, specifically related to district residents is what you're.
Yes,
Yes.
yes.
No, ma'am.
And I received your information. It says on Tuesday, March 5th, but I got it on Friday, so thank you very much. I finally received it. Of course, we haven't had the opportunity to look it over, so if we have any follow-up questions, we would like to be able to talk with you about it. But overall, where do you see training in the government moving forward into 25. Do you see that the agencies are, for instance, compliant with the mayor's new order as it relates to sexual harassment? Do we need language that is specific on general, the culture of in the office, working in the office? Again, just trying to understand what it is that we may need to do in order to make human resources operate smoothly for all of the employees, and particularly those that like to say, well, we're independent. What does that mean? You get a paycheck through the government. That's how I see it. So I'm trying to understand, what do we need to put in place, if anything, that would be a clearer understanding of the expectations as a district government professional?
Excellent question. So we've been having discussions internally as it relates to training. And we believe that it is vital. It is important to ensuring that our employees have a good experience, our managers have a great experience as well, that persons are able to build their capacity. And so one of the things that we've just started doing is making sure that just with the HR community, we are enhancing the way that we meet, which includes training on various topics, so that as they go back to their agencies, they're able to take the information that they've received and make sure that it's implemented in each agency. What this does is to make sure that there's a normed approach to the way that we're doing HR across the district, which means employees, managers, directors should receive the same level of service because we're norming the way that we're doing things. We see ourselves branching out to ensure that managers receive training as well. Culture occurs not just from the top down, but from everybody. Everybody plays a part in culture. So it can't just be about the manager, but it's also about the employees who work in the environment as well. And so making sure that we have culture and climate trainings available for them, whether you're an employee or a supervisor, understanding the part that you play in creating a good culture. Ultimately, we want people to see the workplace as a community, because that's what it is. And everybody plays a part. Everybody contributes. When everyone sort of holds up their portion, we start to see a healthy community, a healthy environment, and a healthy culture. So those are the things that we are considering. We know in a post-pandemic workplace, we need to sort of adjust people's minds as to what it means to be back in the workplace, to collaborate, coming out of isolation. What does it mean to team build in this sort of environment? And so those are things that we're concentrating on and will be focusing on. To your point about compliance with the mayor's order on sexual harassment and telework, we've created trainings for those. We're asking persons to complete them. Those types of trainings are mandatory, that everyone needs to complete the manager's portion of the sexual harassment training, the employee portion, as well as our telework policy trainings.
I guess I have just a few more thoughts about your important agency, and that is do you have plans? Do you have have you given consideration to looking closely at how we classify our employees and the criteria that is used in order to do that? Can you
Sort of expound upon what you mean by classify, so that I'm on the same
I
page.
think it's an area that I tried to speak on in the past. It is employees who have been in the system and who are getting very good evaluations but they feel landlocked. And feeling like they're not recognized, except through the evaluation process. And others, they feel that others, maybe newcomers, immediately get the recognition. They may have the same evaluation, but they have an opportunity to move on. And it seems that the longer you've been an employee in DC government, the less likelihood you will be able to move forward. So I'm wondering about that. What classification, holds people back?
Got it. So I think that what I would probably use a different word than classification, because it sounds like what you're talking about is promotional opportunities.
Correct.
And so for each instance, there's a different factor based on that individual. I know that someone might feel like they were passed over. One of the questions that I think we have to ask employees lends itself back to what you were just talking about as it relates to training. And so have you been attending trainings? What skills have you built up? What reskilling and upskilling have you done to ensure that you're better positioned for a promotion? Because one of the things that Dr. Hurley may have participated in trainings, and it has brought him to a level where now he's ready to actually occupy a different position. And I may have been there for 20 years, but just doing what I've been doing for 20 years and haven't participated in any kind of upskilling or reskilling at all. And I see Dr. Hurley get a promotion and I'm wondering why I didn't do it. One of the reasons why is because I didn't take advantage of building my capacity. And so I'm probably may get an interview. I may not have the experience though, that's going to be required for the new position. And that's a challenge. So one of the things we want to continue to push our employees to do is to take full advantage of those professional development and training opportunities. You can never learn too much. And so the better you're positioned to be the top qualified candidate for a position, the better chances are you're going to get it, regardless of how long you've been in the district. Because at the end of the day, as I think both of us believe, we want the best qualified candidate in the position.
Mr. Director, I want DC people in some of these positions. That's what I want. And I think it's a real shame that we don't seem to be focused on DC residents getting some of these positions. That really concerns me. And, I live in the community, have lived here much of my life, and except when I ran off to school. But the thing that gets me is hearing from individuals who started their career here decades ago, always get, great remarks from their supervisor, and salt of the earth. You can depend on them, but they feel that they are constantly overlooked. And so you're telling me that they have to prepare themselves. They have to take advantage of trainings, even when they don't know or hear about the trainings, but they're supposed to do that. That doesn't sit well with me. Okay. But I'm not in charge. I don't think it sits well with the public that is in charge. So I think you need to really look at that.
Yeah.
Truly.
So just for public knowledge and for your knowledge, you don't even have to hear necessarily about a training. The training opportunities are available for you to seek out. They're on a platform for you to take, as you talked about, online, and they're in-person opportunities that you can actually see when they're scheduled to take place. So you're not waiting for someone else. So I do think there's a personal accountability moment here for all of us. Yes, we're going to put it out there. Yes, we're going to advertise it. But yes, you have to take advantage of it as well. Because if I give you a car, give you a license, give you a key to the car, but you decide to take public transportation, you can't blame it on a transportation problem because you have access. You've just decided not to utilize it. And so we've got to make sure that there is a balance of utilization and access.
All right, I don't know when you can complete this request, but I'm going to send to you in writing a request that you define to us those individuals that have been promoted and who continue to get promoted, and what curricula or programming they participated in. I want to see those numbers.
Yeah.
Okay, I
we'll see
really
if we
want to
can
see those
provide
numbers.
those. We'll
Yeah,
definitely see that.
that would be very earth-shattering to see those numbers, to learn that that is how DC employees ultimately can look forward to a promotion, even when they have been given and are evaluated at the top of the class.
Yeah, and I also don't want us to forget the interview process, which we all know in an interview, you're interviewing against other people. And the person who interviews the best, as I'm sure you know, is the one typically you're going to give the job to. So part of your training is ensuring that you've also been beefing up your interview skills, because it's a competition. You are competing with others for a position, and you've got to make sure that you're increasing your interview skills. So all of those things play a part in the factor of who ultimately gets the position.
I see. All right. Well, thank you very much. And it's not yet 8 o'clock, and we appreciate your time and participation in today's budget hearings. I hope that you'll get back to me rather
Yes, ma'am.
quickly on a couple of things that we do need before we make decisions about your budget. I want to thank everyone who participated in today's budget oversight hearing for their contributions. I believe we have a better understanding of how our dollars are spent to ensure that we are providing the appropriate services to the district residents. And if the public has any additional thoughts or would like to submit written testimony regarding the performance of these agencies, please submit it through the council hearing management system at dccouncil.gov or email it to seal@dccouncil.gov, and that's CEAL. It will be included in the official hearing record. And the record will close on, I'm going to say on Wednesday, the 1st of May, 2024 at 5 p.m. The next hearing will be later this week on the 26th for the Public Employee Relations Board, the Office of Employee Appeals, the Office of Labor Relations and Collective Bargaining, and the Office of Campaign Finance, and the Board of Elections. With that, the time is 7:55 p.m. on Monday, April 22nd, 2024. And with that, the meeting is adjourned, and thank you for those who were so patient with us today. Thank you very much. Thank you.